Hello, hello, hello. Hello, 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 hello.
આવે છે શું જતું રહ્યું
Hello, 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 hello.
Mehsana, ये मैं ले लेती हूँ बोले तो ठीक है मैंने ऑफ किया
Good morning, ladies and gentlemen, distinguished guests, and esteemed colleagues. A very warm welcome to this prestigious nursing conference. We are honored to stand before you today as your anchors for this remarkable event. My name is Romi, and I am Fahmi. We are thrilled to be a part of this gathering that celebrates the incredible advancements and contributions made in the field of nursing. So let us embark on this incredible journey together, embracing the opportunities that lie ahead. May this conference be catalyst for growth, innovation, and collaboration as we strive to elevate the nursing profession to new heights. Dear students, I hope all of you have received your folders. I request all of you to take the pre-test form and kindly fill the pre-test form and do submit before the inauguration summary closes.
As we gather here,
today we honor a tradition that holds deep meaning in our culture. The lighting of lamp symbolizes the triumph of light over darkness and represents knowledge, wisdom, and enlightenment. It is fitting that we partake in this ceremony as we embark on a journey of intellectual exchange and inspiration throughout this conference. On behalf of the organizing committee and all the attendees, I invite our esteemed guests, Dr. Deepika Khaka, Dr. D.G. Chowdhury, Sri M.K. Chowdhury, Mr. Iqbal Kadiwala, Dr. B.K. Jain, and Dr. Rajesh Shah, and Professor Mrs. Divya Jiji to join us on the stage and take part in the lamp lighting ceremony. Your presence will be cherished and it will be undoubtedly make this occasion truly memorable. I request our volunteers to kindly guide this guest to the stage. I request Dr. C. Khaka also to come on the stage to light the lamp. I request our chief guests, all the guests of honors, to kindly come forward to light the lamp. Thank you, sir. Thank you, ma'am. Before we proceed further, let us take a moment to come together in a spirit of reverence and reflection. Okay. May I kindly request all the guests to stand and turn off your electronic devices and ensure a quiet and safe environment for this prayer. To lead us in a prayer, I would like to call the first year students of JMB Institute of Nursing who bring with them deep spiritual insight and wisdom.
इतनी शक्ति हमें दे न दाता, मन का विश्वास कमजोर होना। इतनी शक्ति हमें दे न दाता, मन का विश्वास कमजोर होना। हम चले नेक रास्ते पे हमसे भूल कर भी कोई भूल होना। इतनी शक्ति हमें दे न दाता, मन का विश्वास कमजोर होना। हम चले नेक रास्ते पे हमसे भूल कर भी कोई भूल होना। इतनी शक्ति हमें दे न दाता, मन का विश्वास कमजोर होना। दूर अज्ञान के हो अंधेरे, तू हमें ज्ञान की रोशनी दे। हर बुराई से बच के रहे हम, जितनी भी दे भली जिंदगी दे। बैर होना किसी का किसी से, भावना मन में बदले की होना। हम चले नेक रास्ते पे हमसे भूल कर भी कोई भूल होना। इतनी शक्ति हमें दे न दाता, मन का विश्वास कमजोर होना। हम न सोचे हमें क्या मिला है, हम ये सोचे कि यहाँ क्या है अर्पण। फूल खुशियों के बाटे सभी को, सबका जीवन ही बन जाए मधुबन। अपनी करुणा का जल तू बहा के, कर दे पावन हर एक मन का कोना। हम चले नेक रास्ते पे हमसे भूल कर भी कोई भूल होना। इतनी शक्ति हमें दे न दाता, मन का विश्वास कमजोर होना, मन का विश्वास कमजोर होना, मन का विश्वास कमजोर होना।
Thank you all for patiently listening for the prayer. To express a warm welcome to a distinguished guest, I invite Mrs. Madhu Chavda, Administrative Officer, JMD Institute of Nursing.
Thank you, ma'am, for giving me this opportunity. फूल खिलते हैं जब आप मुस्कुराते हैं, फूल खिलते हैं जब आप मुस्कुराते हैं, जहाँ जाते हैं चार चांद लगाते हैं। उस मंच की शोभा के क्या कहना, जहाँ पे आप जैसे अतिथि आते हैं। आई एम वेरी प्रिविलेज्ड टू इंट्रोड्यूस चीफ गेस्ट ऑफ टुडेज फंक्शन। वी हैव डॉक्टर दीपिका खखा, द नर्सिंग Advisor, Directorate General of Health Services, Ministry of Health and Family Welfare of India, Government of India as our chief guest. She pursued her BSc, MA in Psychology, Masters in Nursing from Delhi University. She completed her PhD and worked at AIIMS Delhi for 34 years in different capacities. She was awarded 2 international fellowships, that is, Fogarty Fellowship at New York University, USA in 2002 and Advanced EITRP Fellowship at University of California, Los Angeles, USA in 2007. She is also the recipient of 2 awards, Amazonian of America Award for Best Nurse for the year 1999 and Best Nurse Research Award for the year 2006. She was also awarded Best Poster Evidence Live 13s at Oxford University, UK in March 2013. She has been awarded TNAI Nursing Excellence Award in the academic category in 2021. Currently, she was awarded with National Health Icon WHO Diamond Jubilee Year Award in 2023. Please give a huge round of applause for our chief guest. Thank you so much, audience. Coming to her research profile, she has been dealing with 2 national and 5 international consultants. She is the member of editorial board of 5 international journals and reviewer for 18 national and international journals. She has dealt with 2 national and international research projects. She has been the research supervisor of 7 PhD, 1 MD and 52 MSc students. She has been an inspector for Indian Nursing Council and counseling supervisor for the District of Delhi of GFATM project, Delhi University. She is the district counseling supervisor for ICTC. She is the member of WHO Global Clinical Practice Network. She is the member of 5 doctoral research committee. She was in the expert panel of Clinton Foundation and Indian Nursing Council for HIV/AIDS Initiative for Nurses. Regarding her publications and conferences, she has 67 publications in Index Journal, 624 citations, 10 chapters and monographs. She has also written a book on essentials of mental health nursing. She contributed as an advisor to WHO for drafting of 3 months curriculum of TOT for nurses in HIV care at Bangkok, Thailand. She was the co-investigator, collaborate care of diabetes with depression with University of Washington. Also, she is holding memberships of 6 professional bodies. She was the Secretary of Nursing Research Society of India. She has been examiner for 9 universities. On behalf of the management, I thank you, ma'am, for providing your gracious presence to join us today to enhance our joy. Please give a huge round of applause for the achievements that ma'am has gained. I would like to request Dr. D.G. Chaudhary, the trustee of JMD Institute of Nursing College, to please welcome and felicitate our honorable chief guest. Thank you, ma'am. Thank you, sir. दिल मायूस सा था कोई उम्मीद जगती न थी, हथेली पर गुलाब खिला दे यूं हमारी हस्ती न थी। हम कैसे शुक्रिया आभार उपकार कहें आपका, अगर आप न आते तो यह शाम महकती न थी। I feel honored to introduce guest of honor of the conference, Mr. Iqbal Kadiwala, member of Indian Nursing Council. He is also the Vice President of Gujarat Nursing Council. He is the head nurse of Surat Civil Hospital. He was the advisor in SNA-TNAI in 2017. He received the prestigious award, National Florence Nightingale Award in the year 2010. Please give a huge round of applause for our guest of honor. I request Dr. B.K. Jain, the director of JMD Institute of Nursing College, to kindly welcome and felicitate our sir. I feel delighted to introduce Mr. M.K. Chaudhary, trustee of JMD Institute of Nursing. He is the former president of Akhil Anjana Kedwani Mandal. I request Professor Divya Jiji, principal of JMD Institute of Nursing College, to kindly welcome and felicitate our sir. थैंक यू सर, थैंक यू मैम। मंच रोशन हुआ, जगमगाहट मिली, हर्ष आनंद की खिलखिलाहट मिली। आपके आगमन से श्रीमान जी हर किसी को यहाँ मुस्कुराहट मिली। I feel privileged to introduce Dr. Rajesh Shah sir, working as a director of Research and Projects Department of JMD Science College. He holds the teaching experience of 38 years and research experience of 24 years. Regarding research experience, he is the recognized PhD guide of Gujarat University, MS University, and KSKV Kutch University. Under his guidance, 6 students have achieved PhD degree. His more than 50 research papers are published in national and international journals. He has presented research papers in 30 national international conferences. Regarding research projects and consultancy projects, Dr. R.D. Shah has carried out various research and consultancy projects for 20 years. The major geological organization, that is Space Application Center, ISRO, Gujarat Mineral Developmental Corporation, GMDC, GER Foundation, GIPCL, PRL, has constantly provided projects to Dr. R.D. Shah. He has worked as a principal investigator in GMDC-sponsored consultancy projects on hydrogeological studies of Tatkeshwar lignite mines, Amod lignite mines, and Umarsar lignite mines. He carried out detailed studies using remote sensing and GIS of Kalyanpur bauxite deposits, Jamnagar district of JMDC. I request Ms. Pratima Sapkota, Assistant Professor of JMD Institute of Nursing College, to please welcome and felicitate our sir. I know. I have one more announcement here. Ma'am, we have one memento for you on this auspicious event. I'm sorry that we forgot to give you that. I request the volunteers to please give memento to our chief guest. Thank you so much, ma'am. I'm profusely elated to introduce Dr. D.G. Chaudhary, Chief Patron of today's conference. Sir, you hardly education at MG Science Institute. He was awarded as role model in the world for Special Olympics Gujarat program by Dr. Timothy Shiver, the chairman and CEO of Special Olympics Washington, D.C., USA. Hence, he is also working as the chairman of Special Olympics Bharat Gujarat State, which is organized by international NGO. He has received several awards in the sports discipline. He has also written numerous articles and participated in various seminars in physical education, sports management, exercise, science, and yogic science. Most recently, he has been assigned as the president of Bone Homey Sports Event Management Private Limited and is organizing Pro Volleyball League Season 1 Ahmedabad Defenders from Gujarat. I request Ms. Akhila Wilson, Assistant Professor of JMD Institute of Nursing College, to please welcome and felicitate our sir. Thank you, sir. Thank you, ma'am. आप आए यहाँ शुक्रिया मेहरबान, क्या कहे आपको हम हुए बेजुबान। यह सभा हर्ष से हो गई तरबतर, नूर से भर गया ये सारा शमान। I feel honored to have with us the patron, Dr. B.K. Jain, the director of JMD Institute of Nursing College. He pursued his PhD in botany from Gujarat University in 1984 and completed masters in botany from GU in 1979. He has experience of 12 years as a lecturer and 25 years of principalship in Grant in Aid Science College. His more than 98 papers have published in reputed international journals. He supervised 25 students for PhD degree awards and completed 5 major research projects. He has been a reviewer and examiner for MSc, MPhil, PhD, member of Board of Study and member of selection committees. He worked as a coordinator, co-author, reviewer and translator of Gujarat State Secondary and Higher Secondary Textbook Board, Gandhinagar for Science and Technology and Biology books from 10th to 12th standard. He contributed as a leader of the Institute in accreditation ranking of the Institute, namely Srimati S.M. Panchal Science College, Talod and MG Science Institute, Ahmedabad. He was awarded Young Botanist Award by Indian Botanical Society at Patna in 1987. He was also appointed as a State Coordinator, Mission Mode Implementation, that is MMI 2013, by Commissioner of Higher Education, Gujarat Government. He was appointed as a Zonal Coordinator of Ahmedabad Zone for Mega Placement Fair 2019 and 2020 by Education Department, Gujarat Government. He was also appointed as a member of Juvenile Justice Board and Children Welfare Committee by Gujarat Government in 2016 for a term of 5 years. I request Ms. Bhumika Chadbar, Assistant Professor of JMD Institute of Nursing College, to please welcome and felicitate our sir. Thank you, sir. Thank you, ma'am. I feel privileged to introduce Chairperson of today's function, Professor Divya JJ, Principal of JMD Institute of Nursing College. She has done Masters in Psychiatry from Jamia Hamdard University, Rufaida College of Nursing, New Delhi. She has an outstanding experience of 12 years in hospital as well as educational sector. She pursued her PG Diploma in Clinical Research 2019. She is also a national and international editorial member of Journal of Psychiatry, Red Flower Publication, Trained Nurses Association India, Indian Society of Psychiatric Nurses. She has published various articles, and amongst it, one of her articles received the title of Best Paper Award at Indian Society of Psychiatry Nursing Conference. She is also a paper setter. She was also invited as a resource person, as a speaker, and chaired sessions in various conferences. She was the international speaker for the webinar session from UK on the topic COVID-19 Reflections from Around the World. Her 16 papers have been published in national and international journals. She is also the member of Industria Academia Advisory Board for the MBA program at Ganpat University. She is also the editorial member of American Journal of Psychiatry and Neuroscience. I request Ms. Bhumika Patel, Assistant Professor of JMD Institute of Nursing College, to please welcome and felicitate our ma'am.
Thank you, ma'am, for introducing our guest and welcome them warmly. I would like to introduce two more dignitaries on the stage. I invite Mr. Rajesh Shabara, Nursing Tutor, Government College of Nursing. Sir, we warmly welcome you to participate in this nursing conference. Thank you, sir. I would like to invite Dr. C. Khaka, who is the spouse of Ms. Dr. Deepika Khaka, ma'am, and who is the Medical Commissioner in ECIC Hospital, Bapunagar. Thank you, sir, for joining us.
Dr. Deepika Kakha, ma'am, we are honored to have you as our chief guest today. On behalf of the organizing committee and the entire nursing community gathered here, I cordially invite you to come forward and unfold the theme of our conference. Your profound insights and experience will undoubtedly enlighten us and set the tone for this transformative event. Please, ma'am.
I request all the dignitaries to join Dr. Deepika Kakha, ma'am, to unveil the theme. Thank you, ma'am. Thank you, sir. So, ma'am, we would like to arrange the stage a little bit so that all of you can see the PowerPoint presentations also. So, we would like to arrange the table and chair sort of this side. Thank you, dear dignitaries. Sorry for the interruption that we have made. As a principal of a prestigious Institute of Nursing, Professor Mrs. Divya Jiji has been a guiding force in shaping the future of nursing education. Her extensive knowledge and dedication and visionary leadership have played a pivotal role in the success of our college and the development of competent, compassionate nurses.
I would be honored if you would accept our invitation to deliver your address. Your insights and wisdom will inspire and motivate our audience comprising students, faculty and esteemed guests. Please, ma'am.
Hello. Namaste one and all. It gives me immense pleasure and joy to welcome our esteemed chief guest, Dr. Deepika Khakka, who exemplifies excellence and leadership. She has been a source of inspiration for countless individuals, demonstrating how perseverance and dedication can lead to remarkable success. She is a leading embodiment of the values we hold dear. And we are incredibly honored to have her here today. Our guest of honor, Mr. Iqbal Kadiwala sir, is no stranger to making a lasting impact on society. He has selflessly devoted his time and effort to numerous causes, leaving a positive mark on the lives of many. We are truly humbled that he has chosen to join us today and share his wisdom and experiences. To our trustees, Dr. D.G. Chaudhary, Shri M.K. Chaudhary, your guidance and unwavering support have been the pillars upon which this organization stands. We are equally privileged to have our respected director, Dr. B.K. Jain, with us today. Your strong leadership and vision has transformed our institution into a center of excellence, and also our well-wisher, Dr. Adi Shah, Dr. Rajesh, and Dr. C. Khaka, who have joined us today in this event. Additionally, we have esteemed speakers, Dr. Binu Jo, Mrs. Swapna Suhas, and Mrs. Rameshwari Jala, who has graciously accepted our invitation to enlighten us with their knowledge and expertise. Furthermore, a warm welcome to our moderators, Mr. Jayesh Jain, Mrs. Himali Prajapati, Ms. Selvina Mekwan, who will skillfully guide our discussions and ensure fruitful exchange of ideas. Your presence will undoubtedly steer this event towards success. I welcome all renowned principals, faculty members, and staff nurses and nurse educators who have accepted our invitation for discussion and mutual deliberation. It is an absolute honor to have all of you here representing various institutions and hospitals. Your presence here is a testament to your commitment to the pursuit of knowledge and the dedication to the growth and development of our students. A warm welcome to all the dear students from JMD and other colleges of nursing. We are happy to announce that we have around 15 college students among us to attend this conference. I stand here amidst the luminaries of nursing education as well as some eminent persons of nursing education to present the milestone of this nursing college and highlight its achievements. JMD Institute of Nursing was established by JMD Educational Trust in the year of 2018. It is affiliated to Gujarat University. We are having 3 courses, that is BSc, GNM, PBBSc. At JMD, we encourage co-curricular and extracurricular activities with a view towards developing holistic development of our students. We inspire teachers to attend various workshops and seminars, conferences, so as to improve their academic transaction skills and to update their capabilities. We have organized in our college 2 workshops, 2 panel discussions, research presentations, various in-service education, staff development programs, and now first state level conference. JMDians have nurtured 58 graduates from both PBBSc and BSc last year. With the firm commitment of JMDians towards developing the nursing colleges, there are plans already of expanding the courses and programs. While the immediate plan of the college is to consolidate the existing infrastructure and facilities and appointing of teaching posts. The long-term vision is that of opening MSc courses and various other certification courses to produce nursing personnel of high caliber to meet the demands of the modern health care services and nursing education. It is remarkable to express happiness that I, along with my college staffs, with the blessing of our dynamic chief patron and patron, are blessed with the opportunity to organize first state level conference on theme Quality Improvement through Nursing Process. Quality improvement seeks to standardize process and structure to reduce variations, achieve predictions, and improve outcomes for patients, healthcare system, and organizations. Moreover, using the nursing process encourages nurses to practice critical thinking, creativity, and problem solving, and also sharpens their decision-making abilities in clinical practice. As a result, the quality of nursing care increases, and so does the level of patient satisfaction. Hence, this process is used for improvement and is the framework utilized by the healthcare institutes for improvement in patient care. This conference will provide an excellent opportunity for delegates to share the platform with renowned nursing experts. The one-day event of academic extravaganza will enlighten the nursing students, faculties, nursing educators, and staff nurses about the requirement of continuous improvement in the nursing process, which in my mind is the need of this hour, and I'm sure this conference will emboss an ever-refreshing image and everlasting impression in the heart of everyone. At the end, I must congratulate all the students of this college who have endured the initial hardship of a new college, and in particular those who managed to perform outstanding and will be awarded prizes today. Thank you all.
Thank you, ma'am.
Today, we have the privilege of extending a very special invitation to a person whose dedication to nursing education has been exemplary. It is my honor to welcome the esteemed Director of JMD Institute of Nursing, Dr. B.K. Jain. I kindly request our patron of this conference, Dr. B.K. Jain, to join us on stage and share his valuable insights with us. Please, sir.
Respected Dr. Deepika Khaka, respected Shri Kadiwala ji, Shri Dr. D.J. Chaudhary, dignitaries on the dais, principal from the various colleges, faculty members, dear students. At the outset, on behalf of JMD Institute of Nursing, I welcome all of you in the one-day conference on the quality improvement through nursing processes. You know that after COVID, the demand of nursing professionals has increased tremendously. And to cope up that, Government is trying level best to increase the seat in the existing colleges and also opening the new colleges. You might have heard that this time in the cabinet they have sanctioned 157 government colleges to be started throughout the India. See, exact figure I don't know, but tentatively I will tell you. Near about 9,000 nursing colleges are there in India, imparting the nursing education to the 3.2 lakh students. Even though country is facing deficiency of nursing professionals, as per the WHO, on every 1,000 people there should be 3 nurses. And our country is having only 1.7. And conditions are still worst in the UP and Bihar, where on 1,000 hardly 1 nurse is there. Of course, Kerala, Andhra Pradesh, they are doing very well. So according to the recent report, if you will see, India needs 4,30,000 nurses by 2024. This is the scenario. Why I am telling you? Because you are having very bright future. After doing this much, we are getting the deficiency. The reason may be, many of the countries, they are open for the nurses. And there is a migration of the nurses for the better opportunities in the different parts of the world. And I tell you, India is the second country which trained the nurses and fulfilled the requirement of many countries of the world. First one is the Philippines. See, with the increasing the seats in the colleges for the nursing program, it has also become essential to improve and maintain the quality of nurses and health system. And this we can do through the nursing processes. See, dear friend, you know that nurse is an advocate. Nurse is an advocate between patient and health system. But nursing is a process. Nursing is a process through which we can develop, we can improve the quality. Actually, nursing process deals with identification of the problem, treating the problem, and improving the wellness of the human being. And today what you are going to get the information regarding. Today resource persons are there who will give the information on the quality improvement that is required to improve the quality of nurses, to quality of health services. So I hope that you will get a lot of informations on the quality improvement through the nursing processes in this conference. See, my request to all the senior members, today you have to grab the opportunity because the Madam Khaka is with us. You will not get this opportunity, very rare, but today you got the opportunity. You interact with her, you make the dialogues with her, and try to know what is the current scenario and what will be the future of nursing. I am thankful to Madam Khaka and Shri Kadiwala ji. They spare their valuable time and they become part of our conference. I am on behalf of JMD Institute, I am thankful to the principal Divya, all the staff members and students, volunteers who made their untired efforts to make this conference successful. I wish you all the best and bright future. Thank you very much.
Thank you so much, sir. As we gather here to explore the latest innovations and best practices in nursing, we are reminded of the crucial role that leaders like Shri M.K. Chaudhary sir plays in the fostering an environment that nurtures learning and growth. I would like to invite the former president of Akhil Anjana Kedavni Mandal and the senior trustee of JMD, Shri M.K. Chaudhary sir, to deliver his address. Please, sir.
I welcome all the guests on behalf of JMD. I know this is bright career opportunity profession of nursing, and we hope you will grab this opportunity and your priorities future. We wish success of this seminar. Thanks.
Thank you so much, sir. We are truly fortunate to have Mr. Iqbal Kadiwala, Vice President, Gujarat Nursing Council, as our guest of honor for today. He brings a unique perspective and wealth of knowledge that will undoubtedly enrich our understanding of nursing education. His insights and experiences will provide invaluable guidance as we cross through this conference. I would like to invite Mr. Iqbal Kadiwala to grace the stage and share your thoughts, wisdom and inspirations with us all. Please, sir.
आज के नेशनल कॉन्फ्रेंस में भारत सरकार के नर्सिंग एडवाइज़र आपने पूरा उनका बायोडेटा मैं पहली बार सुना मैडम। 67 पब्लिकेशन, कितने अवार्ड हैं, एक नर्सिस के लिए गर्व की बात है। स्टैंडिंग ओवेशन दी जाएगी खूब ताड़ियों के साथ। थैंक यू। मैंने मैडम को सूरत बुलाए थे नेशनल कॉन्फ्रेंस में। उस टाइम भारत सरकार के स्वास्थ्य मंत्री भी वहां पे मौजूद थे। मैडम कुछ बिजी शेड्यूल की वजह से नहीं आ पाए, मगर आज खुद मिलने का मुझे मौका मिला है। डॉक्टर सीसी खाखा सर वेस्ट जोन के मेडिकल कमिश्नर है। वो हस्बैंड वाइफ बिल्कुल शांत और सौम्य है, मगर उनकी जो ऊंचाई है मैं उनको वंदन करता हूं। डॉक्टर डीजी चौधरी सर, डॉक्टर बीके जैन सर, डॉक्टर बीनू जॉय सर, सपना जी है, रामेश्वरी झाला जी और प्रिंसिपल दिव्या जी, ताड़ियों उनके लिए हो जाए। प्रतिमा जी और अखिला विल्सन और हमारे यंग लीडर है दो यहाँ पे, मिस्टर हेमदीप पटेल, वो बीजेपी के युवा लीडर है भरूच से, और दूसरा हमारे SNX VP है भार्गव पटेल, फैकल्टी और डेलीगेट्स। બધા કારના અંગ્રેજી સાંભળીને થાકી ગયા એવું લાગે છે। आज के GNC ऑब्जर्वर डॉक्टर राजेश सबारा सर, अपना मोदी साहेब अमेरिका जाए तो बधा भूरियाओ हमें हिंदी में हाँ बोले ने सांभळे छे कि नहीं मने कहो है। बधी ज भाषाનું જ્ઞાન આપણને હોવું જોઈએ, પરંતુ ભૂરિયાઓને સાડી પણ પહેરાવો ને એને ગુજરાતી બોલતા પણ શીખવાડો, તો જ ચૌધરી સાહેબ ગુજરાતી તરીકેનો વટ પડવો જોઈએ। આજે ખૂબ ખુશી થાય છે કે આપણી વચ્ચે ડૉક્ટર દીપિકા ખાખા મેડમ એ ભારત સરકારના નર્સિંગ એડવાઇઝર છે। ખૂબ ઉચ્ચ સ્થાન ઉપર આપણું સર્વોચ્ચ નર્સિંગનું જે ઉચ્ચ સ્થાન છે એ તેઓ શોભાવી રહ્યા છે. ખૂબ શાંત છે, પરંતુ એમનું જે વિઝન છે, ગુજરાતમાં નર્સિંગ ડાયરેક્ટરની પોસ્ટ બધી ખાલી છે ને એમનું જે વિઝન છે સામેથી આવકારે છે. તાળીઓથી વધાવીએ. આ ખૂબ ઊંચો વિચાર છે સાહેબ. આવનાર દિવસોમાં આપણા જ ફેકલ્ટી એમએસસી પીએચડી થયેલા લોકોને ફાયદો થશે. એક નર્સ તરીકે આટલું મોટું સ્થાન, અને આજે આ કોન્ફરન્સમાં એમને જે ફોલ્ડ પર જે થીમ પર આખું એ પોતે એમનું નોલેજ આપણને પીરસશે, આ ગર્વની વાત છે. આ સંસ્થાના પ્રિન્સિપાલ મેડમને અભિનંદન આપું કે તમે સ્ટાર શોધી લાવ્યા છે. બીનુ જોય સર છે અને આ જે કંઈ બધા આજના સ્પીકર છે એ ખૂબ સારા છે. એટલે જ અમને આવવાનું મન થાય કે ગુજરાત નહીં પરંતુ દેશનું નર્સિંગ સેક્ટર એક અલગ દિશામાં જઈ રહ્યું છે. આજે ભારત દેશના નર્સિસને અમેરિકા કેનેડાવાળા માગે છે. કોવિડે તમને બધું શીખવાડ્યું છે અને દરેક બાળકો બહુ ડિસિપ્લિનથી બેઠા છે. હું ફેકલ્ટીને અભિનંદન આપું છું કે એક પણ બાળક છે કે શું નથી થતું. 15 કોલેજના વિદ્યાર્થીઓ છે. આ છે ગુજરાતનું नर्सिंग सेक्टर. અને અત્યારે દીકરીઓ, मैडम मैं थोड़ा गुजराती में इसलिए बोल रहा हूँ कि बच्चों को मजा आएगा, नहीं तो हिंदी में આપણે એ જ કરવાનું છે કે કોવિડ પછી કોવિડમાં ફેકલ્ટીએ પણ ખૂબ કામ કર્યું, સ્ટાફ નર્સે ખૂબ કામ કર્યું, પણ 200 કરોડની જે વેક્સિન આપીને એ કોઈ ડૉક્ટર આપવા નથી કે એ સ્ટાફ નર્સે જ આપી છે, જેનો આપણને ગર્વ છે. અને ડૉક્ટર તો કિટ પહેરીને થોડી વાર રાઉન્ડ લઈને જતા રહે, પરંતુ દર્દીનો જીવ બચાવવાનું કામ આ જ ફેકલ્ટીએ તૈયાર કરેલા બાળકોએ કર્યું છે. એમાં કોઈ શંકાને સ્થાન નથી. આપણે એ દિશામાં બધાને ઘણા ફર્સ્ટ યરમાં આવતા હોય કે કોલેજમાં જઈશું, પિક્ચર જોવાનું મળશે. અરે તમે સિટી મારતા પણ આવડવું જોઈએ. કેટલાને સિટી મારતા આવડે મને કહો? અમારા નાયક સાહેબ આ જ પ્રશ્ન કરે. એ તમને કદાચ તમે ડૂબી જાય ને સિટી મારીને તો તમને મદદ કરે. તમારા 4 વર્ષ તમને મજા પણ કરવાની છે અને અભ્યાસ પણ કરવાનો છે. છોકરાઓ હસે છે કે અમે કેસ સ્ટડીમાં એમાંથી ઊંચા આવીએ તો ને, પરંતુ તમારા 4 વર્ષ તમારા પરિશ્રમના છે. તમને આખા વર્લ્ડમાં તરતા મૂકશે ને तो पण તમે તરી જશો. હમણાં एम्सમાં मैडम इस बार एम्स में 15 लड़का और लड़की पास हुए हैं. पहले गुजरात का सीनियर ऐसा था 1 या 2 लोग पास आउट होते थे. पिछले 4-5 साल में करीबन 62 नर्सिस एम्स में पास हुए हैं. गुजरात के लिए गर्व की बात है. और जब आप एडवाइजर है तो गुजरात आपसे मांग सकते हैं, क्योंकि आप गुजरात की बहू है. सर यहाँ पे है, સાહેબ આપણા છે ને મેડિકલ કમિશનર છે વેસ્ટ ઝોનના, તો આપણે એમની પાસે માગીએ आप जितना भी ग्रांट कॉलेज के लिए, जितना भी नया आइडिया है गुजरात के लिए वेलकम है. आप कहीं भी मीटिंग रखना चाहते हैं मैडम, हम अरेंज करेंगे, आपको यहाँ बुलाएंगे. मैंने आपकी बोला कि आपको स्टैच्यू ऑफ यूनिटी, विश्व का सबसे ऊंची प्रतिमा, अपने लोखंडी पुरुष सरदार वल्लभ भाई पटेल की वहाँ आपको हम इनवाइट कर रहे हैं. थोड़े दिन में आपको वहाँ पे बुलाएंगे और पूरे गुजरात के जितने सीनियर लोग हैं उनके साथ आपकी मीटिंग करवाएंगे. ये मेरा वादा है. આવું વ્યક્તિત્વ હોય અને પછી આપણે માગવા જવાનું હોય બીજે સામેથી. આજે એમને કહ્યું મેડમ રામેશ્વરી ઝાલા મેડમ પણ આપણી વચ્ચે ઉપસ્થિત છે, આપણે એમને આવકારીએ. બાળકોને મારી એટલી જ વિનંતી છે કે આ કોન્ફરન્સમાં તમે જેટલા તજજ્ઞો છે એ તજજ્ઞોનું જ્ઞાન બિલકુલ શાંતિથી મેળવજો. અને હવે પછીની દરેક સ્પર્ધાત્મક પરીક્ષાઓ હોય છે. તમે એવું નથી કે પહેલાં મેરિટ પ્રમાણે, અને દરેક મેરિટ પ્રમાણે હોય છે. એ પરીક્ષાઓ તમારે ડગલે ને પગલે આપવાની થશે. હવે પ્રાઇવેટ સેક્ટરમાં પણ ઇન્ટરવ્યૂ થાય છે. તમે આખા વિશ્વમાં ધૂમ મચાવો. અત્યારે જેટલા છેલ્લા 5 વર્ષમાં જેટલા લોકો કેનેડા, લંડન અને અમેરિકા ગયા છે એ લોકો પોતપોતાની રીતે ત્યાં સેટ થયા. ટીએના હેડક્વાર્ટર પણ લંડન મોકલે છે અને ઘણા બાળકો આપણા ત્યાં ગયા છે. આ ખૂબ સારી સંસ્થા છે. જેએમડી ઇન્સ્ટિટ્યૂટ મેં તો જોઈ જ નથી, પરંતુ ખૂબ વેલ સેટ સંસ્થા છે. તમે નસીબદાર છો કે તમે મને કીધું ચૌધરી સાહેબે કે બધું જ મેરિટથી, અને આવી સંસ્થાઓ આપણે 10x10ની ખોલીની સંસ્થાઓ કરતાં આવી સંસ્થાઓને અમારું તમને સમર્થન છે સાહેબ. જ્યાં જરૂર પડે તમે અમને કહો. અને હવે પછી જે અમને કાયદો આવી રહ્યો છે, આઈએનસી ડિઝોલ્વ થાય છે, અને જે આપણું આખું બની રહ્યું છે સેટઅપ, મારી તો ઈચ્છા છે કે મેડમ તમને ચેરમેન बनावे 1-2 वर्ष માટે. आपको 2 साल के लिए चेयरमैन बनाए ने तो 10x10 की खोली का सवाल खत्म हो जाएगा. 10x10ની રૂમમાં બાળકને શું બનાવે, એના કરતાં સારી સંસ્થા હોય, સારું એટમોસ્ફિયર વાળું એનું કેમ્પસ હોય, એનું ગ્રાઉન્ડ હોય સારું, બાળકો બધી રીતે. અને આપણી દીકરા દીકરીઓ એડિશનલ કલેક્ટર, મામલેદાર, આઈપીએસ થઈ છે નર્સિંગમાંથી બીએસસી થયા પછી, જે આપણા માટે ખુશીની વાત છે. તમે બીએસસી નર્સિંગ કર્યા પછી આખા વર્લ્ડમાં ગમે ત્યાં તમે જીપીએસસીની એક્ઝામ આ તે તમે જુઓ, મેડમના એવોર્ડ જુઓ તમે. અમેરિકામાં પણ એવોર્ડ લીધા છે, WHO પણ એ છે. એવી રીતે આપણી છેલ્લે બેઠેલી દીકરી કે આગળ બેઠેલો દીકરો, આ જેએમડી ઇન્સ્ટિટ્યૂટનું નામ, જે જે સંસ્થામાંથી તમે આવ્યા છો એનું નામ રોશન કરો, અને ગુજરાતી તરીકે તમારો વટ પડવો જોઈએ સાહેબ. આ બીનુ જોઈ સર છે, ઘણા લોકો રાજસ્થાન, કર્ણાટકથી આવીને જે રીતે ગુજરાતને ઉજળું બનાવ્યું છે, આ લોકો જે સંસ્થા ચલાવે છે, જે એનું એસોસિએશન ચલાવે છે, એ એસોસિએશન થકી આખા દેશમાં આપણે ઉજળા બન્યા છે. દરેક વિદ્યાર્થી આજે ભલે છેલ્લી પાટલી પર હોય કે વચ્ચે બેઠેલું હોય, અને એમને કુતૂહલ થશું કે આ હું બધું ભાષણ છે, આ છે તે, પણ આવા गेस्ट अपनी वच्चे होय ये गुजरात माटे गर्वनी बात है. मैडम आपका स्वागत है गुजरात में. जब भी आप गुजरात आना चाहते हैं, जब भी अहमदाबाद आते हैं, कुछ ना कुछ आयोजन करो, कोई भी कॉन्फ्रेंस में आपको बुलाएंगे. अने एमा विनु जोई सर कुछ सौराष्ट्र में भी एक अरेंज कीजिए. मैंने काफ़ी बार टी दिलीप कुमार साहब को बुलाया है, उस टाइम में एसोसिएशन का प्रेसिडेंट था. परंतु तमे बधा जे फैकल्टी है ये गुजरातनो वटवाड़ो है, एना लीधे गुजरात नर्सिंग काउंसिल पण उजळुं छे. डॉक्टर प्रज्ञाबेन डाभीए आ कॉन्फरन्सने शुभेच्छाओ पाठवी है, અને કોન્ફરન્સ સક્સેસ જાય એના માટે હું શુભેચ્છાઓ પણ પાઠવું છું. ઈશ્વરને પ્રાર્થના સક્સેસ જ છે. આટલા સારા ગેસ્ટ સ્ટેજ ઉપર હોય. સવારા સાહેબ છે, આજે જીનેરા છે, જીનેરામાં બધા જ કોર્સીસ ચાલે છે. આમાંથી તમે એમએસસીમાં એડમિશન મળો, અને આપણો દીકરો દીકરી 5 વર્ષ પછી કે 7 વર્ષ પછી ને આ પીએચડી થયા પછી 10 વર્ષ પછી બધા ભૂરિયાઓ હાથે આંખમાં આંખ મિલાવીને એના અંગ્રેજીની ભૂલ શોધે. ભૂરિયાઓને અંગ્રેજી બોલતા સારું નહીં આવડે. દીપિકા કાકા મેડમ અમેરિકા હોય કે લંડન હોય, તાના ભૂરિયાઓની ભૂલ શોધશે, એની ગેરંટી આપું તમને હું. તો જ આ કરી શકે હવે આટલો મોટો બાયોડેટા. એવી રીતે તમે પણ દરેક જગ્યાએ તમારી પોતાની આગવી ઓળખ ઊભી કરો, અને આવનાર 10 વર્ષ પછી આપણી દીકરી સ્ટેજ પર હોય એવી શુભેચ્છા સાથે વિરમું છું. અમારું સન્માન કર્યું આ સંસ્થાએ, અમને તમે બોલાવ્યો તે બદલ તમારો આભાર. ભારત માતા કી જય, વંદે માતરમ.
Thank you so much, sir. Our chief guest today is a true luminary in the field of nursing with years of experience and outstanding contribution to patient care, research and education. Dr. Deepika Kakka ma'am has garnered widespread respect and admiration. She has played a pivotal role in shaping the nursing profession and continues to inspire countless individuals with her expertise and dedication.
So without any further ado, ladies and gentlemen, please join me in extending a warm welcome to our chief guest, Dr. Deepika Kakka, Nursing Advisor, Ministry of Health and Family Welfare, Government of India. I kindly invite ma'am to grace the stage with your inaugural address and share your thoughts regarding a theme by enlightening us with your profound wisdom and experience. Please, ma'am. Ma'am, with due respect, ma'am, with due respect, before you proceed with your address, I would like to request you to release a book, a pharmacology book, a textbook of pharmacology for BSc nursing students, written by Mr. Pritpal and published by Vision Books. I request Mr. Hiren from the Vision Book Publications to come on the stage and hand over the book to Dr. Deepika Kakka ma'am for the release. Thank you, ma'am, and thank you, sirs. Ma'am, now the stage is for yours.
Shri M.K. Chaudhary, Senior Trustee, Dr. D.G. Chaudhary, Trustee JMD, Dr. B.K. Jain, Director JMD, Mr. Shri Kadiwala, Vice President, Gujarat Nursing Council, Dr. R.D. Shah, Director Geeta Residency, and Professor Divya, Principal JMD, Dr. Khaka, my dear delegates, students, faculty, resource people, eminent nursing leaders, ladies and gentlemen. I bring greetings from Directorate General of Health Services, Ministry of Health and Family Welfare, Government of India. It is my great honor and pleasure to be amongst you all today at this very important and pertinent topic of your conference today, which is quality. We all know that quality is a part and parcel of our lives, and quality is a component which all of us would like to have. And as the conference theme is on the nursing process, quality according to the nursing process, and we all know, and nowadays we are talking about quality also giving holistic, patient-centered, compassionate, empathetic, culturally contextual care. And as very beautifully been deliberated by my speakers before me, that it is very important, especially during the time of COVID, it was an eye-opener for all the governments all across the world to understand the importance in investing in healthcare. And nurses played a very pivotal role in the delivery of healthcare services during the time of that pandemic. And the government is also very committed and invested and interested in investing in nursing. And as told earlier, you are all aware that the recent budget declaration, the government has announced 157 nursing colleges to be co-located with medical colleges in many aspirational districts so that everybody has access to good quality education. Now, I am very sure as students you are aware about the process of nursing process, that is assessment. You try to do proper assessment of your patient who comes to your healthcare facility, try to assess the patient's status, not only physical but mental, assess the patient holistically, and we know that whenever a person falls sick, not only the physical aspect of his life is affected, the mental aspect, the social aspect, the spiritual aspect is also affected. So we have to do a very keen observation, very competent and very thorough assessment of the patient. After the basis of the assessment, we do nursing diagnosis, and then we plan the care, implementation and evaluation. Now this all process has to be done with utmost sincerity, dedication and commitment. Because only if every step you do properly, the outcome is going to be better. And when we talk about quality, the reason why we talk about quality, it has many advantages. Like if the services you are rendering or the giving are of quality, the patient satisfaction is going to be higher. Patient safety incidents are going to be lower. That means patient will be well taken care of. There will be no incidence of any medication error, any falls, any kind of hospital acquired infections during the time the person is accessing a healthcare facility. Then nursing sensitive indicators also, like we have to focus, like any kind of untoward adverse events will be reduced if the services are given of quality, that is like pressure ulcers, injuries, any kind of errors will be reduced if the services are of quality. And another very important indicator of quality is to maintain the nurse-patient norms. If we maintain the nurse-patient norms, naturally the quality of care will improve tremendously, which will lead to if the nurse-patient norms are not maintained, that can lead to increased patient morbidity, mortality, longer hospital stays and adverse events. We have to also, to maintain quality, we have to also comply to the nursing standards and protocols like standard operating procedures, SOPs, etc. And it is important that wherever you are working, you should have SOPs and one has to adhere to those protocols of care. good quality of care leads to better patient outcomes in relation to patient morbidity and mortality is less. Readmission rates are reduced. Infection rates are reduced. This is functional improvement to evaluate the effectiveness of nursing interventions. Then another important component of quality care is that you very accurately document your records, whatever care you are giving, for communication, for continuity of care, and for legal reasons. So it is very important to document whatever you are doing to the patient very, very carefully. Good quality of care or services you give can also lead to better retention rate and turnovers. Like I was, before we came, we were discussing, and the trustees were telling me that the kind of environment here it's very student friendly. They have very good employee friendly policies. The leaders here, the faculty here is given independence to function without any interference from management. So these are proactive reasons why the quality of care improves. And as deliberated earlier, and the WHO data says that 1 in every 8 nurse does not work in the country of her origin. So this reflects the number of migration of the health force, especially nurses. Our Indian nurses are very much respected and appreciated world over. Now, why is this happening? Why are we appreciated for our services and for our work world over? Is by the quality of services we are giving. And how we are giving quality of services is because of the quality of education you are getting. So it is also important at this time when you are still students to have certain things like medical humanities, which talks about empathy, which talks about compassion, which talks about giving culturally relevant care to your patients, which talks about giving holistic care to the patient. Patient is just not a disease entity. Patient is a combination of a person who has physical, psychological, spiritual, social domains as well. So when we give care to our patients, we have to have that in the back of the mind, that any illness can cause a lot of influence on the other domains also, like psychological, social, and spiritual. Like before pre-COVID, if somebody had any cold or cough, we used to think na ye viral hai and nothing has to be done. But after COVID came, if anybody has cough and cold, we all get little scared na कि कहीं ये वो तो नहीं, कहीं कोविड तो नहीं है इसको. We have this fear ना, so we try to distance from this person thinking कि हमें तो नहीं लग जाएगा. So and even अगर आपको खुद को खांसी जुकाम हो जाता तो आपको लगता है ना कि फिर से तो नहीं आ गया वापस कोविड. You have that anxiety ना. So we have to always remember कि जब पेशेंट बीमार होता है तो खाली वो बीमार नहीं होता है, उसको साइकोलॉजिकली बहुत प्रेशर होता है, सोशली भी होता है, फाइनेंशियली भी होता है. So we have to treat that person in totality, and your kind words, your empathy, your compassion can make a lot of difference. And किसी भी hospital का या किसी भी healthcare facility का by having a grand building या बड़े बड़े gadgets से उसका reputation नहीं बनता है. उसका reputation बनता है by the quality of services which the people working there give. So I remember I take sometimes interviews, so we ask ना candidate को कहाँ से पढ़े हो, उससे हमें थोड़ा सा अंदाजा हो जाता है कि उसका quality. So your reputation, what gives you respect is the quality of work you give. And आपकी reputation आपसे आगे चलती है. So हम लोग बात करते हैं आजकल, we talk about nationalism, we talk about, so we किसी भी देश की सबसे precious धरोहर क्या होती है, उसके लोग. People in the country are the most invaluable asset. और हम उस invaluable asset के एक तरह से caretakers हैं. So it is our moral responsibility towards our contribution to nation building is कि जहाँ भी हम काम कर रहे हैं, we should give our 100% services with utmost dedication. Because human resource से या human life से ज़्यादा important कुछ नहीं है. Yes or no, you agree or you don't agree? You are very quiet. I hope you are getting what I am saying. So we have to remember this. Government of India is also very committed in giving quality services. So we have, Government of India has some programs like NQAS program, which is National Quality Assurance Standards, in which we assess our CHCs, our PHCs for seeing to it that the standards are maintained. Then we have quality certifications like NABH and many other initiatives in which we are assessing the quality of services which are given. We have Kaya Kalp awards for seeing to it that cleanliness, waste management and hygiene standards are maintained in the healthcare facilities. Then we have another initiative called Swachh Swasth Swastra initiative, जिसमें we are assessing the programs like PHCs. Then we have Quality to Urban Health, Labor Initiative for Excellence, Mera Hospital Patient Feedback, then also Standard Safety Guidelines, and Training and Capacity Building. And we also have one quality initiative called Lakshya, in which we are assessing the labor rooms and the care during labor. So these are some of the initiatives which the Government of India has taken to ensure कि जहाँ भी patient जा रहा है, जहाँ भी हमारा citizen जा रहा है, उसको अच्छे से अच्छी सेवाएं मिले. And I will also like to highlight that you students are the future of tomorrow. आपके हाथों में हमारी धरोहर of healthcare services. अभी अच्छा टाइम है, जो आपका 4 साल है या 3 साल है, जो भी आप क्रॉस कर रहे हो, जितना आप सीख सकते हो, हैव दैट डेडिकेशन, मोटिवेशन एंड कमिटमेंट कि जितना ज़्यादा आप सीख सकते हो, और ऑलवेज फील एज अ student, as a teacher, as a healthcare provider, what difference can I make in the system? All of us have the potential to make a difference. Like I started my journey from the base of the pyramid. I worked in the bedside. I have, for the last 35 years, I'm in the profession. I started my journey as a bedside nurse. And I worked for 13 years in the bedside at AIIMS Delhi. And then I became a counselor in the Department of Medicine. Thereafter, I was a faculty in the College of Nursing. इसलिए मैंने हर जगह, हर एक level पे काम किया है. I'm a person who has risen from the grassroots. And I'm telling you, अगर आप अच्छा क्वालिटी का काम करते हैं, आपको अब लोग बहुत ज़्यादा इज्जत से याद करेंगे. आपका काम ही आपकी पहचान है. अगर वो 100% अपना देंगे, आपको उसका वापस, एंड हम कर्मा में बिलीव करते हैं, तो वट एवर गोज अराउंड कम्स अराउंड. अगर आप अच्छी तरह सर्विसेज देंगे, आपको किसी ना किसी तरीके से भगवान विल ऑलवेज पे यू बैक. और ह्यूमन रिसोर्स से ज़्यादा और ह्यूमन लाइफ से ज़्यादा कुछ भी चीज़ उससे ज़्यादा बहुमूल्य नहीं है. तो हम लोग देश की धरोहर जो है, सबसे बहुमूल्य चीज़ जो है, उसके लोग उसको डील करते हैं. तो हमें उस तरह की कमिटमेंट और डेडिकेशन और मोटिवेशन और एक मॉरल रिस्पॉन्सिबिलिटी होनी चाहिए कि जो भी जहाँ भी हम प्लेस्ड हैं उसमें अपना 100% योगदान दें टू मेक आवर कंट्री a better place to live in. And we know that our government is very committed. We are getting a lot of international respect and recognition by the able leadership of our Honorable Prime Minister Shri Narendra Modi ji. And it is also our duty to join in his commitment to make a difference in our country. So thank you so much for your patient listening. And I wish you all the very best. और जो भी आज सीखेंगे आप लोग, उसका impact तभी होता है कि आप उसको अपनी practice में translate करें. तो जो भी आपके वरिष्ठ लोग आके आपको बताएंगे, आपकी renowned faculty, try to seep that in and try to reflect it into the practice. तभी हम बोलते हैं कि उसका impact हुआ. And I'm very sure you are doing a good job, but there's always scope of improvement. तो सबसे अच्छा competition क्या होता है कि आप अपने आप से compete करें and you become a better version of yourself every day. So I always believe that passion is very important for the cause. You have to be persuasive. सारे टाइम आपको करना पड़ेगा. You have to be patient and you have to have this feeling कि मैं अपना personal योगदान क्या दे सकती हूँ. I really like that quote of Mother Teresa which says कि our efforts can be like a drop in the ocean, but without that drop, ocean is one drop less. तो हम सबका कर्तव्य बनता है to make that change, and the change can start from us. हम जनरली किसी से बात करते हैं, लोग दूसरे चीज़ों को ब्लेम करते हैं, सिस्टम को, समाज को, सरकार को. आपको देखना है कि मैंने क्या करना है, व्हाट इज माय कंट्रीब्यूशन. दैट इज द इंपॉर्टेंट थिंग. और उसी से बदलाव आएगा कि द चेंज बिगिंस फ्रॉम मी. आई हैव टू टेक अ प्लेज दैट आई विल गिव क्वालिटी सर्विसेज वेरेवर आई एम पोस्टेड, इन विच एवर कैटेगरी आई एम पोस्टेड. आई विल मेक अ डिफरेंस. थैंक यू सो मच एंड जय हिंद.
Thank you so much, ma'am, for emphasizing on the health determinants and how important the nursing care quality for the better patient care. So as ma'am said, if our effort is not there, we cannot make a better patient outcome. So let us take this as an encouragement for all of us and kindly practice in our day-to-day lives. Thank you so much, ma'am, for joining us and giving us your inspiration speech.
Throughout the years, Dr. D.G. Chaudhary sir has demonstrated an unwavering commitment to promoting excellence in nursing education. His dedication to our institution has empowered countless nursing students and educators to pursue their passion and achieve greatness. I kindly request Dr. D.G. Chaudhary, trustee of JMD Institute of Nursing and our chief patron, to join us on stage and address our esteemed gathering.
Please, sir.
सभी को मेरा नमस्कार। आप लोग लेक्चर से शायद थक गए होंगे, लेकिन बीच में जो स्टैंडिंग आपने किया उससे थोड़ा सा रिलैक्सेशन मिल गया आपको। मैं आज के दिन आप सब लोगों को बहुत बधाई देता हूं। बधाई इस बात की है कि जिस चीज के लिए कड़ीवाला साहब ने जो बताया आपको, और उन्होंने जो बातें की कि आज हमारी यही वनडे कॉन्फ्रेंस में हमारे चीफ गेस्ट डॉक्टर दीपिका जी हैं और ये हमारा सौभाग्य है। तो मैं आज एज अ जेएमडी ट्रस्ट की ओर से अभिनंदन करता हूं मैडम, आपका वेलकमिंग भी करता हूं और आभार भी मानता हूं। आप इधर पधारे, आपने जो टाइम दिया है और हमारे इन स्टूडेंट्स को, नॉट फॉर जेएमडी, 15 कॉलेज के स्टूडेंट्स को आप जो गाइड करेंगे और पूरा दिन जो आज आप लोग ज्ञान अचीव करेंगे, उसके लिए मैं आपका आभारी हूं। और आपको बहुत अच्छी तरह गुजराती में एकदम सिंपल लैंग्वेज में कड़ीवाला साहब ने जो बताया मुझे बहुत पसंद है, क्योंकि अपनी जो लैंग्वेज है, अपनी जो भाषा है और जिन भाषा में हमारा प्रभुत्व है, उसी लैंग्वेज में आपको बोलना चाहिए। क्योंकि चाइनीज और जापानीज इंग्लिश नहीं बोलते हैं, लेकिन उनकी लैंग्वेज से ही अमेरिकन लोगों के साथ बात करते हैं। यानी आपको ये डर नहीं होना चाहिए कि भाई मुझे ये लैंग्वेज नहीं आती है। तो कड़ीवाला साहब ने जो आपको बताया और जो बात की, मैंने बहुत नाम सुना था कि गुजरात नर्सिंग कॉलेज में वाइस प्रेसिडेंट हैं, सूरत से हैं, कड़ीवाला साहब हैं। काफी 4 साल से नाम सुन रहा था, लेकिन आज मुझे बहुत खुशी हुई आपसे मिलके सर, और पहली दफा मिला हूं मैं आज। हमारे साथ एक कॉन्फ्रेंस में और भी तज्ञ हैं जो गुजरात नर्सिंग कॉलेज की ओर से भेजे गए हैं ऑब्जर्वर। हमारे जो इन कॉन्फ्रेंस के तज्ञ हैं, साथ में हमारी जो कॉलेज हैं उनके डायरेक्टर डॉक्टर बीके जैन सर हैं, हमारे प्रिंसिपल दिव्या जी हैं, और साथ में उनके साथ में जो उनके कन्वीनर हैं, स्टाफ, वॉलंटियर्स, स्टूडेंट्स, सभी लोगों ने, आप लोगों ने जो एफर्ट डाले हैं, तभी जाके आज मेरे हाथ में माइक है, वरना मैं इस स्टेज पे आज नहीं होता। आप लोगों के प्रयास से, आप लोगों की मेहनत से आज जो ये वनडे कॉन्फ्रेंस है, उसमें सब लोगों को आप लोगों ने इनवाइट किया है। हम तो कुछ नहीं है, हम आपके सामने आके खड़े रहे हैं, लेकिन आपकी वजह से हम हैं। लेकिन मैं आपको ये कहना चाहता हूं, आज सब लोग आफ्टर कॉन्फ्रेंस जो है वो यही बोलते हैं कि आज का दिन बहुत अच्छा रहा, ये अच्छा था, वो अच्छा था, ये था। लेकिन मैं आपको एक रिक्वेस्ट करता हूं कि हमारी कम से कम 20 बुराइयां निकाल के लिख के जाइए आप लोग। कम से कम 20 बुराइयां निकाले और लिख के जाइए, ताकि हम नेक्स्ट कोई प्रोग्राम करें उसी प्रोग्राम में वापिस हम वो गलतियां ना करें और हमारी गलतियां हम सुधार सके। तो मेरा ये रिक्वेस्ट है आप लोगों को कि जो लोग काम करते हैं ऑलवेज गलतियां करते हैं और वो गलतियां वापिस सुधारी जाती हैं। आज नर्सिंग जो है और नर्सिंग के बारे में जो कड़ीवाला साहब ने बताया आपको, वो बहुत अच्छी बात मैंने सुनी है, क्योंकि मेरा प्रोफेशन तो स्पोर्ट्स है और स्पोर्ट्स में आप बोलेंगे तो मैं 4 घंटा बोल सकता हूं, लेकिन नर्सिंग के बारे में बहुत इतना मुझे पता नहीं है। हमने नर्सिंग कॉलेज स्टार्ट कर दिया और वो भी हमने किसी से इंस्पायर किया कि आप करिए नर्सिंग कॉलेज, जरूरत है नर्सिंग कॉलेज की गुजरात में, आप क्यों नहीं करते हो, आप करिए। तो हमने नर्सिंग कॉलेज स्टार्ट कर दिया और हमें सबसे बड़ी खुशी ये है कि हमारे प्रिंसिपल जो है दिव्या जी बहुत अच्छे मिले हैं और बहुत हार्ड वर्क करते हैं, और उनके साथ उनका स्टाफ जो सपोर्ट कर रहा है, स्टाफ में जो वो बोलते हैं वही स्टाफ उनको सपोर्ट करता है। तो स्टाफ की वजह से आज ये कॉन्फ्रेंस हो रहा है। और साथ में हमारे जितने भी स्टूडेंट्स हैं, वॉलंटियर्स हैं, वो सब लोगों ने जो अच्छा काम किया उनका सबका मैं आभारी हूं और आभार व्यक्त करता हूं कि आप लोगों की वजह से आज ये प्रोग्राम सक्सेस होगा इसलिए बोल रहा हूं कि हमने पूरा नहीं किया है। हमारे साथ जो बाकी कॉलेज से जो प्रिंसिपल्स इधर हैं, उन सब लोगों का मैं वेलकमिंग करता भी हूं और धन्यवाद भी करता हूं कि आप लोग पधारे हैं इधर। जेएमडी इंस्टीट्यूट ऑफ नर्सिंग की कॉलेज की जो हमारे ट्रस्टी है मणि भाई, बहुत शांत है, बहुत कम बोलते हैं, लेकिन उनका ऑब्जर्वेशन बहुत अच्छा है और वो हर बार हमको गाइड करते रहते हैं कि हमें ये करना चाहिए, ये करना चाहिए, वो करो आप। क्योंकि ऑलरेडी जो एक संस्था चौधरी समाज की है सेक्टर 7 में, वो संस्था के चौधरी समाज की संस्था के और चौधरी समाज के प्रमुख रहे हैं और उनका जो ज्ञान है वही ज्ञान से हम आगे बढ़ते हैं। तो मैं आज मणि भाई का भी बहुत आभार मानता हूं इधर, और साथ में मेरे कलीग डॉक्टर आर.डी. शाह बहुत बड़े साइंटिस्ट हैं, वो उनका जो है आईआईटी बॉम्बे से पास आउट किए हैं। साथ में स्पेस, इसरो, डिजास्टर मैनेजमेंट, सभी में उन्होंने बहुत ही अच्छा काम किया इंडिया लेवल पे। ऐसे हमारे सारे मेहमान हैं। गवर्नमेंट ऑफ गुजरात नर्सिंग की ओर से डॉक्टर राजेश जी है। सभी लोगों को जो इनवाइट किया है, दिव्या जी आपने चुना है सब लोगों को, हमको तो पता भी नहीं था कि आप इतने अच्छे गेस्ट को चुना है। तो दिव्या जी का भी आभार व्यक्त करता हूं कि हमको ऐसे बहुत अच्छे गेस्ट मिले आज। दिव्या जी आप और आगे बढ़िए, जेएमडी इंस्टीट्यूट आपके साथ हैं, ट्रस्टी सब लोग आपके साथ हैं। थैंक यू वेरी मच।
Thank you so much, sir, for encouraging us. I hope all of you have filled your Praetor's form. Kindly write your name, the full name, on the top right corner of your Praetor's form, and I request all the volunteers to collect the Praetor's form back. I request all the delegates who are seated here to maintain silence and pass on the praetors form to the volunteers. So as we come to the end of this inspiring inauguration ceremony, let's take a moment to reflect on the remarkable moments we have experienced today. We witnessed passionate speeches and the coming together of brilliant minds in the field of nursing.
I would like to extend my heartfelt gratitude to our esteemed guests, dedicated organizers, and all the participants who have played a pivotal role in making this conference inauguration resounding success.
Nursing is not merely a profession, it's a noble calling that requires compassion, dedication, and unwavering commitment. Each one of you holds the power to make a difference in the lives of countless individuals.
Let the spirit of this conference ignite a fire within you, fueling your determination to provide exceptional care, advocate for patients, and lead positive changes in the healthcare landscape. Remember, together we can achieve remarkable things.
As we conclude our inauguration ceremony, I encourage each and every one of you to actively engage in the upcoming conference sessions. Make the most of this platform to share your experience, expertise, learn from others, and forge valuable connections.
Thank you once again everyone who joined us today. I wish you all a fruitful, enlightening and rewarding conference. Let's continue to learn, grow and shape the future of nursing together. Thank you and enjoy the rest of the conference. We kindly request our distinguished guests to kindly make their way off the stage and take the seats arranged in the front.
I would like to invite the volunteers to kindly guide the guests to sit on off the dais. Thank you, sir. Now we have a few sponsor sessions. I would like to introduce the Delta inventories so that they will explain regarding their activities and the products that they having. thank you Delta Inventories for introducing your products with us. I hope all these products will be very helpful for the students for the practical skill upgradation, and thank you so much Delta Inventories.
Okay, now I would like to introduce our sponsor, Mr. Puspendra from Shivangi Nursing Academy, to share the details about their academy.
Hello, good morning to everyone. Warm welcome to everyone. Myself Puspendra Kardam, डायरेक्टर ऑफ शिवांगी नर्सिंग एकेडमी गांधीनगर गुजरात। तो आज आपके सामने हम एक छोटा सा कैरियर ओरिएंटेशन रखने जा रहे हैं रिगार्डिंग हमारी नर्सिंग के। ठीक है मैडम, हमारा इंस्टीट्यूट है शिवांगी नर्सिंग एकेडमी, वो आपके नर्सिंग फील्ड में डिफरेंट गवर्नमेंट एग्जाम के लिए प्रिपरेशन कराता है। लाइक आपके सेंट्रल गवर्नमेंट में अगर मैं आप बात करूं, आपका एम्स हुआ, पीजीआई चंडीगढ़ हुआ, ईएसआईसी, लाइक आपके स्टेट गवर्नमेंट एएमसी, वीएमसी, जीएमईआरएस, आईकेडीआरसी, और अदर में बात करूं तो आपका लाइक आउट ऑफ कंट्री आप जाना चाहते हैं तो उसके लिए एनक्लेस के लिए हम प्रिपरेशन कराते हैं। ये मोस्ट ऑफ हमारी फैकल्टी रहेगी। हमारी फैकल्टी में सबसे मेन है शिवराज सर, जो हमारे मेन फाउंडर हैं। ये आपको एमएसएन पढ़ाते हैं। ठीक है, ये ओवरऑल और हमारी फैकल्टी है जिनसे आपको पढ़ने को मिलेगा। ठीक है, ये माई सेल्फ पुष्पेंद्र नेक्स्ट मैडम। ठीक है, अभी हमारा ऑफलाइन ऑनलाइन दोनों प्लेटफॉर्म अवेलेबल है। ऑफलाइन प्लेटफॉर्म की फीस हमारी 24,000 हमारी फीस रहेगी और ऑनलाइन प्लेटफॉर्म की हमारी फीस 99,000 रहेगी। 10,000 हमारी फीस रहेगी। मैं आपको एक गुड न्यूज़ दे रहा हूँ, आज एक अनाउंसमेंट करने जा रहा हूँ। जो भी रनिंग स्टूडेंट हैं, बीएससी सेकंड ईयर, बीएससी थर्ड ईयर या फोर्थ ईयर, जीएनएम थर्ड ईयर सेकंड ईयर, उनके लिए स्पेशल अनाउंसमेंट है कि उनको 3 साल की एक्स्ट्रा वैलिडिटी मिलेगी। ये स्पेशल अनाउंसमेंट है। और एक यहाँ मुझे बहुत अच्छा लगा, यहाँ आकर बहुत सपोर्ट किया दिव्या मैम ने, पूरी जेएमडी फैमिली ने, उनके लिए बहुत धन्यवाद। इसी को देखते हुए मैं आपको एक और बहुत अच्छे अनाउंसमेंट करने जा रहा हूँ नर्सिंग फील्ड के अंदर, कि जो बच्चे फाइनेंशियल कंडीशन जिनकी ठीक नहीं है, जो बच्चे नर्सिंग करके भी मतलब स्कॉलरशिप बेस पे उन्होंने नर्सिंग किया है, जिनकी फाइनेंस कंडीशन ठीक नहीं है, उन सभी बच्चों के लिए स्पेशल अनाउंसमेंट है। उनको नाम मात्र फीस के साथ हम पूरे कॉम्पिटिटिव एग्जाम के लिए तैयारी कराएंगे और उनके सपनों को उड़ान देंगे। नेक्स्ट, ये हमारे एसएनए स्टार हैं, डिफरेंट एग्जाम में सेलेक्टेड हैं, आप देख सकते हैं। नेक्स्ट मैडम, अभी हाल ही में एक एग्जाम हुआ था 3 जून को, नॉर्सेट एम्स। एक नॉर्सेट एग्जाम है जो कि दिल्ली एम्स कंडक्ट कराता है। वूल ओवर जितने भी आपके 29 एम्स रनिंग है एट प्रेजेंट, उन सबका एक एग्जाम होता है नॉर्सेट एम्स। तो अभी हाल ही में 3 जून को उसका एग्जाम हुआ था, उसका रिजल्ट अभी 3 दिन पहले ही आया है। तो आप देख सकते हैं मैनी डिफरेंट सेलेक्टेड शिवांगी नर्सिंग एकेडमी से लगातार सिलेक्शन देती रही है। 7th रैंक, 19 रैंक, 20 रैंक, 27, 34, आगे मैडम ऐसे काफी सारे सिलेक्शन है। लिस्ट काफी बड़ी है। तो मैडम नेक्स्ट, लिस्ट काफी बड़ी है और तो आपको बयान नहीं कर सकते, शायद इस पीपीटी पे भी नहीं आ सकती। तो नेक्स्ट मैडम, एक्सजीपीजे, ये हमारे गुजरात से ऑफलाइन ब्रांच से आप ही के से 14 रैंक है प्रिया, 14 रैंक आपके गुजरात ब्रांच से ऑफलाइन ब्रांच से हैं। ये मिलोनी वासवा है, 69 रैंक है इनकी, ये भी ऑफलाइन से हैं। ये दारजी मेघना है, गीता सोलंकी। तो मेरा ये डिफरेंट एग्जाम से मैनी रैंक है। ठीक है, तो ये एसएन स्टार एसजीपीजीआई का हाल ही में एक एग्जाम हुआ था एसजीपीजीआई। ठीक है, उस एसजीपीजीआई में 1900 सीटें थी। 19 कितनी सीटें थी? 1900 सीटें थी। उसमें से 45 है ना, 45 यानी मैं बोलूँ 450 सीटें, 450 सेलेक्टेड कैंडिडेट एसएनए से थे। और अभी हाल ही में नॉर्सेट का जो अभी मैंने आपको रिजल्ट दिखाया है, अभी हाल ही में मैंने जो आपको नॉर्सेट का रिजल्ट दिखाया है, उस नॉर्सेट के अंदर 3055 पोस्टें थी, जिसमें से अभी क्वालिफाई जो बच्चे जो क्वालिफाई हुए हैं, जो कैंडिडेट हैं, वो 2667 बच्चे हैं, जिनमें से ओनली फॉर हमारी ब्रांच से, हमारी एकेडमी से, शिवांगी नर्सिंग एकेडमी से 500 स्टूडेंट यानी 500 स्टूडेंट आपके सेलेक्टेड हुए हैं और अभी भी लिस्ट जारी है क्योंकि बच्चे भी धीरे धीरे भेज रहे हैं। ठीक है, नेक्स्ट ये आपका भी एक लोकल एग्जाम हुआ था 2022 में 13 मार्च को पीएससी के अंदर। वहां पे भी हमारे 10th रैंक थी हमारे रवल धवल जी की, 20 रैंक आपके नौशद जी की, 37 रैंक अमीन मार्गे की। यानी इसमें भी आपके लोकल स्टेट एग्जाम के अंदर भी हमारे टॉपर्स रहे हैं। ठीक है, ये आपके गुजरात से हैं, एम्स सेलेक्टेड लास्ट 2020 के अंदर जो एम्स हुआ था उसमें सेलेक्टेड हमारे सितारे हैं। ठीक है, ओके, ये आप हमसे कांटेक्ट कर सकते हैं, हम हमारी 8302923295 पर आप कांटेक्ट कर सकते हैं। ये हमारा एड्रेस रहेगा, ऑफिस नंबर 333 राधे स्क्वायर पे आपका कुड़ासन गांधीनगर में हमारा ऑफिस है, विजिट कर सकते हैं। और 29 जुलाई को हमारा बैच स्टार्ट हो रहा है, तो आप सभी से निम्न निवेदन है कि आप आके विजिट करें। ठीक है, तो 2 मिनट में और आपका लूँगा। डियर स्टूडेंट, अगर आपको लाइफ में कुछ करना है ना तो सपना हमेशा बड़ा देखिएगा। आप हमेशा सपना हमेशा बड़ा देखिएगा। जितने बड़े सपने आपका होगा उतनी ही बड़ी मेहनत होगी और उतनी ही बड़ी आपकी कामयाबी होगी। डियर स्टूडेंट, अगर आप मेहनत कर रहे हैं और आप बार बार आपको फेलियर हो रहा है तो आप निराश मत होइएगा। ज्वाइन करिए शिवांगी नर्सिंग एकेडमी, आपके सपनों को 100% उड़ान दी जाएगी। अगर आप बार बार फेल हो रहे हैं तो बैकअप नहीं लीजिएगा। डियर स्टूडेंट, आपने मकान देखा है, आप सबने मकान देखा है। मकान बनने में मुश्किल से 4 से 5 मंथ लगते हैं, मगर महल जो होता है, आप सोचा महल बनने में टाइम लगता है। तो आप अगर फेल हो रहे हैं तो हार नहीं मानिएगा, क्योंकि आपके सपनों को महल बन रहा है। टाइम जरूर लगेगा सर, बट सक्सेस 100% श्योर आपको मिलेगी। तो इसी के साथ और भी कई सक्सेस, बोलूं मैडम 2 मिनट और लो, ठीक है, तो 2 मिनट और। तो आप हमेशा देखो, आप भी सोच रहे हैं आपकी तरह ही मैं हूँ। ठीक है, इसी इंस्टीट्यूट शिवांगी नर्सिंग एकेडमी के अंदर मैं ओनली आज से 1 साल पहले 12,000 में वर्क कर रहा था और आज ही आपके सामने रिप्रेजेंट हूँ एक अच्छी पोस्ट पर। तो इसका मतलब क्या है, अपना नर्सिंग प्रोफेशन इतना होनेस्ट है और इतना स्कोप है कि कहीं भी नहीं है, और वर्ल्ड के अंदर सबसे नंबर 1 पर आता है अपना नर्सिंग प्रोफेशन होनेस्टी के मामले। तो मैं यही कहूँगा, अपने काम से प्यार करें, अपने प्रोफेशन से प्यार करें कि आप इतना देगा भगवान, इतना देगा कि आप सोच भी नहीं सकते। ठीक है, इसी के साथ मैं आपको धन्यवाद करता हूँ जेएमडी फैमिली को, दिव्या मैडम को, ऑल ओवर जेएमडी ट्रस्ट को जिन्होंने मेरे को इतना कीमती समय दिया, और धन्यवाद आप सभी स्टूडेंट को जिन्होंने मुझे अपना कीमती टाइम दिया, उसके लिए थैंक यू सो मच।
Thank you for introducing your nursing academy and giving such offers for all the students. Thank you, Shivangi Nursing Academy.
Dear student body, we are going to start our sessions. I request all of you to maintain silence and listen properly for the sessions ahead. And if anyone wanted to use the restroom, please to maintain discipline and go one by one. Otherwise, it will be very difficult. So please to maintain silence and listen properly. Thank you. So students, how are you all? I'm unable to hear. Do you all had your breakfast? Yes? So are you losing your energy? Yes? So what should we give to boost up your energy? Do you want to get up and dance? Huh? No? Okay, we have 3 sessions ahead. I think most probably we'll finish with 2 sessions ahead before lunch, and we have a great delicious lunch that is prepared for you already. Okay? And do participate and be patient for the lunch ahead. Okay, fine? Yeah. So how many of you are from far? Out of Ahmedabad? Out of Ahmedabad, who are all the students? Your travel was good? Have you ever been to Gandhinagar before? So, was there any difficulty to reach here? Very difficult? Nah? Okay. Are you liking the conference? Yes? So, are you happy with Dr. Deepika Khaka ma'am? Yes? So, she have told many things, right? About the quality of patient care. So, will you practice that in your life? In your nursing profession? Please do practice. Then only we can make it change. As ma'am told, a single drop can make it change, right? So change have to be started from yourself. So please do make a change in everyone. Start from us and the whole world can be changed. Okay? So we're going to begin our sessions. So please be on your toes, get ready. And I think we have provided you with a pocket notebook and a pen. So please do note down the important points that you have. Clear your doubts. Then and there, we have a questionnaire session after the speaker have been introducing. So please to ask the questions if you anyone have and clear your doubts and go with a positive mind. Okay? So are you all ready? Not ready? Not ready? Not ready? No.
आवाज ही नहीं आ रही है पीछे से.
So are you all ready? Okay, that's the spirit. So I again am requesting, while the sessions are going on, please to keep your mobiles apart. Fine? Yes. So this is a conference, so you have come here for a better improvement in study. You can use your mobile if you're feeling sleepy to check your DP and your profiles, photo, and then keep it back. Understood? So there are all the guest speakers and the moderators are come far away only for you. Right? So please to give the due respect for them and keep your mobiles away. Thank you. Quality improvement through nursing process, harnessing the power of the nursing process for continuous improvement. This conference is a platform dedicated to advancing the field of nursing, fostering innovation and promoting collaboration among healthcare professionals.
Over the next few hours, we will delve into various topics, explore cutting-edge research and engage in thought-provoking discussions aimed at enhancing patient care, improving healthcare, and shaping the future of nursing.
We are going to begin our first session. It is my privilege and pleasure to introduce our esteemed moderator for the first session. Please join me in welcoming an exceptional faculty member with an illustrious career spanning 14 years, Mrs. Himali Prajapati. With a wealth of experience and expertise, Mrs. Himali Prajapati has been at the forefront of shaping nursing education and practice.
Currently serving as the head of the Community Health Nursing Department at CM Patel College of Nursing, Gandhinagar. Mrs. Himali Prajapati has exemplified visionary leadership and a passion for nurturing the next generation of nursing professionals. As an ardent pursuer of knowledge, Mrs. Himali Prajapati is currently pursuing her PhD, developing deeper into the realms of nursing research and contributing to the advancement of the nursing profession.
Throughout her journey, Ma'am has actively engaged in various academic pursuits, including attending several nursing conferences. Moreover, she has contributed to the academy academic community through her published papers, sharing her insights and research findings which have undoubtedly enriched the field of nursing.
As we embark on this enlightening session, we are privileged to have Mrs. Himali Prajapati as our moderator, guiding our discussion and facilitating meaningful exchange of her ideas. Her expertise and passion for nursing are sure to inspire us all, creating an atmosphere of growth and enlightenment.
So without any further ado, let us warmly welcome Mrs. Himali Prajapati to the stage. Ma'am, please to come. I would like to invite Mrs. Aarti Patel, Assistant Professor of JMD Institute of Nursing, to welcome ma'am with a bouquet. I'm sorry for the delay happening. The mic is for yours, ma'am. Stage is yours. You can introduce the speaker.
Thank you, ma'am. It's my privilege to get the opportunity to be here as a moderator. And I'm extending my gratitude to the JMD Nursing College for welcoming the different distinguished guests from the different areas and opportunity for the moderation of the session. So today I would like to the session which will be taken by the Mrs. Shuhas ma'am. Ma'am right now working in the JG College of Nursing as an associate professor, and ma'am has more than 12 years of experience. Ma'am has guided many research, and ma'am has published many research in the journals, as well as in the ma'am has contributed in the books. Ma'am has completed the MSc Nursing from the Bombay Hospital College of Nursing, Mumbai, Maharashtra University of Health Science, MUHS, and ma'am right now pursuing her PhD from the Amity Nursing College. Then ma'am has done the many short-term certificate course. The course which is like Yoga Nindra under the trained personnel, then the certificate course on Six Sigma Green Belt, then certificate course for the Google for Education, then certificate course on evidence-based practice under Indo-American Evidence-Based Practice Academy in collaboration with Johns Hopkins Nursing Center for Evidence-Based Nursing, USA. Ma'am got many awards. She got medal for the standing first in dissertation, second year MSc Nursing, university exam. Then she got first runner-up in the Miss MGM and Best Personality Award from the MGM College of Nursing, Navi Mumbai. She got medal for the standing second in the second year BSc Nursing, university exam. Madam secured the distinction in fundamental nursing and in the first year BSc Nursing course. Madam has a various experience in research interest. Right now she is delivering with the different areas as a coordinatorship. She has guided more than 10 students in the research area. Ma'am has published papers, oral presentation in the National Conference on Strengthening the Profession on Nursing and Enhancing the Transformation at MGM New Bombay College of Nursing, Navi Mumbai. Ma'am has different publication. Ma'am have a professional organizations, lifetime membership with the TNI and lifetime member of Association of Nursing Executive in India. So today we have a distinguished guest speaker, that is Mrs. Swapna. So I would like to welcome for the session.
Thank you, ma'am, for this wonderful welcome. And before I start my session, I want to thank Divya ma'am for giving me this opportunity to be a speaker for this state level conference and also to share a stage with such an eminent personalities. So a very good afternoon to all dear students. Are you here? Are you physically present? I know you're physically present, but I need your mental presence also. Okay, let us start with the session. Yes? No? Who is that? No. Okay, we'll start with the session. Okay. So, as you can see over here, we are going to study about nursing process. So what is a nursing process? Nursing process is a 5-step clinical decision-making approach. Okay, what are the 5 steps in nursing process? The first one is nursing assessment, nursing diagnosis, planning, implementation, and evaluation. Oh, you are very smart. So today, what I'm going to discuss with you is nursing assessment and nursing diagnosis. So let us first understand what you mean by assessment. Assessment is an act of judging, determining something. Okay, so for example, you must be seeing your friend after many days. You try to check your friend or judge your friend. Oh, today you wore a very nice dress. You try to look at your friend, so you are assessing your friend, right? In the same way, in nursing assessment, what a nurse needs to do is to assess the health condition of the patient. Okay, so let us understand now what is nursing assessment. So definition says that nursing assessment is a systematic and continuous collection, organization, validation, and documentation of data. Now what do you mean by data? Data means information or facts. Now what data you're going to collect is the patient's health status. Okay, so the 4 points which are being highlighted are nothing but the activities which are being carried out in nursing assessment. So that is we'll be seeing each of these parameters, activities in detail. Okay, so collection in short is nothing but collecting. As you must be when you were very small, you had a habit of collecting things. You will be collecting, I know one of my friends was collecting erasers, different types of erasers, right? So here what we are collecting is the information. And how we are going to collect it? We are going to collect it by documenting it in the history taking or health history. You must have, I hope so, you know the history taking format. Yes, where we have biographic data of the patient, then chief complaints, right? So in the history taking and in the physical examination, in a systematic way, we collect the data. After that, we organize. Organization is nothing but the same thing. For example, when you're writing your physical examination, you don't write it down just like this is the condition of the chest, this is the condition. We write it down in a system-wise, right? So that is a systematic way. And why nursing assessment is continuous? Remember, my dear students, continuous because nursing assessment should never be done only in the first step. It has to be carried out in all the steps of your nursing process. I will give you an example. For you are handling a patient who has, you check the blood pressure of the patient. The blood pressure is 90/60. Now that is a hypertension. Hope so you know this, right? Yes or no? So, and that patient is been advised to be given an antihypertensive drug. Now, an antihypertensive drug will do what? It will reduce the blood pressure furthermore. Now, when you are giving the medication in an implementation phase, right? So, in an implementation phase, when you see that a patient's blood pressure is so low, you are not going to give medication. You are going to inform the physician because I don't want my patient to again go or fall the BP down more. Are you understanding? So, assessment doesn't mean that only the first step. It has to be carried out in all the nursing process steps. Is it clear? Now, what is validation? Validation is nothing but double checking. You have to check what you have written or what you have collected data from the patient is right or wrong. We'll be seeing about in detail furthermore. And next is your documentation. Documentation is nothing but recording. I made you understand why it is a continuous process and what is the purpose behind it. The purpose is to establish a database. For example, a patient who is admitted to the hospital, you get the information, you collect the information from the patient. So, for example, the patient was admitted with fever. So, as a nurse, what is our responsibility is that after giving care, my patient's health has to improve. Yes or no? I don't want my patient to get his health to get worsened if he is admitted in the hospital. As a nurse, I want my patient from the ward to get discharged to the home, and from ICU, he should go to the ward and then go back to the home. Yes or no? This is our responsibility to give best quality care to the patient, right? So once I assess at the initial assessment that the patient's the body temperature is 102, so the next day when I assess, it will be the first day assessment will give me a baseline data about my patient, and then I will compare it every day to see there is an improvement in the health. Okay, so this assessment helps us to provide or record about the patient's health condition and then compare it with time. Okay. Now there are 4 types of assessment. The first one is initial assessment. The next is problem focused, then emergency and time lapsed reassessment. Okay. We'll see one by one in detail. What you mean by the word initial? Initial means beginning or first. So when a patient is admitted first time in the hospital, okay, at that time a nurse who has been appointed or who is there, she will be doing initial assessment of the patient. Okay, so that is the first assessment of the patient what we are doing as a nurse. You can see time performed within specified time after admission. What is the purpose? Again, to establish complete database from problem identification, because once you take the initial assessment, you get to know what is the problem of the patient, whether the patient is having stomach pain, whether the patient is having headache, whether the patient is having fever. You're checking it through checking vital signs, by doing physical examination, by taking the history, you get the detail about it, right? And the example you can see, nursing admission assessment. Is it clear? What is initial assessment? Yes, everyone? Yes or no? Next is problem focus. Now this patient who has just admitted to the hospital, then the next day and the next day when you're caring for the patient, okay, that is problem focused assessment. Because if the patient was admitted with a problem of fever, after maybe 2-3 hours, he's saying, I also have stomach pain. So that is, his problems may change or the problem remains the same, but you are assessing it. That is called as problem focused assessment. Okay, so that word with the main word over here is ongoing. You can see the time performed, ongoing process. Ongoing process, you are assessing your patient. Purpose: to determine the status of a specific problem identified in an earlier assessment. An example you can see in ICU, we conduct an hourly assessment of client's fluid intake and urine output. Okay, and in the ward, we check 4-hourly the vital signs of the patient. Okay, hopes you understood problem focused assessment. The next is an emergency assessment. The word only suggests that, and remember, in an emergency assessment, you should be very fast in determining the patient's condition. You cannot delay it. For example, patient is saying that I'm having a chest pain, and suddenly the patient collapses there, and you see in the monitor there's no heartbeat seen of the patient, and you see that the patient is not breathing. You can't be walking very slow to the patient. You have to be very fast. You should be very vigilant enough. Okay, so commonly you can see over here it is written as physiological and psychological crisis. At that time we do emergency assessment. Commonly you're going to witness both of the things. Physiological can be when the patient is getting cardiac arrest. Now here what happens is that the patient doesn't have pulse. The patient is not breathing or has gasping breath. What do you mean gasping? Like this when the patient is doing, that's called gasping breath. At that time, we start CPR for the patient. That is cardiopulmonary resuscitation. you will be studying. I hope so you don't know about it. So you can see it is during any physiological or psychological crisis of the client to identify life-threatening problems, and the example, rapid assessment of a person's airway, breathing status and circulation during a cardiac arrest. That is a physiological crisis. What is psychological crisis? Assessment of suicidal tendency or potential for violence. Now, commonly in an ICU, patient where the patient is a little stuporous or the patient is semi-conscious, and sometimes patients try to remove the endotracheal tube, remove the IV line. So at that time, we sometimes restrain the patient or give sedatives to the patient. Okay, but as a nurse, we should be vigilant enough to look at our patient. What is their behavior? We need to assess for any psychological crisis. The example you can see, suicidal tendency or any potential violence. Is it clear? Emergency assessment? Yes? I need a response, otherwise you will be sleeping. The last type of assessment, remember the word is time-lapsed reassessment. The word is you are assessing again. The word is not assessment, it's reassessment. After a particular period of time, you are reassessing your patient. So you can see when it has been done, several months after initial assessment. Then purpose to compare the client's current status to the baseline data previously obtained. And the example you can see, reassessment of the client's functional health pattern in an home care or an outpatient setting. For example, a patient was admitted in the hospital and you had care for that patient. Now the patient is coming after discharge, maybe after a month or maybe after 2-3 weeks. The patient comes to the OPD and you are an OPD nurse. You are now going to do a reassessment. That is called as time-lapsed reassessment of the patient. Is it clear? What is time-lapsed reassessment? So there are how many types of assessment? Very good, you all are very smart students. Next is, what are the activities in the assessment phase? The same thing you had written in your, or you had seen in the definition. So collection, organization, validation, and documentation. So assessment, you can see all together, what all we do is we observe our patient and interview. We take interview of the patient, families, and the significant others, and examination of the patient and checking the patient's medical records. Okay? So we'll see one by one each activity. Collecting or collection of data is a process of gathering information about a client's health status. It must be systematic and continuous to prevent the omission, that is, deletion or missing of significant data and reflect a client's changing health status. For example, as a nurse, you are going and meeting your patient for the first time, and then you ask your patient, "Uncle, how are you?" Uncle says, "I'm okay." "Okay, you are okay?" Then, "Okay, I will go." Arey, you are not going to stop there. You're going to further ask your patient, "Why only okay? Yesterday you said me you were better. So what happened today?" Then the patient will say, "Today I have little stomach pain." Okay, stomach pain. Where exactly you are having the stomach pain? As you know, your abdomen has 9 quadrants. Yes? So you are going to tell your patient to point at. Use the finger and point and tell me exactly where is the pain. Okay, and then you are going to mention, if that pain may be in the epigastric region, you can further ask whether you have any burning sensation. Okay, so this is in detail. You are going to take the data from the patient so that you don't miss any important data while collecting. Okay? So what all data we collect, we know it. That is, as if I talk about health history, then or history taking format, we have biographic data, patient's chief complaint. Remember, the chief complaints of the patient should be written in the patient's own word. That means if the patient is saying you that I'm having leg pain, then you have to write it down in the chief complaint, leg pain since. We write it down, we give a multiply sign, that is nothing else, since 2 months, 1 month, 1 day, that has to be written, okay, in the chief complaint. Then we write it down is nothing but our present illness. Remember, in the present illness, you need to describe your chief complaints in detail. Now when the patient said you that leg pain, you need to ask, where exactly you're having pain in the leg. Your leg is such a big area. Exactly where you're having pain. In the thigh region, or in the knee region, you need to ask that and write in detail in your present illness. Okay, then we collect about past history. So past history can include, you can see example which is given, history of allergic to penicillin, past surgical procedures, or any chronic disease. Nowadays, you can see every human being or any patient or a client has diabetes or hypertension. So most commonly, you may be writing in your past history, known case of hypertension. So you need to write from how many years and what medicine that patient is taking for that particular disease. Okay? This is very important. What are the two types of data which we collect? One is subjective and the second one is objective. Very good. You all know very nicely. So what is subjective data? Subjective data can be also called as, you can see, symptoms or covert data. What do you mean by covert? Covert means secret, hidden. Okay, for example, I'm not going to give you anything, but if I give you a box which is nicely covered with a gift wrap, you will have that curiosity to know what is deep inside that box. Yes or no? Yes, you will have that curiosity. But don't worry, I'm not going to give you any boxes with any gifts. So how can you remember that subjective data is called as a covert data? How can you remember? Remember, covert, the word has cover. Something which is hidden, something which is secret. That cannot be seen from out. Example of a subjective data is pain. Now, if a patient is telling you that I have pain, I have headache, so how can you identify really the patient is having headache? Can I take a knife and cut his head and then see, idhar dard ho raha hai usko? Can I do that? No, it's not possible. That is subjective. His feelings, his experiences. You cannot go and cut and see. If a patient is saying you, I'm feeling like nauseated, so can you just go open the esophagus and say, idhar nauseated ho raha hai? No. So what is subjective data? Subjective data is something which is a patient's verbalization of his problem. Okay? So you can see over here can be verified or described by only the person who is affected and the patient's verbal description of their health problem. Example, you can see itching, pain, feeling of worry, nausea. All these are subjective data. So what's the important word over here is patient's verbal description of their health problem. It includes the client's sensation, feelings, values, belief, attitude, and perception of personal health status and life situation. Hopes you understood subjective data is called as symptoms and covert. Covert means secret, hidden, is nothing seen from out, but there's something which is there within the patient which you need to assess. The next type of data is objective, which a nurse is going to assess in the patient. You are going to see. So it's called as signs and overt. Overt is an opposite of covert. It is unhidden. Overt means unhidden. Are detectable by an observer and can be measured or tested against an accepted standard. Observation or measurement of a patient's health status. Who is going to do this observation? The nurse is going to assess. They can be seen, heard, felt, or smelled, and they are obtained by observation or physical examination. You can see the example, discoloration of the skin, you are checking the vital signs. Now for the pain, which is a subjective data, how can you collect the objective data? You can give the patient a pain scale and tell 0 is no pain, 10 is severe pain. Tell me, at what level is your pain? The person may say, maybe 5. So 5 is a moderate pain. Okay, is it clear? I hope so you all are with me, not just sitting, but mentally present and listening to me. So you can see some examples I've given over here, subjective and objective. So subjective, you can see I have fever. So I check the body temperature, it's 100 degree Fahrenheit. Tachycardia, 100, that is the pulse rate is 100 beats per minute. Dull and tired, dried lips. And I feel sick to my stomach. So how can I assess that as an objective data? Patient has vomited 100 ml of green tinge fluid. Abdomen is firm when I palpate, slightly distended, and there is active bowel sounds which are heard in all the 4 quadrants. I am short of breath. That is, patient is saying I have shortness of breath. So how can you have an objective data for that? You check the respiratory rate, which is 28. You can see breaths per minute. Tachypnea, lung sound diminished in the right lower lobe. Okay, now this is how you're going to assess the patient's subjective and objective data. Hope so you understood what is subjective and objective. Subjective is called as overt data, right? People are listening. Subjective is called as an covert data, and objective is called as overt data, and overt, that is sign. Okay. Now what are the sources of data? Primary and secondary is very easy. Primary is nothing but your client or your patient, from where you collect the information. And what is secondary? Secondary includes, you can see, all indirect sources. That is the family members or other support person, other health professionals, records and reports about the patient, lab values and relevant literatures if you go and research on, or you try to search on in the books. Now what are the methods of data collection? There are three main methods of data collection. The first one is observing, next is interviewing, and the last one is examining. Okay, so what is observation? Occurs whenever the nurse is in contact with the client. Interview, when you take your nursing health history. And examining is nothing but when you are checking the or doing your physical examination. So let us understand in detail about how to observe. To observe is to gather data by using the senses. Now here, you know, you need to be a keen observer. You need to be a keen observer. What it means is, what do you mean by keen observer? You are so vigilant in observing the patient that you know that this is a problem and the next step has to be taken. Now this can come only and only if you are dedicated. For example, patients, you will be studying in your second year about ECG, right? And if you see some changes, you should be very fast to take action. And if you see changes, very nice changes in ECG, something new is there today. You just see and then go off. That is not a proper assessment what you're doing, right? So you should be very keen observer in assessing your patient's problem. For that, you need dedication. You require to learn the concept, whatever is taught to you properly, then only you can assess your patient, okay? Observation is a conscious. You cannot do unconsciously and semi-consciously also. You have to give your heart and soul whenever you're doing your nursing care. Remember that. Conscious and deliberate. Deliberate means खुद से करना है, कोई धक्का मार के भेजे आपको नहीं. It should be your efforts in assessing the patient. I know it will take time in assessment, but you have to learn the skill. That is developed through efforts and with an organized approach. So using the senses to observe the client's data. So what are the methods of observation? First, using your eyes, that is vision. Overall appearance of the patient. For example, if you see your friend anytime, and if there is any changes in his face, can you identify that? Yes, why? Because you have concern for your friend. For example, if there is an enemy, your enemy comes and his face or her face is disturbed, you'll never ask her, "Jaane do, acha hai." Right? You may have such feelings, but for your patient, you should have such concern as you have for family. Then only you can observe the changes in the face. Okay? Discomfort, facial and body gestures, skin color and lesions, and non-verbal clues, that is, he's very angry, or he's anxious, or he's worried. Smell. The next method of observation is smell. When you next go to your patient and you smell some bad odor is coming, then you try to identify, maybe he must have not taken bath, or nobody is there who has given. So you as a nurse can give bed bath. Okay, so body odor or any breath odor. Next is methods of observation, hearing. So what you are going to hear? You are going to use your stethoscope and listen to the lung and the heart sounds, bowel sounds, ability to communicate. You are also assessing whether the patient is able to communicate with you. Language spoken, ability to respond when spoken to, and orientation to time, place, and person. What you mean by this is, if you ask your patient, what is the time now? And if the time is in an afternoon time and he's saying that is night, so he's not oriented to time. If you ask your patient where you are, he's in the hospital and he's saying you that I am in Paris, in a bungalow. He is not oriented to place. And you ask that who I am. So he's saying that you are my neighbor. So that is also, he's not oriented to the person. Clear enough? Orientation to time, place, and person. Next is touch. So when you touch your patient, you can assess the skin temperature, moisture, muscle strength, pulse rate, and any palpable lesions. Okay, when you are doing palpation, if you find any, first you should be aware enough what is a normal. Then only you can identify any abnormal. Like for example, when you do a palpation of abdomen, you can palpate your kidneys, means patient's kidneys, and then suddenly if you palpate the kidney and say, there is a mass. No, it is not a mass. You have not known what is normal. Okay, and then you can identify what is abnormal. So lumps and masses can be there. So what are the aspects of observation? You are noticing the data and selecting, organizing, and interpreting. You can see the example which is given. A nurse who observes that a client's face is flushed must relate that observation that maybe his body temperature is raised, or because of activity he is tired, and maybe the temperature is too high, or his blood pressure must have dropped down. So these are the different inferences or conclusions which you are making. So the first data collection method which we saw was observation. The second one which we are seeing is interviewing. Interview. What is an interview? Interview is a planned communication. Remember, never go to your patient without planning. You just don't go, just stand next to your patient. Okay, uncle, बताइए, क्या बताना है आपको? No, you have to have questions with you. You should have a detailed questionnaire, what you want to ask to your patient. And remember, don't go and disturb the patient again and again. For example, you have taken the patient's family history and suddenly you remember, अरे uncle, आपका बेटे का नाम तो लिखा ही नहीं मैंने. And the patient is sleeping. You wake him, उठो उठो, मुझे नाम अभी बताओ. You can't be doing that. You can't be disturbing your patient. So see to it, all the questions you ask should be at one time. In nursing, and the conversation is with purpose, that is, you know why you are communicating with your patient. In nursing, one example of an interview is nursing health history. And there are two approaches in the interview. We have direct and indirect, or we say it as non-directive. Direct is what? It is highly structured and extracts specific information. That is, when you have less time, like an emergency situation, you are not going to ask detailed questions. Okay, for example, a patient has come with a road traffic accident. You are not going to sit and ask, बताइए घर पे कितने लोग हैं? You are not going to ask that question. For you, the main question is, how did the accident happen? And where all you are having any pain, or did you have any sensations in your fingers and your toes? Are you understand? That is a specific question which you are going to ask. Commonly, the questions are very highly structured, means it is yes or no. Questions can be asked to the patient. Nurse, except the purpose of the interview, nurse is the main controller of the interview, and it is frequently used when the time is limited, like an emergency situation. What is indirect? It is rapport building interview, that is understand. Because when, for example, when you must have gone to your patient, you must have asked in detail the question to the patient. Okay, uncle, tell me how you were admitted to the hospital. Then he will start that I got up in the morning, I had this problem, and then I had chest pain, I then went to this clinic, then this is in detail. Okay, here the nurse is not controlling. Here the nurse is giving the patient the whole authority to tell in detail about his problem. So you can see, nurse allows the client to control the purpose, the subject, matter, and the pacing. At whatever pace the person wants to say, you are there to listen. What are the types of questions you can ask in an interview? There are 4 types of interview question. First is closed, open-ended, neutral, and leading question. I hope so you all are listening. Yes? Yes? I just want you all to clap for yourself for listening at least for half an hour. Very good. The clap was so loud. So what are closed question? Closed questions are used in a direct interview, and they are mostly where you get an answer of yes or no. So you can see the example, are you having pain now? So the answer will be yes or no, okay? What is open-ended? Open-ended commonly used in a indirect or non-directive interview where you give the patient chance to answer in an elaborate manner. Example, you can see, what brought you to the hospital? That's what I said just now. So he will be talking in detail about it. Next is neutral question. Now, neutral questions are those questions where you're not pressurizing your patient. Okay, if he wants, he can answer. If no, fine. So it is commonly used it's an open-ended question, used in non-directive interview. And how do you feel about that? Or why do you think you had the operation? Leading question is where you're guiding, or you had such a scenario. For example, surgery has happened, and then you want to ask the patient something about it. Or surgery is going to happen, and then you want to ask your patient, are you worried about your surgery? That's a leading question. Okay, leading questions are commonly used is usually closed and used in a directive interview. You are stressed about your surgery tomorrow, aren't you? You will take your medicine, won't you? So this is again a closed-ended question, okay, commonly used in a direct or directive interview. Planning the interview and setting. How are you going to conduct the interview? So there are various aspects of this. The first one is time. The nurse needs to plan for an interview with hospitalized client when the client is physically comfortable. Remember, when the patient is having severe pain in the abdomen, and then you go, tell me who is there in your family. Tell me about your economic status. He is in severe pain. You can't be asking at that moment such questions. Okay? So you try to help him resolve his problem. He should be comfortable whenever you're going to ask questions to the patient. Physically comfortable, free of pain, and when interruptions by friends and families and other health professionals are minimal. For example, if the patients, there are visiting hours, right? Visiting hours are there. At that time, the relative has come, and then you go. Now you tell me about your whole history, or you're going to take health history from the patient. That is wrong. Let him spend some time with the family, and when they go, after that, you collect your history. The place where you are going to ask the question or do health history taking, you can see well-lit, well-ventilated, moderate-sized room, free of noise, movement, and interruption can encourage the communication. And how should be the seating arrangement? The nurse should be either sitting or standing at 45-degree angle. That doesn't mean you take a protractor and measure it. It doesn't mean that. It's nothing but a diagonal. You are going to stand or sit in a diagonal way to the patient. Distance, the professional distance, 2 to 3 feet has to be maintained. And the language has to be which the patient can understand. Okay, you can't be talking in English with the patient, and the patient is not able to understand what you're speaking. Okay, and very important word, please avoid medical jargons, using medical terminologies. A patient who is just now admitted, and you say him, wait uncle, I will bring sphygmomanometer. Oh my God, he say, kya? Sphygmo kya hai? He will get scared of it. If you say BP machine, he will be okay. But sphygmomanometer, such hi-fi words, you don't use. Medical jargons, don't use with your patients. The last data collection method is examining. So commonly we are going to do it through physical examination, and the steps you can see, it is inspection, palpation, percussion, and auscultation. So commonly we do head-to-toe approach or body system approach or review a specific system. Organizing. So we have just completed one activity, okay, that is collection of data in nursing assessment. The second one, don't worry, it's very small. The second one is organizing. Organizing is commonly done, that is you're writing in the health history and physical examination, which is organized manner. Next is validation. Validation is also called as double checking. You can see there are double ticks. That is, you're checking it again. Or verifying the data which is accurate or factual. What is the purpose of validating? Ensure that the data or data collection is complete. That you have collected all the information from the patient, because if you're not doing your nursing assessment properly, your nursing diagnosis will affect, your planning, implementation, and everything further. So your assessment should be proper. And one common mistakes which I have seen students doing is first writing nursing diagnosis and then writing nursing assessment. That is a wrong step. First you have to collect data, and then from that nursing assessment we prepare the nursing diagnosis. Okay. So ensure that the objective and the subjective data agree. For example, if the patient is saying you that I am feeling very worried, I am feeling very anxious, and then you see that is objective. Okay, subjective is I am worried, but objective when you see your patient is smiling and laughing. So you need to counter question your patient. Why is that you are laughing and you are saying you are worried about? Okay, so your subject and objective is not matching. Obtain additional data that may have been overlooked by you. Avoid jumping to any conclusion. Okay, I'll be talking about the cues and the inferences that will make it more clear. What are cues? Cues are nothing but the subjective and the objective data which a nurse is collecting. Okay, and what is inference? Inference is nothing but the conclusion made from subjective and objective data. You can see over here the example, red swollen wound. So what conclusion I can make is that it is an infected wound. Dry skin, that can be concluded as there is dehydration. Documenting, remember to document in an factual, that is what is right, that has to be documented. Remember that your vital signs, please check and document. Don't write from the patient's file. You have to check the vital signs and then record. I've most commonly seen you just copy it down from the patient's file, which is recorded by some doctors. It includes all the data collected about the client status. You can see one example which is given. You have to be specific in writing. You can't just write chest pain. You have to write where exactly is the pain. Or the pain is radiating. Or the pain is precipitated, increased or decreased. How? Everything in detail. The example given over here is a nurse records the client's breakfast intake as, now this commonly we write it down in nurse's notes. Okay, nurse's note is a column, diet column, where we write it down specifically. You just don't write the patient is having a diabetic diet. You need to write in detail what the person has taken. You can see slice of wheat bread 2, 1 banana, poha. Okay, so he has taken all this rather than writing a normal diet or a diabetic diet. The nurse records the subjective data in the client's own word, which I have already told you. So we have just seen now about nursing assessment. Is it clear to everyone? What are the 4 main activities which are carried out? Collecting. Yeah, loud, little loud. Collecting. Organize. Yeah, organizing. Validation. Very good. I think this group is very smart. This group has to be more smarter. Let's move to the last topic. That is, yeah, oh my God, ma'am, yeah, I know that. But nursing diagnosis. Now, there's a difference between a medical diagnosis and a nursing diagnosis. Medical diagnosis, I'll give an example. If there are 2 patients admitted in the hospital with the same medical diagnosis, that is malaria. Now, medical diagnoses are based on the laboratory test or the clinical manifestation which the patient is showing. Now, one patient with malaria is saying you that I have headache and fever. But the second patient is telling I don't have fever, but I have headache. Now, you can see the response, the human response of the patient, of one patient is different from the other. That's why, remember, you cannot be writing the same care plan for both the patients, because their problems are different. Commonly I've seen, you pass on the care plans to others. Mera bhi wohi hai, wohi likh de. But it's not like that. Patients are different. Patients' problems are different. Okay? Sorry. So what's the definition? Okay, let's see the little introduction. The second step and involves analyzing, that is you're collecting carefully the data, and synthesizing, that is you're bringing it together, of data and formulation of diagnostic statements. Each statement describes the potential or actual problem. What do you mean by potential? The risk-related problem. For example, a patient who is bedridden. So there is a risk for bed sores or pressure ulcer. Now remember, this risk-related problem, patient is not going to tell you. Patient cannot tell you that I have this risk. You as a nurse is educated, knows that this can be a risk for the patient. Okay? And what is the actual problem? Actually now, what is the problem of the patient that you are recording? So remember, based on your nursing assessment only, you can do or formulate your nursing diagnosis, not the ulta of it. Don't write first nursing diagnosis, then write assessment. First write assessment and then formulate your nursing diagnosis. So the definition says that it is a clinical judgment. You are judging the patient's signs and symptoms, okay? And concerning a human response, as I said, human responses are different. Both the malaria patient had different clinical manifestation, and that's why your care will differ. Remember, your nursing process is not a group care. It is an individualized care, one patient at a time. So you can see human responses to health condition, life processes, or a vulnerability to that response by an individual, family, group, or community. And a nursing diagnosis provides basis for selection, because if you write your nursing diagnosis properly, you can plan your nursing interventions. So what all activities are being carried out in nursing diagnosis? Compare the data against standard. That is, what do you mean by standard? You should be aware about normal values. If you check the patient's temperature, you see it is 102 degree Fahrenheit. You should be aware that 102 is a fever or pyrexia. Because if you don't know, then you don't know how to write further the diagnosis of the patient. Cluster or group, you are going to group the data together. If a patient is having shortness of breath, so from the vital signs, you will be recording the respiratory rate, right? By looking at the patient, you will see there's a shortness of breath which is present in the patient. So you can write, I can observe shortness of breath is present. Okay, so this all data, you're going to bring it together and then formulate your nursing diagnosis. Identify any gaps or inconsistency in the data. Determine the client's health problem, health risk, and the strength, and then formulate the nursing diagnosis according to the priority. What do you mean by priority? We always keep airway, breathing, and circulation as the first priority, and then write it down other problems of the patient. So there are different types of nursing diagnosis. The first one is problem focused. What do you mean by problem focused? It is a clinical judgment concerning an undesirable human response to health condition. It's very easy. What is the actual problem of your patient? That you are writing and then formulating a nursing diagnosis. The next one you can see, it is a risk diagnosis. That is, you are assessing what is my patient at risk for. Okay. You can see the example which is given. It is risk for deficient fluid volume, risk for pressure ulcer, risk for falls. The next one is health promotion diagnosis. Health promotion is something which we want my patient to promote his health for a better one. Okay, now you can see the example, readiness for enhanced nutrition. A patient should be ready, or the patient should be having that enthusiasm to improve his health. Then you can formulate this diagnosis. And the last one is syndrome. Syndrome is nothing but a group of signs and symptoms which is present. So commonly, very rarely we are writing syndrome diagnosis, but example you can see, it is a chronic pain syndrome. Very important part is how to formulate a nursing diagnosis. So there are different parts of the nursing diagnosis. The first part you can see is a nursing diagnostic or diagnosis label. And the second part is your indicator. You can see diagnostic indicator. Now diagnosis or nursing diagnostic label has further two parts, that is modifier and focus of the diagnosis. I'll show you the example. Modifiers are the words ineffective, risk for, readiness for, enhanced, impaired, ineffective. And you can see the diagnostic focus, airway clearance, overweight, knowledge. So it is like ineffective airway clearance, risk for overweight, readiness for enhanced knowledge. The whole thing is a diagnostic label. Okay? But diagnostic label also has two parts, modifier and diagnostic focus. Is that clear? Yes? Yes? The diagnostic indicators, there are three main diagnostic indicators. That is, we'll move defining characteristics, that is an observable clues, inferences that cluster as manifestation of diagnosis. Commonly we say it as signs and symptoms. Defining characteristics are nothing but what you observe in your patient and the subjective data which you collect from the patient. The next is related factors. What is the reason that the patient is having this nursing diagnostic label? Okay, so the main etiology, circumstances, facts or influences are the cause or the contributing factor. Well, we see one example, then you will understand a little better. So defining characteristics are signs and symptoms. Your related factors are the main reason why you're writing that nursing diagnostic label. And the risk are the risk factors which you are finding in your patient and then mentioning. As I said, you are going to write a risk for pressure ulcer. Why you are writing? Because it is related that the patient is bedridden. Okay. NANDA, you should be aware about NANDA. What is NANDA? Is North American Nursing Diagnosis Association. I stands for international. They have formulated many nursing diagnostic label. I think you have been given the nursing, yes, you have been given in the folder, I hope so, the NANDA diagnosis, which is of 2021 to 23. They revise it every 2 years. They are only giving you the diagnostic label. Remember that the whole nursing diagnosis they are not formulating and giving you. So you can see there are around 267 nursing diagnoses which are grouped or classified within 13 domains. There are so many domains which are there. Okay, let me give you an example of one domain. The domain 4th is activity and rest. In that the first one, class 1 is sleep and rest. This has been given by NANDA. You have to refer NANDA and then write nursing diagnosis. If you are making your own diagnosis, then please write your name below it. That is been written by you. Okay. So sleep deprivation, disturbed sleep pattern. And at class 2, you can see it is activity for that impaired physical mobility. I just request you that you refer the NANDA diagnosis and then write it down. So formulating the nursing diagnosis, how you are going to formulate, there's a format that is PS or P format. So P stands for problem statement. That is the diagnostic label. E stands for etiology or the main, the main related factor. And defining characteristics or signs symptoms is S. Commonly we use PE or PES format. So this is how you formulate a nursing diagnosis. First, write the nursing diagnostic label. I have seen students writing down difficulty in breathing. Difficulty in breathing is not a nursing diagnosis. It is a problem which you have identified. What you need to write it down is ineffective airway clearance, impaired gas exchange, ineffective breathing pattern. Okay. So nursing diagnostic label. Why the person is having that? That is related to the main cause behind it. And then defining characteristics is written as evidenced by. Please don't write due to. Due to is not the main or the right format of writing your nursing diagnosis. It is always related to as evidenced by. As evidenced by is nothing but yours. You're going to write the signs and symptoms which you observed. The example you can see down, ineffective airway clearance related to excessive mucus and asthma. So here I'm saying that the person is having ineffective airway clearance. The main reason behind it is excessive mucus and the person is also having asthma. And as evidenced by decreased breath sound bilaterally, crackles over the left lobe and it is persistent, and ineffective coughing is present in the patient. This is how you are going to write your nursing diagnosis. I have brought an example for you combining both nursing assessment and nursing diagnosis. So here you can see that the patient subjective data, patient is complaining of abdominal pain. And what is the objective data which as a nurse you are going to write or you have assessed? Patient has undergone surgery for gallbladder stone 6 hours back. He appears restless. Upper right subcostal incision, that surgery has happened, so there is an incision which is present. Reports abdominal pain 7 on a scale of 0 to 10. Patient is lying in supine position, attempting to draw up his legs because he's having pain. Pulse rate is 90 beats per minute, respiratory rate is also increased, and blood pressure is also increased. Can you tell me what can be the nursing diagnosis? Easy, very easy. You are very smart. The nursing diagnosis will be? Not even one student. The nursing diagnosis will be acute. Very good. You know it. Acute pain. But remember to write related to what is the main reason. Here the main reason is because of surgery. Okay. Related to tissue injury, surgical intervention as evidenced by restlessness. Guarding behavior. Guarding behavior means he is trying to pull his leg up in order to reduce the pain. Elevated pulse, respiration and systolic blood pressure, and reports that the pain is 7 on a scale of 0 to 10. Is it clear how you're going to assess and then write the nursing diagnosis? One important point which I want to tell you, whenever you're writing risk-related diagnosis, please don't write subjective data. Risk-related diagnosis, why you're not writing subjective data? Because patient is not going to tell you, I am at risk about this. Remember this point. Whenever you're writing risk-related diagnosis, never write subjective data, write only objective. Any questions? Anyways, I just want to tell you, be determined that you want to do nursing. Okay, first your goal should be clear. Determine that I want to learn. Take efforts in learning, and practice can make you perfect. I just wish you all the best. May you all be a competent nurse who are going to provide the best quality care to your patients. Thank you.
Thank you. Thank you, ma'am. Ma'am has very nicely explained about nursing assessment and nursing diagnosis. Ma'am has covered almost all the content regarding that in the assessment, types of assessment, then the activities, then the nursing diagnosis. Ma'am explained about the parts and how to formulate the nursing diagnosis. So I hope you all are clear with the nursing assessment and nursing diagnosis. Now, any students, anyone have any doubts or question regarding how to formulate that, you can ask the question. Now, house is open for the discussion. Okay, hope so it is very clear. Fine. So, the main thing in that, I would like to focus that our today's theme is that quality improvement in nursing process. See, in your basics in the syllabus, you already learn about the nursing process and how to formulate the nursing diagnosis and all. But the main thing is that like how to improve the quality. So I request all the students during a nursing practice, try to understand that what is the problem of the patient. Try to implement, try to formulate the nursing diagnosis in very proper way by following of the Nanda nursing diagnosis, the revised nursing diagnosis, then the implement that nursing diagnosis and provide care according to that way. The one more thing in that, the nursing theories in the next syllabus, in the revised syllabus, they are focusing with the nursing theories. Okay, how to correlate that nursing theories with your nursing process. Okay, so try to understand about the different nursing theories and how to implement that nursing theories in your nursing process. That is the things. It was about the today's session of the nursing assessment and diagnosis. So I would like to thanks Mrs. Swapna ma'am for deliberation of this topic in very nice way with a good example and explain in easy way. Okay, so thank you ma'am. And thanks to the team of the JMD Institute of Nursing for organizing a wonderful conference with a beautiful audience. So thanks everyone.
Now I would like to invite Mrs. Aarti Patel to felicitate Mrs. Swapna Suhas and Mrs. Himali Prajapati.
करेगा यार, आप क्या कर रहे हो? ऐसा ही
Thank you so much, Himali ma'am and Swapna ma'am. Good afternoon, ladies and gentlemen. Now we have a few sponsor session. I would like to invite Ms. Rasika Taskar, healthcare entrepreneur from Ostra Healthcare, to come and share her academic details.
Good afternoon. So everybody is hungry and I'm not going to take too long, okay? First of all, thank you. It's great to see all of y'all in such large numbers, and thank you to JMD Nursing School of Association for, allowing us to participate at this stage, because it's allowing a woman-led startup to participate in this. So let me just, so we are talking about healthcare now, but where are we going to be in healthcare 2040? This is how it's going to look. But are we there right now? And I think, there's a lot of change that has to come in the way we teach. And that is exactly what we are focused upon. So, next slide. Yeah, this is to show you what the current processes are, but I really don't want to go there. So, because to give you an introduction of my company, I started this 2 years ago. I've been in the space of hospital consulting for the last 20 odd years. And at Ostra, we look at a new way in which we can try to teach the nursing students, the paramedics, and the allied health force. So this is an attempt to work along with nursing organizations, nursing institutes. Right? Next slide. At Ostra, we have two types of solutions. One, as you can see, is Ostra Learn, and the second one is Ostra Access. In Ostra Access, we manage the post-discharge post-hospital discharge care. It's a collaborative care with nurses, hospitals, and this is kind of a new system that we are trying to evolve over here with hospitals. In Ostra Learn, we have an immersive learning platform which can serve all of y'all. This morning I've been hearing that how important patient scenarios, case scenarios, how important it is to note down what you're learning now and go back and really see it practically. That's where we are trying to make a change. Yeah. Next slide. Thanks. Next. So this is where we are. We've combined data sciences, cognitive sciences to evolve a model, to evolve a way in which we can change or try and change the way we learn. So we are trying to map patient scenarios. We are trying to push it into this particular platform. And this platform allows the user to learn in a very stepwise manner. So you will have a particular case scenario going on, and the student is constantly questioned on skills and on knowledge. So it's not just, and post all of this, there's a huge data analytics that is done on where and how much has your student learned. So this is for all the faculties. I don't know how many are here. Maybe if you all are interested, we can, kind of demo this on a one-on-one basis. So, yeah, next slide. So as I was saying, our platform is seriously immersive. It can be teaching you on a 2D video. It can be teaching on a 3D video, and as well as on a virtual human being. Right, next slide. This is to show you, this is how we kind of, make the learners give an instant feedback. And that is important because you want your learner to go through the entire process of learning and not just, understand 15 minutes or 50% of it and not understand the 50%. Yeah. This is, as I said, there's a huge analysis that goes behind this system. And the analysis actually presents to the entire data for the entire cohort that is learning. It tells you what is the skills, what is the knowledge that has been learned in that particular session. And it's all simulation based, it's video based, so it's meant to be in the space of upskilling and continuous learning. That's it. So based on all of this is a program of ours in which we have about 41 modules, right? And that program is known as ACT. I'm happy to talk about ACT to relevant stakeholders in this particular forum and take it forward if you guys are interested. As I said, there are 40 topics. We teach in an online manner, offline manner. They're all meant to be, and all programs are certified. So they all are in the format that you would want them to be in. We've done some 6,000 odd trainings so far, so in the last 2 years, and that too in the thick of COVID. We've done it in small places like a Kionjar district in Orissa, as well as in cities, and we've seen that this model is accepted everywhere. So if you want to connect with us, I would leave that and really would appreciate you guys connecting, because this platform is not meant to be only a single-use platform. It's a collaborative attempt that we need to do to kind of see where we can take the learning. That's all. Just a minute.
Thank you, Dr. Rasika Bireva, ma'am. My name is Renuka Bhosle. I am a nurse by profession. I have completed my graduation from Jamia Hamdard, New Delhi, 2003. Completed my master's in child health nursing in 2012. I have around 20 years of experience in teaching, training, administration. Currently working with Ostra Health with my founder, Dr. Rasika ma'am, as a business manager into clinical sales. Let me simplify the things what ma'am wanted to say you. On the daily basis, you attend many lectures where half of the things is not understood by you. Because you don't know. For example, just now a topic was conducted for you to do the assessment. How many of you know how to do the assessment, head-to-toe examination? शायद 90% लोगों को नहीं आता है. स्टेथोस्कोप कहाँ रखना है? रिनी टेस्ट कैसे करना है? एलेंस टेस्ट कैसे करना है? वेबर टेस्ट कैसे करना है? बट हमने असेसमेंट करना है, करके दिखाओ. पता नहीं कैसे करना है. ठीक है? So we are into that. We hold your hand. We take you in the classroom, 5% to 10% of theory and 90% of demonstration. So the Ostra Health is into upskilling of the nurses and the skilling of the student nurses, as well as the upskilling of the nurses who are already working in certain hospitals. Taught programs for the nursing tutors. So we are into that. We wanted to bridge in the gap between your knowledge, what is taught here in the books, just the theory, but we want you to be upskilled. We want you to understand the procedures, how to do it in a real manner. When you reach to the hospital, you understand. मैंने जो book में पढ़ा था, वो अभी करने में मेरा confidence 0 है. Yes or no? आप लोग बहुत सारे लोग 4th year में होंगे, 3rd year में होंगे, 2nd year में होंगे. आपको पता है ब्रैडन स्कोर क्या होता है? आपको पता है कि नेजल कैनुला से ऑक्सीजन मास्क पे कब स्विच करना है? Okay, fine. If you know these all simple questions, you are doing wonderfully. But if you don't know these simple questions, you need not to come, gear you up, take knowledge every day, not in terms of just theory. I want you to be for the practical. So my QR code was here. We will leave it for you. Anyone wanted to connect to us, my number is, I understood that there are 15 colleges are participating here. Can I get one representative from each hospital, college, one person from each college. Anyone, you can decide among yourself. May I have you here in the stage? Okay, fine. So I'll leave my brochures here. You can take. My number is there, my QR code is there. You can connect to our company directly. I would request to the nursing trainers here, the principals who are present here, please motivate your student to go for the programs which are really helping them to understand how to work how to be ready in the clinical area. Thank you so much.
Thank you, ma'am. Now I would like to invite Ms. Gayatri from United Overseas Private Limited Company.
Jai Shri Krishna, everyone. How are you? Nice to see you all. So today I'm here on behalf of United Overseas, one of the overseas consultancy in Gandhinagar. So I'm here to represent United Overseas, although you all know that I'm also part of nursing faculty taking English subject. So let's have a short film, first of all, related to our overseas company, that is United Overseas. And here it is. Please, ma'am. These are the places where the classes are being run. We have our receptionist looking after the inquiries, dealing with the cases which are there and giving solutions. We have our directors. We have our counselor room where the counseling sessions are being conducted and the test takers are given guidance related to our consultancy and the countries where they are going to take their career.
So you will be appearing for IELTS exam or you will...
Proper training programs are given by the trainers to all the test takers and make them focused in all the 4 modules which are there in IELTS and PT.
I request all the student body to listen here properly and please to maintain silence.
I am one of the students of United Overseas Gandhinagar. I am taking coaching from
nursing is very good. Facility giving guidance for therefore improvement, and I am well to score 65 and above.
Myself Chaudhary Riya, I am one of the students of United Overseas Gandhinagar. I am taking the coaching in this institute last 3 months. Best teaching quality among PD class and giving guidance for good score. So whenever you get chance to visit for this institute.
I am one of the students of United Overseas. I really like to study here. All the faculty members are doing best in their job. Also, my trainers train me very well in all modules. I will book my date very soon, and I am confident to get a good band score. Thank you.
My name is Rama Dharmalsi. I am one of the students of United Overseas Gandhinagar. I am taking coaching from this institute last 3 months, and I have taken my test in July. I am confident to get 65 and above. I am very happy to be part of this institute, and my trainer takes a lot of care and provide me guidance very important. This institute provide very many more facilities like PTLM, computer, multi-tel, and many more. And the best part of this institute is the atmosphere is very happy and good.
So these are the reviews. These are the reviews of our students regarding United Overseas.
And facilities are too much good, and tutors are also much good, and PD lab, IEL setup classes, and everything mock test as well.
Myself, Helisha, I'm a student for the United Overseas. Last 2 months, I'm a joined for United Overseas. We all know that the United Overseas so many amenities there, such as the well-development, the classes, infrastructures. Apart from this, all are the faculties who are pretty loving, caring for each other. And we also the trainer name is the Dr. Gayatri ma'am. Dr. Gayatri ma'am always support me like the live wire for me and my backbone. Each and every situations they can uphold me. Thank you so much, United Overseas.
Hi, my name is Shakshi, student of United Overseas. I recently joined by getting good reviews about the institute. I am happy to join this institute. All faculties are very good and the learning environment is pleasant. I love this institute very much.
These are the results of our IELTS and PTE examination, where the students have moved to different countries and they are doing very well in their career. The time period was very short for us, so a very short film we had made about our institute, that is United Overseas. So, United Overseas, the name which was first of all brought in public was by our Honorable Director, Dilip Bhai Oza. It was in Chandkhera, Ahmedabad. From there, it moved to our Gandhinagar, and the main head office is in Gandhinagar. The directors are Shri Dilip Bhai Oza and Shri Kiran Bhai Thakur. I would also like to share saying that there are 2 other branches. One is in Mehsana, taken care by the director, Shri Nilesh Bhai Patel, and the other is in Mansa, where Shri Vipul Bhai Prajapati and Shri Dikshit Bhai Prajapati, they are the directors. I am proud to say that few more branches are going to come up in different locations of Gujarat. We, United Overseas, have got our own vision as well as mission also. So the vision is customer-centric, and that is to provide a new perspective to the immigration industry. Side by side, the mission is to guide the client's migration journey to their dream land, and that is also by end-to-end services. I would also like to add that our United Overseas Institute, it is one of the prominent name, and it is one of the perfect institute for IELTS as well as for PTE coaching classes. We do a lot of research and preparations for which is highly suggested for the students to pursue his and her career abroad through IELTS and PTE. The directors give their best efforts to fill the gap between the best clients as well as the talented people and the best universities across the globe. The students as well as the parents, they have shown their trust on us as a foreign educational consultancy for getting their career goals abroad. As I already told you that I'm an English faculty in the nursing institutes, but I'm also an experienced and certified trainer for IELTS as well as PT for last 29 years, where I'm training all the students in all the modules of IELTS as well as PTE. Side by side, I'm also counseling them, inculcating to them the confidence that they can do it, and also make them focus for the test, getting very good bands. As a proud trainer, I can say that my students have scored 7+ band in IELTS as well as 70+ in PTE. They are admitted in excellent college and universities and doing well in their career. The classroom facilities, they are very pleasant, cozy and comfortable, where the students, they sit and learn all the modules of IELTS as well as PTE. Side by side, the doubts are cleared by the trainers and give them the best solutions which is required there. After the classes, the students are also given time to sit and read and do their work which is being destined. The trainers also, they play a very important role in helping the students in getting the desired bands, and which is the first need of the overseas education. The trainers make the students understand the aim of each module, and then the students find it very easy to solve the questions in all the 4 modules. The guidance given to the students that sharpens their all the 4 modules and also help them to speak English in their day-to-day life. Last but not the least, I would like to say on behalf of our institute, that is United Overseas Consultancy, that we will love to have one-to-one interaction to understand your requirements and your current ability, where we can discuss the roadmap of your journey, and then we will help you to bridge the gap and achieve your goal. We will also say that we will have a good free interactive sessions and discuss about PT and IELTS in general, so that all the things are clear to you. I would also look forward to meet you once again with my team, and my directors will also be there. Thank you, children. All the best to you all. And once again, I thank Divya ma'am. I thank Divya ma'am for giving me this opportunity to be in front of you and giving me this platform. Thank you so much, my dear staff members, and thank you all, my dear children. All the best for your future. Thank you, and God bless you. Jai Shri Krishna.
Thank you so much, ma'am, for explaining regarding your courses and the form. Now I request all the speakers, moderators, nurse educators, staff nurses, and the nursing faculty to move towards the dining room for your lunch. And may I request all the volunteers to guide them to the VIP dining room. Students, please be seated. I request all the student body to be seated. All the faculty, staff members and the educators, you can move to the dining room. Volunteers, please to guide them. Okay, students, you please to wait for 10 more minutes. Please be silent and do be courteous. Please be seated. Take your seats. Students, are you all listening to me? Yes, I know you are all hungry. Yes, so 10 more minutes, only for 10 more minutes. So I would like to invite Mr. Bhupendra from VS Academy to come forward and to explain regarding his firm.
Thank you, ma'am. Good afternoon, every students. Good afternoon, everyone. कईयों के मन में आ रहा होगा चिल्लाया नहीं जा रहा है, शुगर का लेवल 35 पे आ गया है ना? समझ सकता हूं आपके मन के और स्टोमक के दोनों के भाव समझ सकता हूं मैं. आपके 10 मिनट लूंगा, 10 मिनट में पूरी बात फिनिश कर लूंगा, पर एक शर्त है, 1 मिनट बिल्कुल साइलेंटली बैठना. जितना आप ज्यादा साइलेंटली रहेंगे उतनी मैं जल्दी बात को कंप्लीट करूंगा. वी आर फ्रॉम VS नर्सिंग एकेडमी. Our center is located in Kudasan, Gandhinagar, and we are preparing a student for nursing competitive exams. English आ रही है समझ में कि ऊपर से जा रही है? मास्टर होने के नाते समझ सकता हूं, जा रही होगी तो मैं हिंदी में बोल लेता हूं. हम नर्सिंग के जितने भी कम्पिटिटिव एग्जाम्स होते हैं उनकी प्रिपरेशन करवाते हैं. सामान्य भाषा में आप यूं समझिए, राजकोट एम्स में आपको नर्स लगना है तो आपको ये तैयारी करनी पड़ेगी. आपको यदि ESIC बापूनगर में लगना है तो आपको तैयारी करनी पड़ेगी. ESIC वापी में लगना है तो तैयारी करनी पड़ेगी. आपको गुजरात PSC में लगना है तैयारी करनी पड़ेगी. GMERS में लगना है तो ये तैयारी करनी पड़ेगी. IKDRC में नर्स बनना है तो आपको तैयारी करनी पड़ेगी. MSc करनी है आगे और गवर्नमेंट कॉलेज से करनी है तो भी आपको ये तैयारी करनी पड़ेगी. तो उस तैयारी को लेकर के 2 मिनट का ओरिएंटेशन है हमारी तरफ से. हम एक लगभग 6 महीने का ऑफलाइन और ऑनलाइन बैच चलाते हैं. ऑनलाइन बैच और ऑफलाइन बैच दोनों की जो वैलिडिटी रहती है वो अपने एग्जाम तक रहती है. नेक्स्ट एग्जाम जैसे IKDRC का है हमारा पैकेज, तो वो IKDRC तक लिमिटेड रहेगा आपके पास. हम जितने भी प्रिपरेशन करवाते हैं एग्जाम के उसमें हमारा मेन मोटो रहता है सेंट्रल गवर्नमेंट के जितने भी हॉस्पिटल और गुजरात गवर्नमेंट के स्टेट के जितने भी हॉस्पिटल्स हैं उनकी प्रिपरेशन करवाना. गुजरात गवर्नमेंट के, मैम नेक्स्ट आगे बढ़िए. गुजरात गवर्नमेंट के अंदर IKDRC आता है, GMERS आता है, गुजरात गवर्नमेंट के PSC का एग्जाम्स होते हैं. ये सारे के सारे पेपर्स की हम प्रिपरेशन करवाते हैं. गुजरात का एकमात्र ऐसा इंस्टीट्यूट, देखो चूज करने का आपका काम है, मैं सिर्फ बोल सकता हूं. गुजरात में 3 कैटेगरी के इंस्टीट्यूट चलते हैं कोचिंग वाले. 3 कैटेगरी के चलते हैं. हर कैटेगरी का आप समझ सकते हैं. एक वो कैटेगरी है जो आपको पूरी के पूरे 4 साल की नर्सिंग 2.5 महीने में पूरी करके दे देंगे, वी कैन से कचरा. एक वो इंस्टीट्यूट है जो बरसों पुराने से चल रहे हैं. आज आप क्लास लेने जाओगे तो आपको 3 साल पहले के डाटा बता देंगे कि दुनिया का सबसे ज्यादा होने वाला कैंसर कौन सा, वो 3 साल पहले का बता देंगे. एंड वी आर इनिशिएटिव स्टार्टेड ऑन अप्रोक्स 6 मंथ बिफोर. सारे के सारे आप क्लासेस डेमो लेके देखना. एवरी लाइन एंड एवरी टॉपिक इज वेरी अपडेटेड और एग्जाम में वही चीज पूछी जाती है जो अपडेटेड होती है. 2023 का पूछेंगे तुम लोग जो ऑनलाइन क्लासेस ले रहे हो, ऑफलाइन क्लासेस ले रहे हो, वो डाटा आपको 2019 का मिल रहा है, देन डेफिनेटली योर आंसर विल बी रॉन्ग. यस और नो? सो दैट. दूसरा, VS नर्सिंग एकेडमी का ऐप है, आप डाउनलोड कर सकते हैं प्ले स्टोर से. उसको डाउनलोड करके सारी की सारी डेमो क्लासेस डाल रखी है, उनको आप देख सकते हैं. दुनिया गुजरात का सबसे क्वालिटी कंटेंट देने वाला और सबसे सस्ता देने वाला आप देखना. उसमें प्राइस है, एक ऑफर प्राइस है 31 जुलाई तक. फैकल्टी मेंबर्स भी ले सकते हैं. और 3rd ईयर GNM वाले स्टूडेंट, 3rd ईयर BSc वाले स्टूडेंट, 2nd ईयर वाले स्टूडेंट, मेडिकल सर्जिकल नर्सिंग पूरी की पूरी उसमें आप डाल रखिए. आप अभी परचेज करें तो आपके 3-4 साल तक आप कॉलेज वाला भी पढ़ते रहिए उसमें से और आपके कोचिंग में भी काम आ जाएगी सारी की सारी चीजें. जब भी मौका मिलता है, टाइम मिले, पूरे दिन कॉलेज में क्लास लिए, सुबह शाम को घर आए, पता नहीं चला आज मिस्थेनिया ग्रेविस पढ़ाया, व्हाट इज द मिस्थेनिया ग्रेविस, फंडामेंटल ऑफ नर्सिंग में पढ़ा, TPR टेम्परेचर क्या होता है, टेम्परेचर कौन कौन से. अब एग्जाम में सवाल आते बड़े बड़े, कोर टेम्परेचर कहां से लेते हैं, मैडम नहीं पढ़ा. ये सारी चीजें आप कॉलेज में भी एडवांस कर सकते हैं और उनका बेनिफिट डेफिनेटली आपको कॉम्पिटेटिव में मिलेगा और एग्जाम में भी मिलेगा. शुरुआत जितना जल्दी करोगे अचीवमेंट उतना ही जल्दी मिलेगा. शुरुआत जितनी लेट करोगे उतना ही लेट मिलेगा. आपको पेम्पलेट मिल गया सारी की सारी. हमने एक ऐसा 3-4 पेजेस का पेम्पलेट डिस्ट्रीब्यूट किया है, उसमें आपको अपनी करियर अपॉर्चुनिटी डिसाइडेड करके दे रखी है। कौन कौन से पेपर होंगे वीएस नर्सिंग एकेडमी की तरफ से, कौन कौन से पेपर होंगे, कौन कौन से पेपर में क्या क्या क्वालिफिकेशन चाहिए, वो सारी चीजें भी हमने डिस्ट्रीब्यूट कर रखी है। अब पहली बात ये आती है कि हमें ये शुरुआत करने की जरूरत कहां पड़ी। पहली, मैक्सिमम गुजरात के बच्चे क्या करते हैं, प्राइवेट हॉस्पिटल में चले जाते हैं, 20-30 हजार की नौकरी करते हैं और जिंदगी गुजार लेते हैं। सेंट्रल गवर्नमेंट के हॉस्पिटल आपको 1 लाख रुपए, 90,000, 70-80 हजार रुपए सैलरी देते हैं, और उसमें आप गुजरात, अभी एक कड़ीवाला साहब कह रहे थे कि गुजरात में अब गुजरात राजकोट एम्स में 30-40 जने सेलेक्ट हो गए कि गुजरात से। आने वाले 4 साल में आप देख लेना, गुजरात वाले राजकोट एम्स में गुजरात के ही मैक्सिमम बच्चे मिलेंगे। ये 4 साल में रिजल्ट देख लेना ला करके। ये सारी चीजें तब हो पाएगी जब आपका भी कंट्रीब्यूशन साथ में होगा। सो मूव विथ अस, ज्वाइन अस। और है ना, ये यहाँ स्टेज और ये सब लाइव चल रहा है, गारंटी देता हूं यदि ढंग से हमारे साथ 6 महीने पढ़ाई कर ली तो नौकरी 500 के स्टाम्प पे लिख के ले लेना। आगे चलिए, ये फैकल्टीज है, आप लोग देख सकते हैं, सारी की सारी फैकल्टीज हैं। ऑल फैकल्टीज आर एक्सपीरियंस्ड। मेरी स्टूडेंट AIR फर्स्ट आई है, नॉर्थ साइड में ऑल इंडिया फर्स्ट रैंक। मेरे स्टूडेंट दीपिका, आप यूट्यूब पे सर्च करके देखना, अब की बार नॉर्थ साइड ये जो 4 का रिजल्ट है फर्स्ट रैंक करें, ठीक है। और मैक्सिमम मोर देन 300 स्टूडेंट, 2500 की वैकेंसी में 300 हमारे बच्चे, समझ सकते हैं आप इस बात को। सो रिजल्ट में नो कॉम्प्रोमाइज। दिल्ली की, जयपुर की, जोधपुर की सबसे बेस्ट फैकल्टीज आपको सेम प्लेस पे मिलेगी। शुरू इसलिए किया था, सब जगह बिखरे बिखरे थे, गुजरात वाले बच्चों के आसपास कोई नहीं थे। मैंने कहा सब मिलकर के गुजरात में भी एक चीज करते, और हमारे हम पैसे कमाना नहीं है। पैसे होता तो 4,999 में ऑनलाइन कोर्स नहीं देते। दूसरे वालों का देख लो, 10,000, 11,000, 12,000, 13,000, 14,000, क्या लूट मचा रही है यार। बच्चे स्टूडेंट है, उनको पढ़ना है, दुकान तुम वो कोई बाहर नहीं है ना। चलिए, विश यू ऑल द बेस्ट एंड गुड लक। थैंक यू तो बोल दो। चलिए, मैं एक बार थोड़ा सा, अच्छा, अगर सिलेक्टेड स्टूडेंट, ये सिर्फ गुजरात वाले सेंटर से, दिल्ली जयपुर वाले से नहीं, उनके देखोगे तो लाइन लग जाएगी, ठीक है। चलिए, थैंक यू JMD इंस्टीट्यूट फॉर गिविंग अस शानदार अपॉर्चुनिटीज, एंड वी विल मीट यू अगेन इन आवर सेंटर। बाय बाय, टेक केयर।
Thank you, sir.
So now, are you ready for the lunch? Okay, so we have the breakfast in the morning, the same area. You can go for the lunch and do come back on time. Thank you. Finish your lunch as soon as possible and do come back on time, right? So by 2:40, should be back. As we are going to begin the second session, please be seated. As we dwell deeper into the wealth of knowledge and the insights that this conference has to offer, it gives me immense pleasure to extend a special invitation to an exceptional faculty member who has demonstrated remarkable dedication and expertise in the field. Please join me in welcoming Ms. Selvina McQuan, Assistant Professor, JMD Institute of Nursing, to be the moderator for this significant nursing conference.
With her 5 years of experience, she has already showcased a profound commitment to advancing nursing education and practice. As our moderator for this session, we can expect Ms. Selvina McQuan to bring her unique insights, energy and enthusiasm to guide our discussion and create an engaging and informative experience for all participants.
So let us warmly welcome Ms. Selvina McQuan as our moderator. I would like to invite Mrs. Madhu Chavda, admin, to do the floral welcome.
Thank you, ma'am, for gracing us with your presence. We look forward to an engaging and enlightening session under your guidance. Over to you, ma'am.
Again, I request the student body to please be seated and to maintain silence. Volunteers, kindly take their positions and to maintain the discipline.
Good afternoon, everyone. I hope you all had your lunch properly. Yes or no? ખાધા પછી હવે એનર્જી આવી ગઈ? Okay, I hope you all are awake now. So, we are going to start our second session, okay, which will be goal and planning. I humbly request all the students, please make a silent and be seated on your designated place. Thank you all of you for your coordination. Okay, so for second session, I would like to call our Mrs. Rameshwari Jala ma'am. She is assistant professor currently working as a Manikaka Topawala Institute of Nursing. She has more than 14 years of experience in teaching fields. Okay, she is currently pursuing her PhD. She gave her excellent work in different national events. She worked in a different academics for giving her training and sessions. Okay, so I would request Mrs. Rameshwari Jala ma'am to please come forward and give your precious knowledge regarding our goal and planning sessions. Ma'am, the session is all yours.
I would like to invite Mrs. Bhumika Patel, Assistant Professor, JMD, Institute of Nursing, to do the floral welcome for Mrs. Rameshwari Jala ma'am. Thank you, ma'am.
Good afternoon, all. Okay. So we have learned regarding nursing assessment and nursing goals. This session is about nursing goals and planning. So talking towards the nursing goals, everybody is having a goal. What is your today's goal? What is your today's goal? Why you are here? Excuse me. So everybody is having goal. Without goal, nobody will come. Okay, we are here today for sharing the knowledge. And today's topic is regarding goal and planning. So first step of nursing assessment, second step is nursing diagnosis, and this is the third step. Okay, planning is the third step of nursing process. It should be deliberately done and it is a systematic one. Okay. So what is a planning? Planning is defined as a category of nursing behaviors in which client-centered goals and expected outcomes are established and nursing interventions are selected. Client-centered goal means we need to think each patient as an individual one. Okay? If we see motor vehicle accident patient and who is having a right hand injury, both the patient's nursing care and both the patient nursing center goals are different. So here in planning, you need to consider each patient as a unique one, and goal is a general one, and the expected outcome, it will be a specific one. We will see in a further session it. So what are the types of planning? Mainly 3 types of planning is there. First is initial planning. Initial planning means once the patient is get admitted and we do a planning is called as initial planning. So initial assessment. Initial assessment in emergency we need to perform as soon as the patient enters into the casualty. And in ward, initial assessment should be performed within half an hour of the patient admission. So initial assessment, what we do head-to-toe assessment if the patient has transferred from one hospital to another hospital and having the IV line and all. So we see that the patients are having any kind of infections or patients are having any kind of long-term illness which we cannot address or which need attention, that we will see. Second, in ongoing planning. So ongoing planning at the beginning of a shift, each nurse should do. And it is a continuous assessment kind of a thing. Here the nurse plans the care to be given by the day. Okay, so in an ongoing planning, once the patient is admitted today, so today the initial assessment of the time of admission has been done, and then once the shift is getting changed, the shift in charge nurse should do the ongoing assessment of the patient. Next is the discharge planning. So discharge planning, it is a comprehensive one. It should be started at first contact with the client, and it involves the comprehensive planning, means what will be the needs of patient after getting discharged from the hospital where the healthcare personnel are not present. Next is steps of nursing care. These are the main 4 steps we have. First is setting priorities. Second is developing outcome. Third is developing nursing orders, and fourth is the documentation. So setting outcomes, setting priorities. So once the patient is getting admitted into the hospital, they will be having a multiple need. Okay, so multiple need we cannot address at a time. So addressing one need at a time, we need to prioritize the things into a high priority, medium priority or low priority. So we will see one by one. Setting priorities. So it is a process of establishing a preferential order of nursing diagnosis and interventions. So once the patient is coming and you are planning nursing actions or nursing procedures, you need to prioritize. And basically here the nurses are frequently uses Maslow's hierarchy to prioritize the needs, and all the physical needs are getting a highest priority because as we count it as a like a example, breathing difficulty. It is a physiological need and which needs attentions. So all physiological need like air, food, water, they are basic to our life, and that should be addressed as a higher priority in the care. You can see the Maslow's hierarchy. This is the basic one, and the base, you can see it is a red line. Why it is red line? Because it should be a life-threatening needs, and if that needs are not fulfilled, the patient survival will be having a question mark. So first, breathing, food, water, sex, sleep, homeostasis and excretion, these are the physiological need, and that should be addressed once. Second is safety, security of body or security of employment, security of resources, morality of the family, health and prosperity. These are the second priority needs. These are called as a safety need. Third is a love and belongingness, like a friendship, family, sexual intimacy and all. Fourth is self-esteem, confidence, achievement, respect of others, respect by others. They are the self-esteem needs. And the highest is a self-actualization need, where morality, creativity, spontaneity, problem solving will come. We will take example of a person who is having epilepsy attack. So person who is having epilepsy attack and having a choking, so clearing of the airway, it is a basic need. Once the basic need is there, second is a safety needs, means the patient should not fall down from the bed, means having a side rail up. These are the safety needs. Then separation of that patient from the family members. These are the third one. That is a love and belongingness need. And then after that, the patient is having confidence to live with the epilepsy attack. It is a self-esteem need. And knowing the reality of the epilepsy will go into the self-actualization need. One more example we will take, that one person is admitted into a casualty having accident. The person, whatever the person is having a breathing difficulty or the person is having heart attack. So these are the physiological needs which need to be addressed. But the patient verbalized that I am worried about my wife. So that is a safety needs, that patient is worried about safety of the wife. Third is the patient is verbalized that I am having a separation from my children. So these are the third, love and belongingness need. So these kind of patients are admitted in a hospital with multiple levels of need. So as once the patient admit and you do assessment, you do interaction with the patient, you maintain IPR with the patient, you need to prioritize that which kind of needs you need to address first. What are the factors which affects the setting of priorities? Okay, so there can be a dilemmas because we have seen we need to address the physiological need, but still there are some points like a patient's health values and beliefs, patient's priority, then resources which are available to the client and the nurse, urgency of the health problem and medical treatment plan. So once these factors will be having a attention, and then only the needs will be prioritized. Second step is developing outcome. Developing outcome means the outcome is also referred as a goal, and it is also written as a behavioral objective. So nurses try to achieve goals by implementing nursing interventions. So nursing interventions are nursing actions or nursing procedures, what the nurse do for the betterment of the patient. So here the goals are a general statement or a general description, whereas expected outcomes are a specific one which describes what will be observed in the client after care is done to show the benefits of the nursing care. So here we will see example how it should be written. So problem of the patient is ineffective airway clearance. So general what we write goal as a achieve airway clearance. But if we wanted to write an expected outcome or desired outcome, so lungs will be clear to auscultate during entire post-operative period. The second example, like a impaired nutritional status is a problem. The goal, it is a general one, improve the nutritional status. But if I wanted to tell in a expected outcome, so it is a very specific that what amount of weight you are gaining within what amount of period. So today is a 22nd of July. So 5 kilogram weight gain within August 22. So 1 month में आप 5 kilogram weight बढ़ाना चाहते हो या 1 kilogram weight बढ़ाना चाहते हो. Okay. So goals are a very general statement. Okay. And expected outcomes are very specific one. So what are the purpose of goal and desired outcome? Why it should be written? So it provides a direction for planning nursing intervention. When you write your expected outcome, when you write your goal, when you have goal for your life, then you have a direction where to go, what to go. Because all of you right now you are doing a GNM, BSc courses. Then after some will have a desire to work in a government setting, some have desire to go in a abroad. So as your desire, your goals are there, then you will be working towards to achieve your goal, and that will create your a planning path. And so one by one, once you achieve, you can able to reach to near to your goal. Second, it serves as a criteria for evaluating client progress. Means you can see how much my patient is better, or again what other things I need to put into practice. Next, it enables the client and nurses to determine when the problem has been resolved, and it helps to motivate the client and nurse by providing a sense of achievement. Here the client progress will vary as individual is having a different system, and all individuals are unique one. Suppose all patients, 2 patients are there, they are suffering with a respiratory infection. One patients are getting betterment because the patient's willpower is very strong. But the second patient is having some kind of emotional trauma, and that patient's condition is becoming more worsen and worsen. And I think you might have seen these kind of things in a COVID scenario. The persons who are having a good willpower, they are getting recovery from the like adverse infections, and the persons who are having not good willpower, they are getting worsened because of their emotional stress. Next, the types of goal. The name itself, it suggests that short-term goal and long-term goal. Short-term goal is a time frame. Short-term, when the patient is there with you in a hospital, you plan. That is called as a short-term goal. Long-term goal, here we are planning that goal for the betterment of the patient, and that can have a duration of 3 months, 6 months, 9 months or 12 months. So short-term goal, here client will achieve comfort within 24 hours after post-operative period. And in long-term, client will adhere to post-operative activity restrictions for 1 month. The components of goal, there are mainly 4 components of goals are there. First is a subject or noun. So here it can be a client or some attribute related to a client. Then second, component is a verb. So it is an action the client needs to perform, okay, or your patient needs to do. Third component is condition or modifier. Condition or modifier is a specific action and it is added to verb to explain the circumstances of the patient. And the fourth one is criteria of desired performance. Here it is the standard by which the performance is evaluated. So example is like a client drinks 2500 ml of fluid daily. Daily means you can write within a 24 hours. The second example is client administers correct insulin doses using aseptic technique. This is a quality standard, because when you teach the person who is having a non-insulin dependent diabetes mellitus, and they need to take insulin as a daily basis, and they are verbalizing that they don't want to take insulin from health team members, but they wanted to take by themselves, and you are teaching them the procedure, and then after they perform. So here a quality standard kind of a goal you can write. The third example is client performs leg range of motion exercise as a taught, and every 8 hourly the person is performing that. So there are 4 components of goal. What are the components that is applied to your life also? So first is subject, second is verb, third is condition or modifier, and fourth is expected criteria of expected outcome. So these are the verbs. We call it as an action verb that you can use to write your goal, like apply, assist, breathe. Suppose if I'll tell teach insulin injection technique to the patient. So teach is a broad term. Okay, it is not a specific one. But if I use a verb demonstrate, means you are demonstrating in front of a patient the techniques. Means first and foremost you need to tell them what is the titration, how you need to do a titration, means how you need to take the insulin from that vial to the syringe, and what is the desired amount of international unit the person has to take, because all the persons are not having the same units. So these are the terms, verbs, action verbs that you can utilize while writing a goal. Okay, I think you will get a PPT, so you can note down this. Next is a guidelines for writing a desired outcome. So desired outcome should be written individualized one. Okay, all persons are having a different need, so it should be a client oriented. It should be a mutual one. Okay, mutual factors are there, because it should be decided between the nurse and between the patient. And you can write that word. The acronym is like a SMART. It is a specific, measurable, achievable, relevant, and time bound. Specific means it is a very specific one. Suppose if my goal is there, I want my patient's vitals to be normal. So if I write my patient's vitals to be normal, it is a very general and very broad term. But if I want a specific one, because my patient is a hypertensive patient, so I will write my goal as the patient blood pressure should remain as a 120/80 mm of Hg. So that is a specific one. Next is a measurable one. Measurable one means you can measure it. So measurable one means it should be have a number. Suppose if person is having a pain, and you will write your goal that the person's pain will get reduced after giving comfort measure 6 out of 10. So, but I wanted to measure it. What is the progress of pain level of the patient? So you can write that 50% of pain will be reduced in my patients after giving a comfort device. Next is the achievable one. Achievable means it should be a realistic. The goal what we write, it should not be in a vacuum, or it should not be in a sky. So the things what you write, what you put into action, that can be measurable and that can be achievable. So achievable goal means all the nursing actions, like if you are wanted to teach regarding the insulin injection technique, so nurses will write that not in a one thing. First you will write, suppose first you write that the titration of the insulin should be taught. Then after you need to taught the site of the injections, where and all the person can take. And third one is the technique, and fourth one you need to teach them how many intervals they need to change the site, and why, what is the importance of changing the site. Because if you will give insulin injection with the same site for more than 6 times, then there the pus formation or necrosis will start. So that things we need to teach to the person. Next is a relevant. Okay, that relevant means the whatever the goals you are writing, that should be relevant to the patient condition. Suppose my patient is having a breathing difficulty and I write that my patient will have less amount of intake. So that is not suiting to the thing what I wanted to write. And next is a time bound. So it should have a time frame, okay, like within a 6 months, within a 24 hours or within a 6 hours or within a 12 hours, the person should achieve it. So the goal should be written in a smart format. Next is the classification of desired outcomes. So desired outcomes can be classified in a 5 major aspects. First is the appearance and functioning of a body. Second is a specific symptom. Third is a knowledge. Fourth is a psychomotor skills. And fifth is the emotional status. So appearance and functioning of a body, you can write that how, you can write like a person who met with an accident and then they are losing the body part and then they are verbalizing their feelings. So how they feel, like if you are talking with an amputated person, and what is the feeling of a person, that is the appearance and related to functioning of the body. So they are having a limited amount of body functions and how they are going to meet their daily needs. Second is a specific symptom. So specific symptoms, the symptoms will be like a nausea, vomiting, pain. But once the patient is having a pain, so where the pain is there. So, and then once they show the pain, that pain will have a different treatment and you will categorize that pain into a visual analog scale. Knowledge, here knowledge means all health education. Each patients are having a different kind of health education plan, and hope you all are nursing students, so you are planning a different kind of health education after your nursing process or nursing care plan to the patient. But what we are writing, that is a copy paste from A to Z. It should not be like that. It should be a patient specific. It should be a client oriented. Suppose if one person is there admitted with X symptom and one person is admitted with the same kind of a X symptom, but the priorities are different because the age difference will be there. Suppose adolescent is admitted into the hospital and one person who is earning, they are admitted into the hospital, their needs are different one. Okay, so they should have the knowledge regarding that patient's condition. Psychomotor skill. Psychomotor skill means your hands-on skill, what you wanted to teach to the patient, because simple procedure, ORS preparation. Okay, we teach with the standard formula and we teach same thing in the community also. But what the things we are teaching as a sterilization of the utensils and taking the complete amount of measurement, did everything is followed same what you have taught? So once you are teaching a psychomotor skill, if it is a short one, you need to have a complete observation skills. You need to take a demo from your target audience and then you need to test them. Yes, whatever the content or whatever the skills you are delivering, they are delivering with the same kind of thing. Suppose you have entered into a fundamental lab and you are doing a cardiac bed. So first your teacher have demonstrated you and now you are doing a re-demonstration. You yourself can do an introspection and you can identify how many mistakes you have made. It is very easy to observe anybody, but once you perform, then you will come to know what is my limitations. Okay, your teacher will be doing a very smoothly everything, but once you will touch to that things, you will come to know what are the difficulty levels. And then after doing a practice and practice, you need to come out from your psychomotor skills. Next is the emotional status. Emotional status means everybody, once they get admitted into the hospital, they'll have a low self-esteem. They'll have anxiety to the hospital environment. Some will have a financial burden also. So you need to identify that what kind of their emotional status is there and you need to address. Nowadays, all are having a multidisciplinary health team approach. So social worker, they are the part of the health team and they can help the persons who are having the financial burden. They'll have a contact with the non-governmental agencies, NGOs, and they'll come out from the situation. Next. Next is the third step, developing nursing orders. So nursing orders or nursing interventions are the actions that a nurse perform to achieve the client goal. It can be starting with the personal hygiene care, giving a comfort device, and doing a assisting in the advanced procedure also. So nurse chooses intervention to treat the signs and symptoms like a pain. For pain, you give a position, you give comfort device, and then after you go with a medication. Then interventions for risk nursing diagnosis should focus on measures to reduce the risk factors of the client. Suppose your patient is having a risk for a septicemia. It happens mainly in the NICU. Who have worked in the SNCU and all, they know the persons who are just preterm, they are having more and more risk for having a septicemia, because as a healthcare team members, we are not performing good aseptic technique. So once you know that I have 2 or 3 preterms in my nursery, I need to perform good hand washing, and I'll allow my all health team members to do a surgical scrub, and then after they need to touch to the babies. 3 types of nursing interventions are there: independent nursing interventions, dependent nursing interventions, and collaborative nursing interventions. We'll see independent nursing interventions. So independent nursing interventions, these are the actions that the nurses are licensed to initiate on the basis of their knowledge, skills, and their experience. And it is also known as a nurse initiated interventions, like a physical care. If you see the person is untidy, the person unit is not good, so all personal hygiene care procedures you can do, plan, like a combing the hair, giving a eye care, giving oral care. Next, ongoing assessment. The doctor has written that quarterly you need to give a paracetamol injection, but you have taken the vitals and you found that continuously for more than 16 hours the person is not having temperature. Then you can plan, you can skip, you can inform to your physician that the person is not having fever, so that injection I will not give. Then emotional support and comfort. Okay, emotional support and comfort means that is having a therapeutic techniques of therapeutic communication. As first and foremost, active listening is a technique of therapeutic communication. So once you develop a technique of listening to your patients, the patients will come out from more kind of problems that is not noted in the case sheet also. Next is the teaching. That is a health teaching, ongoing teaching, talking to the patient, family members, all the way how you are having a good IPR with the patients. That kind of patients will come show the problems, and that many things you can teach to the person. Then counseling part. If they are having anxiety, stress, all the patients, we should not tell that the persons are not having anxiety. Even we as a normal human being not admitted into the hospital, still we have some kind of anxiety and fear. Then referral to the healthcare professional. So if some specific conditions are there, then you need to refer to the patient to the specialist one. So these are the independent nursing intervention. Next is dependent nursing intervention. So here these are the activities which carried out under the physician's order or supervision, and it is also known as a physician initiated intervention. So all kind of medications or medication doses you give under the physician order. Then all treatment plan, intravenous therapy, diagnostic test, diet, and activity. Suppose your patient is having a diabetes, and the physician has written that 1500 kilocalorie per day. So here dependent intervention means you need to consult to your physicians, and then again you need to have a consultation with a nutritionist, and then after you can plan the menu for your patient. Next is a collaborative intervention. So collaborative intervention, here the actions that the nurse carried out in collaboration with other healthcare team member, like a physical therapist, social workers, dietitian, and physician. The person who is having a shoulder dystocia underwent with the surgery, and then the doctor has written that they need to have exercise for 3 times a day. So you need to consult a physiotherapist, and whatever the exercise the physiotherapist is teaching to the person, in a first week the physiotherapist will come and assist the persons to do the exercise, and then after in the second week onwards, if the patient progress is good, the patient will take over charge of that. Otherwise, the physiotherapist will tell, sister, you are there in a shift, please see that the person can able to do. Because the effect of the surgery will come once the person performs the exercise in a good manner. Because the range of motions, once they are not able to perform good, then they'll have a permanent, either permanent deformity in that particular part. So these are the examples of nursing interventions, mainly independent, dependent and collaborative. Okay, next are the components of nursing orders or intervention. So mainly 5 components are there: date, action verb, content area, time element and signature. So we'll see date. Date means particular date. To confirm, it is not a past date order. Okay, we need to confirm it is today's order only. For the confirmation, we require a date. Action verb means what to do. Palpate. We know inspection is there or palpation is there. So you know that what are the techniques you need to do. So action verbs are necessary. That is a specific action what you need to do. Content area means here in a content area, what, where, which, when, how and how much. These questions you need to ask to your content area. Suppose dress the wound is the nursing order. Dress the wound is the nursing order. It is a very general term. Okay. How many wounds the person is having? Where to dress? What kind of dressing ointment I need to use? When to dress? How many times per day I need to do a thing? So this is not a complete goal or a nursing order which is not in a complete one. But if we write that dress the incisional area on abdomen part with the spirit and povidone iodine 8 hourly, then it has what, when, how much and when. Okay, so that should specify, content area should give a complete information, what things you need to do, when you need to do, where you need to do, how you need to do and how much you need to do. Next is the time element, means it shows that what is the frequency of the action, and then the signature. Okay, it will save the nurses, and for the documentation and for the authentication of a nursing order, the signature is must. What are the characteristics of nursing order? 3 main characteristics is there. Be consistent with the plan of care, what you have planned. Okay, so suppose you have planned injection, you have planned a sponge bath procedure, or suppose you have planned a back care procedure. So you need to stick to that plan and you need to show that what is the rationale of that nursing action. Okay, why you wanted to perform that action. Then next is based on scientific principle. All the nursing actions, when you study your nursing foundation, each step is having a rationale. Suppose we wanted to give injections, but before that why we need to swipe the injection site, and for that 2 rationales are there. That rationales we need to apply for each and every nursing actions and nursing procedures. Next, be individualized to the specific situation. Okay, suppose both 2 persons are there. 2 persons are having a continuous bedridden. One person met with a motor vehicle accident and another person is having continuous bedridden due to aging process, and the person is having a paralysis and all. So whatever the actions you are planning, that actions will be different one. So for a person who met with an accident, you can have a foam mattress, you can have a trapeze so that the person can have a movement change. But in an old person, you need to have a water mattress, you need to have a side rails, and you need to have a like a bony prominence are there. For that you need to apply a lotion 4 hourly. Okay, so both are a bedridden person, but the care, the plan is getting changed one. Next, for this documentation. So documentation in planning phase is accomplished by recording nursing diagnosis, outcomes and nursing orders. For each and everywhere, once you do action, then after you need to record it. Nursing care plans are the keystones of nursing care, and nursing care plan is a document containing statement of nursing diagnosis, outcomes and nursing order in an organized manner. And the end product of the planning phase is the nursing process, that can be a formal or informal nursing process. what will be the structure of nursing care plan? So the nursing care plans are supplemented using a Cardex. Cardex is a one kind of a briefing document you can see on a desktop in your unit area, which shows how many patients you have and what is the problem of the patient and what is the treatment ongoing, what are the diagnostic criteria. Okay, it is a summary of the patient. It is a Cardex, and the diagnosis, outcomes and orders are directly written on the Cardex. But the diagnostic test, treatment are recorded on the Cardex as a specific area. This is an example of nursing care plan. So nursing diagnosis, client outcome and nursing order. So nursing diagnosis, here the nursing care plan for a client with a right side hemiplegia. What is hemiplegia? Group, what is a hemiplegia? Are you all awake? So what is hemiplegia? What is hemiplegia? Anyone? No? No? Very good, very good. Okay, so diagnosis we have made is potential injury related to visual change, decreased sensation, confusion on right side. Okay, paralyzed patient is there, I need to use my right hand or I need to use my left hand because they are the right-handed person for more than 50 years of their life. So client outcome, experience no injuries throughout the hospitalization. Okay, our first ethical principle, we need not to harm our patient. Nursing orders, keep frequently used object on unaffected side, that is the left side. Approach client from left side, teach client and family to safeguard right side of body with diminished sensation from heat, cold, pain and pressure, and use side rails. If same patient is having a paralyzed hemiplegia in a left side, your plan is getting changed one. Okay, you are getting? Okay, there are mainly 4 types of nursing care plans are there. Student nursing care plan, standardized care plan, individualized care plan and computerized care plan. Individualized care plan, these are the client or individual specific. Suppose you are having a patient with myocardial infarction, the care plan will be written only for that person because that patient's troponin I is not will be same with the other patient who are having the MI. Okay, so that is called as a individualized care plan. Next is a standardized care plan. So standardized care plan, here you are making a care plan for group of a patient. Means example, a group of a patient who are having fever. So you will write a standard actions for that. That is called as a standardized care plan. Next is a student care plan. What you all are writing? How many steps you have in your care plan? It is a lengthier nursing care plan having a steps of assessment, nursing diagnosis, goals, planning, rational. Planning you have done, but you need to plan with a rational intervention, implementation and evaluation. Okay, so you will have a 7-step in your care plan. You will have a intervention and rational, you will have planning and rational. Okay, either one as per your college policy you can write it. But the core of the subject is like that. The student nursing care plan is having a 7-step and each step will have a scientific principle why you have planned it. The last one is a computerized nursing care plan. It is a combination of individualized care plan and standardized care plan. Here you will have you can find a mixture of a specific condition and a general condition or a group of a condition. Okay. Okay, here we comes end to my session. Today we have learned regarding types of planning. So mainly 3 types of planning is there. Ongoing planning, initial planning and discharge planning. Steps of planning, there are mainly 4 types of step is there. Setting priorities, developing outcome, developing nursing orders and documentation. Thank you. Now, if you want to ask me any question, the forum is open. Any query regarding planning, writing nursing order or having care plan issues? Okay.
Students,
Thank you.
do you have any queries? Okay, so after the completion of session, I guess ma'am have taught really well. So students or faculties don't have any queries. So I really appreciate for giving your time to us, ma'am, and give your precious knowledge and your time for giving your knowledge and sharing your thoughts with us. Thank you so much, ma'am. Now the mic is on.
Thank you, ma'am.
Thank you so much, ma'am. I would like to invite Mrs. Chilka Patel, nursing tutor of JMD, to felicitate Mrs. Rameshwari Jala.
Thank you so much, ma'am.
Listen, group, what the planning we have learned, this is for the nursing care plan. But same things and same steps can be applied in a real life situation also. Okay? Thank you.
I hope everybody have a beautiful session on planning and goals. Now I'd like to invite Professor Mrs. Divya Jiji, Principal JMD Institute of Nursing, to come forward to felicitate Dr. Rajesh Sabara as for today's GNC observer and a member of Genera. Please do welcome, sir. Thank you so much, sir, for joining us for today. Thank you, ma'am.
Thank you, ma'am. Now we will have our sponsors short video on nursing education tours and travels that run by Mr. Ranjit Bhai. Thank you.
We are now proceeding with the third session. It is a great pleasure and privilege to extend a warm invitation to an esteemed educator and leader in the field of nursing to be the moderator for this session. Please join me in welcoming Mr. Jayesh Jain, Principal, GSC College of Nursing, Ahmedabad.
With a remarkable reputation and wealth of experience, our esteemed sir has been an influential figure in shaping the careers of countless nursing professionals. He embodies the spirit of knowledge, compassion, and dedication that exemplifies the best in nursing leadership. His vast experience and expertise in nursing education and practice make Mr. Jayesh Jain is the perfect choice to moderate the session.
We are certain that under his guidance, this session will be a stimulating and engaging experience for all participants with valuable insights and fruitful discussion. Please join me in giving a round of applause to welcome Mr. Jayesh Jain to lead this session with exceptional guidance and expertise. I would like to invite Ms. Hemangi Prajapati to welcome Mr. Jayesh Jain to the floral welcome.
Thank you, sir, for gracing us with your presence. We look forward to an engaging and enlightening session under your guidance. Over to you, sir.
Good afternoon, everybody. First of all, I would like to thanks to Madam Divya for inviting me here for this one-day conference. Now it is time to invite our special guest of the expert galaxy today, Dr. Binu Joy. Sir is the founder president from Nursing Scholar Society. He is having more than 20 year experience. He is PhD in pediatric. He has completed MBA in hospital administration. He has done diploma in naturopathy and yoga, diploma in computer application. He has done national and international certificate for different nursing courses. He has published 20 papers in national international journals. He has published more than 5 books. And he is the member secretary in Ethics Committee, Clinical Nursing Research Society of India, CNRS, founder president of Nursing Scholar Society. He is the life member of TNI, NTI, CNRS, and life member Neonatal Nurses Association of India. Sir, JMD welcomes you. Please come forward and share your views.
I would request a moderator, Mr. Jayesh Jain sir, to floor welcome Dr. Binu sir.
Warm namaste, greetings of the day to one and all. Greetings to all the JMDN, the leader of the JMDN, the leader of JMDN, Divya ma'am, and all the beautiful nightingales and dear student nurses. Yes, it's very, when we are with the nurses, it becomes an energy. My work and my role is very simple because the legends and from the government of India, the legend of Gujarat, Iqbal Kadiwala sir, all have made my work easier. Two beautiful speakers, two young energetic speakers, they have completed my part. My part is only what they have told, we have to put in action. What these two beautiful personalities from morning onwards they were speaking, the advisor, Government of India, Deepika ma'am, She told the quality. So whatever we have studied till now, whatever we have covered, we have to implement. If we don't implement these all things, then that education is not over. So quality completes when we perform. Can you, next slide. Okay. Okay, so implementation is a part of a nursing process where the three things are applicable. It's an action oriented. You have now to perform. It's not a time to sleep. It's time when we start planning everything. We have formed the nursing diagnosis. We have gone through the assessment, diagnosis, planning has been done now. Our work starts now. We all have to work in the battalion. The Nightingale started with the lady with the lamp. She did work in the very dedicated zone of a criminal. We have worked in the COVID-like situations. So that demand is here. So we have to be very action-oriented, the client-centered, and outcome-directed. So whatever we are doing, it is for the benefit of the patient. Without that, I don't think we cannot survive. An institute does not survive without you all beautiful faces. Same way, I cannot survive with a beautiful patient. So that also we have to think. So we should be very patient-centered. Without client, after all, we are studying for the patient. The life is very important. Life is very precious. Once the life goes, then only that worth is available. So should be very outcome. So based on the assessment, diagnosis, and planning phase, the nurse implements the interventions and evaluates the desired outcome. It is an action phase where the nurse performs all the nursing interventions which we have planned. This stage is basically consists of doing. Here the action speaks louder than voice. But whatever you do, lastly we have to document it also. So it is a performance phase of nursing intervention necessary for achieving the goals. We have laid down our goals. The goals may be short-term, long-term goals, but our ultimate aim is to achieve that goal. So it's a treatment based on clinical judgment, sound knowledge that a nurse performs to enhance the patient outcomes. We should have a sound knowledge. Then only the sound practice can come. We cannot only not tell that the practice is enough. Sound knowledge is the foundation of a sound practice. So both is needed. So in fact, it is a fourth step in the nursing process in which nurse utilizes a knowledge and skill for giving a planned nursing care. It is a process where we put the planning into action. It consists of doing all the activities of daily living, counseling, teaching, and supervising. The basic purpose of this implementation is to provide the technical nursing care. We have to provide the care to the patient. We have to start working. We have to be very therapeutic, to provide a very therapeutic nursing care because they have come for us to treatment. So we have to provide them a proper care to help the client an optimal level of health which consists of physical, mental, holistic health the patient should achieve. So these are those activities which are performed by the nurse and the client to prevent illness, to promote, maintain, or restore health. A variety of interventions or variety of planning can be done. There are various nursing interventions which then the nurse can perform. It will be totally nursing, like directly performing an activity, example, giving a bed bath, assisting the client in performing various activities such as range of motion exercises, supervising the client who performs an activity in steps, doing deep breathing exercise. So interventions are either we teach them and see that they are doing. It's a nurse initiated interventions. So basically when we start interventions, basic 3 skills are very much necessary to do in the implementation. So implementation consists of basic 3 skills which the nurses should have. That is cognitive skills. Cognitive skills, as the word suggests, we should have a sound knowledge. Our knowledge should be background will be strong. Whatever knowledge we should have, we should always have the scientific principles. Because whatever planning has done, why we have done. The question should arise always why. Why I am doing this. Sound knowledge with sound scientific principle is the cornerstone of this. So cognitive skills very much necessary. Interpersonal skills, yes, of course. Nursing peoples are 7 into 24 hours with a patient. 7 into 24 hours you are going with the patient. So of course we have to talk with many supporting agencies. Without talking we cannot help. So we have to be very, talking is very much important. So we should develop interpersonal skills like verbal, non-verbal skills, and a proper therapeutic communication needs to be established. Yes, of course. You cannot, nowadays of artificial intelligence have also come up. So of course, we need to have a technical skills. Knowledge of modern technologies is very much necessary to make the work easier. So in short, the cognitive skills are problem solving, decision making, critical thinking, and creativity skills. Interpersonal skill consists of verbal, non-verbal, and therapeutic communications. Technical skills, specifically manipulating new equipments like new syringe pump, mechanical ventilators, giving injections, bandaging, performing various exercises, moving, lifting, or position change. So these technical skills you should have. How to do the bed making, how to keep the principles of motion and all, how to perform the range of motions without using less amount of energy with proper scientific principles. Now basic steps of implementation. There are 5 steps of implementation. First is to reassess the client. Again, we should start from where? We should start from the first assessment phase. Again, it's before doing any work, it is best once more check it. There is no problem to check again whether we are right or wrong. Because once you do, if it is done wrong, then it is wrong. So it is best whatever we have reached till assessment we have done after assessment, based on assessment, we have made nursing diagnosis, then we have made objectives, then we have made planning, then we are going to implement it. But it is best, again, take 3 steps back. There is nothing harm to make a full stop in your life. Only it is not best to go ahead. It is always best to see sometimes past also, because past is also giving us experiences. So here we have to again reassess. 2 steps backward will not harm. It is best let the seniors go or whatever. We can take 2 steps back. There is nothing harm in going 2 steps back. So reassess the client, reassess the nursing diagnosis. Go again that. Determine the nurse's need for assistance. किसी की मदद लेना कोई दिक्कत वाला काम नहीं है. मैं खुद से कर लूँगा. Nothing can happen. Together we can. Alone we cannot do anything. Together 100% we can. That should be our aim. If when we are together, then it is good. I cannot do anything. It is your smile and all thing. My beautiful 2 angels of the divine profession were the first speakers. So without them, I would have not done implementation and evaluation. So it's together we can. So implement it, determining the nurse need for assistance. How much assistance I needed? I needed the assistance of 2 speakers in front of me. If I have come and directly taken the implementation and evaluation, so it is how much assistance you need. Like caring of the patient. Like I want to do an IV cannulation. If there are 3 nurses available in the team, sister, please come. It's nothing harm to take them. You may be expert. You might have worked 10 years, 15 years. There is nothing harm once you take someone. They will help you out. So determining how much the need for assistance. Then you implement the nursing interventions, whatever you have planned. Supervising the delegated care. Now we will tell, like we conduct a big conferences. That time what we'll do, please, you look after reception committee. Yes. Now sometimes any problem happens. Sorry, I don't mean for any reception committee. Don't feel bad. I'm just telling an example. So sometimes after the conference, if there is any fault of the reception committee, then you should not tell, no, I have given to that committee. No. As a leader, all leaders should see, if you have delegated also, we have to check it. It is supervision is necessary. If you have delegated some task, some junior nurses or someone, please give this medication to the patient, but it is also the responsibility of the charge nurse that you should see that the patient has received that medication. After receiving, it has been documented. So supervise the delegated care. Then lastly, the documentation is very much necessary, because if you don't document and you tell I have done it, it is not worth. In short, the nursing process consists of assessment, diagnosis, planning, implementation, and evaluation. And so first we do is reassess the client. Before implementing, nurse must reassess the client. Every order written on the care plan, the client's conditions may have changed. For example, I've just quoted a patient with an example, Mr. Anil, who has a nursing diagnosis of sleep pattern disturbance related to anxiety and unfamiliar surroundings. Now, this was a diagnosis made. For this diagnosis, there might have been many plans. One of the plans was there to give a back massage to this patient. Now, when you are going to implement back massage on this patient, you see that this patient is comfortably sleeping. Now, is there a need to that? So, reassess what planning you have done. You are planning done for a back massage, but when you are going to do the back massage, you found that the patient is sleeping. So, you should not do it because the patient has achieved that sleeping pattern, is comfortably sleeping. Hope here no one is sleeping. Okay. Determine the nurse's need for assistance. When implementing a plan, nursing nurses may require assistance. For example, if we have a plan to ambulate a client, now you see a client is very obese, so you need the help of other colleagues. Like me, like nurses of my weight is of 20 kg. If I am able to lift a patient of 80 kg, then it is very difficult for me. So it's best to take a help of a team members. Together we can. So position change, comfortable position, extra, whatever work you are doing, what assistance needed, it is best to ask all. The nurses lacks the knowledge or skills in implementing a particular activity like IV canalization. If you are lacking something, it is not harm. It is best that the patient receives the best care. There is nothing harm before asking any help from someone. Okay. Implementing the nursing actions. So what actions you have planned, now implement it. When implementing the nursing actions, we need to follow certain guidelines. Nursing interventions should always be based on sound knowledge, sound principles, based on sound nursing research, high professional standards, and high professional etiquettes needs to be maintained. Nurses must be aware of the scientific rationale and the side effects or complication of all your intervention. So whatever you are doing, what is the rationale behind it, why you are giving some medications before food, you should have that rationals. You should have a sound knowledge of that particular thing. Encourage the client participate actively during implementation. So whenever the patients, we do any care, it's always our aim for a patient is to make from a dependent to independent. Always our aim, whenever we care a patient, that the patient comes out from dependency stage to become independent. He has to become independent. So always we should promote their help. Like if a patient, you are planned for a mouth care. Now you see if the patient is able to walk, whether we should give the mouth care. If the patient is able to walk, it is best you educate them. Morning you have to take mouthwash and you should tell them. So determine that also is very, encourage the client to participate maximum in the interventions. Supervising a delegated care, if you have delegated some of the responsibility to your colleagues or friends, see that it is your responsibility. You cannot simply tell, I told them. That cannot be done. As you responsible, you have to complete that task. Document the nursing activity. Whatever you do, it is not worth if you don't document it, if you don't put it in records. Everything needs to be recorded, then only that things can happen. So the nurses must complete the implementation phase by recording the interventions. The client responds properly in the notes. Immediate recording helps to safeguard if there is any double time, any error, or prevent double actions. If you don't record, as the shift duty changes, other nurse also will go and do that same activity. So it's always best to document so that while the charge, if that has been not told, then also by seeing the notes that our next staff can come to know this is already done. Implementation means doing. Here, as I told, actions speak louder than voice. Here you have to start working. It's not a time to only listen. It's time to start working on what you have studied. So we should see that. For example, a patient with an hypertension, here I've just taken out, teach a client with hypertension. You cannot cure the disease of hypertension. It is going to be a chronic disease and a lifelong disease. So we have to educate them. Yes, of course, your disease is going to be chronic, but yes, of course, with certain modifications in your lifestyle, dietary patterns and all, it can be 100%, it can be controlled. But you have to be strictly educate them. Like we need again and again education. Even you have this nursing process, it's a very academic based topic. So you all have studied, but again education is must, so that again and again you refresh that things. So remind the client to continue give medication even there are no signs and symptoms. And all these weight reduction, smoking cessation, increasing activity can be taught to the patients with hypertension. This is an example of implementation phase, like an example that acute pain in urethra in a client with urinary tract infection. So in a planning state, we have assessed pain, noting the location. We have to locate the location, intensity in the pain scale, and the duration of the pain. So in the implementation phase, we can find out that the client complains the burning pain in urethra. So during the process of micturition. So the location is urethra, and the level of pain is 5 out of 10 in the pain scale, and the pain duration is 15 minutes. Encourage to increase fluid intake and monitor intake output. So in implementation, we have seen that we have encouraged the oral fluids, and IV fluids has been started. So whenever you administer IV fluids, it is our moral responsibility to monitor the intake output chart. So how much time they have drink, that much time you have to note in the intake. And whenever the intake is monitored, output also should be monitored, so that the patient does not go in overhydration, also in dehydration. So both concepts, we need to properly monitor the intake and output chart for the whole 24 hours, and needs to be recorded. Observe changes in the mental status, behavior, and the level of consciousness. So we have to monitor what are the blood level values, electrolytes, uremic levels, like urea is 18 milligram per deciliter, creatinine, client has normal mental status, behavior. So all needs to be properly implemented. What plan you have done, you have to do it. Next, so in short, implementation basically consists of first reassessing the client, determining how much the nurses can do it activity, supervising the delegated care, and then documenting the nursing findings. And then final step of the nursing process is evaluation. Evaluation is a final step. Means we are now evaluating each step. Evaluating each step. Evaluation means actually I can tell it's, you can just change that name, it is re-evaluation. Evaluation is re-evaluation. Re-evaluation of assessment, re-evaluation of nursing diagnosis, re-evaluation of planning, re-evaluation of implementation, and then lastly coming to evaluate that whether the program is successful or not successful, whether the patient has achieved or not achieved, whether the patient has recovered or not recovered. So evaluation is based on your sound clinical judgment, sound knowledge. If you have a sound knowledge, then you can correctly evaluate the patient has become normal, patient has attained at least a short-term objective, or patient has achieved this much. So how much level of that has achieved, that needs to be noted down. So it is in general, it's the fifth step of the nursing process, follows the implementation of the nursing care plan. The nurse determines and check whether the plan of nursing care has worked or not, whether the goal is achieved or not achieved. So it involves to check the outcome of care, whether the objective, what the objectives you have made, the short-term objectives, the long-term objectives, whether it is achieved or not. If it is achieved, means you are in a positive side, then stop that care plan. You have achieved it, so stop. If you have not achieved, again reassess where you were wrong, which stage, whether a wrong diagnosis has been made, or a wrong planning has been done, or there is some mistakes in implementing. So we have to recheck and again remodify and do the care plan accordingly. It is a continuous process in which the nurse assesses and reassesses the program patient have made towards the achievement of pre-established goals. So evaluation is what the goal you have planned, that this patient should get this goal, or this is the objective of this patient. So whether it is achieved or not, we are checking. So basic purpose of evaluation is to make the collection of data for making judgments about the nursing care delivered. So in evaluation, again, we are collecting the data and then finding out whether the objective is achieved or not. Determine the client's behavioral response, how they have reacted to all your interventions, what you have done to the patient, how they have reacted, whether they have reacted positively or not, whether they have recovered or not recovered. Compare the client's response with predetermined outcome criteria. Predetermined outcome criteria is your objective. what objective you have made for that plan. So whether that is achieved or not, how much client responded, how much the client has achieved the objective, appraise the extent to which client's goal were attained. So you should try at least 30% has been attained, means 60% is remaining. If 40% attained like that, means you have this much is remaining. So how to remodify and make 100% achievable? That needs to be done. Appreciate the involvement of client in health decision. Motivation is a key factor for everyone. So we in patient also need motivation. How much they are doing, you should appreciate them, you should motivate them so that they can cooperate in the care. Assess the collaboration of a client and healthcare team members. Yes, of course. You alone cannot do, I alone cannot do, nurses alone cannot do. Yes, of course, they are all needed. You cannot tell only the nurses have done this and others have not done. It's all have done. If you are or we are all the heart of the system, there are someone who are the brain of the system, some are the backbones of the system, there are different. So same way in our body, all the organs are important. In a healthcare team also, it's a collaborative team member. Even the security guards who are standing outside the hospital, they are also directly or indirectly helping in the patient care. It's all. So even housekeeping peoples, all are responsible. It's a collaboration. Identify the errors in the plan of care. To find error means like you have is very appreciable with your trustee, sir. Please, he told me very stressed that word. Write 20 errors. Please write 20 errors. I think he dedicated that 2 times. It is not for why writing 20 errors. He wants that 20 to improve. Because all people will come and go and tell that food was nice, AC was nice, we slept nicely, we had a nice photo section, campus was nice, everything they will do. But he was stressing that 20 errors. Why? It is for the betterment of you all JMDN. You all JMDN he was thinking there. So here also, you don't think that we are finding faults. We are finding faults to improve that our divine person. Who is our divine person? Patient. He is a divine person. So we are finding that fault, not to find fault in our own colleagues or our own healthcare team members, but to improve the health of the divine person, the patient, for whom we are all helping. So monitor the quality of nursing care. Quality is very much important. Without quality, nothing cannot work out. Anything you study, you have to implement in a very quality way. There is nothing can happen if you does not do work in a very quality. So activities involved in the evaluation phase are review the client goals with the outcome criteria. Nurse evaluates the nursing care by knowing what to look for client's goal and expected outcome. Give the objective criteria needed a client's response to care. There is one standard criteria, means that is objective. With that criteria, how much the client has achieved needs to be compared. Then only we can make a change in the process. Collect all the data, measure that the goal is attained or not. You have to measure it, how much it is attained or not. Like a patient who is immobilized. And our aim is that at least by within 1 week, the objective is within 1 week at least he can independently go to the washroom. So okay, but after 2 days care we have find it out, at least he is not passed the urine in the bed, but at least he asked someone and with the help of by sitting position in the bed he has passed the things. But at least he did not went to the washroom, but at least he has done something. So something is also a positive sign. So how much measure you have done, how much goal has achieved, that needs to be framed. Revise and modify the nursing plan care. So whatever you are finding faults, again revise, modify. Review the client goals and the outcome criteria. So basically in the evaluation phase, it is a phase where we identify the criteria with the standards. We identify the criteria in the patient. How much criteria is achieved based on the objective which you have laid down. So this much has been achieved, this much is not achieved. Collecting and evaluating data. So here in evaluation we are again collecting data, like a patient who is having hyperpyrexia. So that's why we have planned, he had a fever of 102 degree Fahrenheit. Now you have made interventions, you have done implementation. Now you in evaluation what you will again collect the data, again check the temperature. If the temperature is 98.6 degree Fahrenheit, that means the goal is achieved. The patient's temperature has reduced. So again collect and then evaluate the data whether the care plan is good or not. Interpret and summarize the findings. Like 98.6 degree Fahrenheit means normal body temperature. 102 means it is a case of hyperpyrexia. So what is data that you need to interpret and summarize the condition of the patient? Document the findings. Nothing can work out. You have to record everything, write everything, legibly, signature, everything needs to be done. And based on that, care plan revision needs to be done. So identify the criteria and standards is the first step in the evaluation of the care. Then we have to collect all the data of the patient, evaluate the client response to the nursing care or the evaluative measures which are simply assessment, skill, techniques. Even like while collecting the data, like a patient who is having breathing difficulty. Now you have given a position change, frequent position change, maintain postural drainage, comfortable position was given. Now again you have to auscultate these sounds and then find out whether the bilaterally lung sounds are clear on auscultation. If lung sounds are clear, then only the breathing is maintained. Normal breathing pattern has been established. So you have to collect and evaluate data again. Okay, so interpret every data what you have collected, you need to interpret. If you know sound knowledge, what this data means, then only you can interpret that. To develop clinical judgment, match the results, evaluative measures with expected outcome, determine the client status is improving or not. So with the data only, with data what you have collected, then only you can come to know whether the patient condition is improved or not improved. Everything needs to be documented. Nothing can work out without documentation. Okay. So then lastly is care plan revision. In evaluation, if the care is achieved, then it is going to stop. That problem has to be stopped. If there is some remodification not achieved, again you have to come for the first step, reassessment, reformulating nursing diagnosis, reformulating the planning stages, redoing the implementation. So that is why I will better tell it's not evaluation, it is re-evaluation. This final step of the nursing process is not evaluation. It can be better way. You can tell it as a re-evaluation, because we are again going from the first. We are re-assessment, re-nursing diagnosis, re-planning, re-implementation. We are again rechecking to modify the care of plan. So that is what. Yes, of course. If you want to have a good objective, we need to have a good patient outcome or a patient have a maximum output of the care. Then we have to think of all the factors. All healthcare members are very much necessary. It's not that the heart of the system, that is nursing fraternity. Only heart is not needed, brain is also needed, backbone is also needed, all the body systems, kidney, liver, everyone is needed. You cannot tell we are nurses, we have done this. Nothing, we can clap sound can happen with one sound. Anyone can clap with one hand. So without one hand also you cannot clap. Then we need the help of someone. Even we point someone. Even if I point someone, 3 fingers are pointing me. So better not to point. Make always together we can. So health team members, give importance to all. Not take the credit. They give credit to everyone. Then only will be the success. Family members, yes, of course. The patient, every child is very unique. What happens when a child is born, we all nurses very eager to take care of that baby and play, cuddle him, play him. Everyone, when a newborn child happens, I have seen the young third-year students, they fast go catch hold, they start playing with the babies. Baby is not that time for a play. He needs a very isolated environment. A bonding has to be established. Hormones needs to be secreted. Milk ejection reflex, prolactin reflex, all these reflexes needs to work. Mother and child. This is after delivery. The newborn baby should be with the mother, not with the 100 nurses. So that baby also get confused. मैं किसका हूँ? So that should not happen. Is only for the mother. So that baby after delivery fast it should reach. The basic essential newborn care is done. Go to the baby. So family members are very much important. That's what I am saying. So what every patient, there are some family members are there. Involve them. They should be always told this things is happening in your patient. Needs to communicate with all the family members and involve them in the care. They are also important. So that nurse. Yes, of course, we should support our own kingdom also, our own fraternity also. So, of course, nurses are also important very much in the healthcare team, in the nursing process. Without nurse, because nurse is going to implement, nurse is with the patient 7 into 24 hours. A doctor can spend hardly 5 minutes or 10 minutes. So, if how much the strength of hospital is big or a patient bed strength is that much high, that much less time a doctor can spend with a patient. So, yes, nurse is going to spend 7 into 24 hours with that patient. So we are going to communicate with all the members of the healthcare team. So whatever you communicate in a proper way and 100% in a truthfulness. Then only the quality nursing care and a quality goal attainment will be achieved. Now there are some of the skills which are required for evaluation. The skills are, you should know where you are standing. You should know the protocols. You cannot be your own protocol. You should know wherever you're working, you should know the standard SOPs which is followed there. What are their policies? What are their rules and regulations? What are their all standard operating procedures of different conditions? Everything you should know, and then based on that only you should perform. Nurses must have up-to-date knowledge and information of many subjects. Learning is lifelong, from the mother's womb to the tomb. Okay, learning is lifelong, never stop learning, go on learning. So if you have to be always up to date, there is no full stop for learning. Full stop means you are death only. So there is no stop at death. When death happens, then only learning stops. So continuously cell multiplies till the last date. So always continue the learning and update the knowledge. Nurses must have a strong intellectual. If you are not having a strong knowledge, sound mind, body. So 100% you should have a strong knowledge, then only you have a strong practice. That's why we should take it together, you cannot separate knowledge and practice. It is always means same side of a coin or a two facets of a single coin. Okay, anyway. So nurses have knowledge and skill in collecting the subjective and objective. You should have a skill. Skill is very much necessary because the first step of the nursing process is assessment. So subjective and objective data is more important. Data collection is very key. How data you collect, based on that only this. So data is the backbone of the nursing process. So you should be very careful, vigilant to collect data. You should notice all the subjective data. You should not, you don't get tired. Patient is trying to explore more things. Listen. Maximum listening, maximum collecting data you are doing indirectly with the subjective data. Then all the objective data also needs to be collected. Then based on both this data, we are framing the nursing diagnosis. Okay, this is just I have taken one problem. Like Mr. A says that I am having fever. This is subjective data. Objective data is temperature is 102 degree Fahrenheit, dry coated tongue. Based on this subjective and objective data, we have formulated nursing diagnosis, that is hypothermia related to infection process, which is manifested by temperature of 102 degree Fahrenheit. Now my objective for this patient is Mr. A will maintain a normal body temperature, that is 98.6 degree Fahrenheit. Now we have laid down set number of planning. We make a set number of planning phases. Assess the condition of patient, check vital sign, provide comfortable position, plan to do tepid sponging, provide oral fluids, provide comfortable position, reassess the patient, administer any medication as per the advice. So these are all we have. Now implementation, we start doing what is in the planning stage. So first assessed. So what we have done, assessed. Having temperature is, yes, temperature is 102 degree Fahrenheit. Vital signs check, temperature 102 degree Fahrenheit. Pulse rate is 90 beats per minute. Respiration is 26 breaths per minute. BP 130 by Henry MFG. Provided supine position with comfortable devices like pillows. Tepid sponging done for every 20 minutes. Provided plenty of fluids, that is 200 juice, 200 ml to drink. Provided a very loose cotton cloth to wear. Reassure the patient that the temperature will reduce. Health education can be done. Administer tablet paracetamol 500 mg TID or as advised. And then lastly in evaluation, Mr. A has maintained a normal body temperature of 98.6 degree Fahrenheit. Okay, one more I have taken down. A 23-year-old patient, Mr. Anil, who comes to hospital with an increased enough of dyspnea, restlessness, on history taking known for a bronchial asthma. So subjective data, he may have labored breathing, or sometimes he is not able to talk, or he cannot tell. Then sometimes we don't have subjective data also, so don't worry. There is no subjective data. You can check for objective data. There were wheezing were there, upon expiration, dyspnea was there, coughing sputum, yellow and sticky, tachypnea was there, prolonged aspiration, tachycardia, chest tightness, anxiety, cyanosis, loss. So these all objective data I have found out. So based on this, we formulated nursing diagnosis, that is ineffective breathing pattern related to presence of overproductive secretions, cough and dyspnea. And objective is client maintains normal breathing pattern. So planning, assess the breathing pattern, teach them, because a case of bronchial asthma, teach them demonstrate how to do the pursed lip breathing, teach them the pursed lip diaphragmatic breathing, make the head end of the bed above. Okay, elevate the head end of the bow, frequent changing of the positions. So by the frequent changing, the postural drainage can happen, secretion can be pulled off, and patient can get comfortable. So establish a good rapport. Establish rapport, assess the patient condition, monitor the vital sign, auscultate the breath sounds bilaterally, how much clear it has been there, airway pattern, elevate the head end of the bed, change position, encourage deep breathing, comfing exercise, demonstrate how to do the pursed lip breathing and diaphragmatic breathing. So evaluation, patient demonstrated the pursed lip breathing and diaphragmatic breathing. Patient manifested the decreased sign of respiratory discomfort and absence of pneumonia. Sometimes the whole objective cannot be achieved, but how much is achieved, that you write off. Yes, evaluation. Also in evaluation is 3 types of evaluations are there. That is ongoing evaluations. So ongoing evaluation, it is done while or immediately after implementing. A nurse orders, it enables the nurse to make on-spot modification. Ongoing evaluation is you do something, you evaluate. You do something like tapered sponging, you evaluate temporarily. Tapered sponging, you like that. Means ongoing, it is continuous within 1 hour, half an hour, that is continuously you are doing, that is known as ongoing evaluation. Intermittent evaluation, it is performed at a specific time interval. Once in a week, shows the extent of progress towards the goal achievement and enables the nurse to correct any deficiencies and modify the care plan as needed. So you, again, like a long-term patients with a long-term diseases and all, you make a short-term goals and then you evaluate, make modify, then again you do. So that is known as intermittent evaluation. Then comes the terminal evaluation, which is done at the time of discharge. It indicates the client's condition at the time of discharge. It includes the status of goal achievement and evaluation of the client's self-care abilities with regards to follow-up care. So terminal evaluation is done at the time patient is going. Now you are discharging him. So you evaluate the situation at the time of discharge. You tell after 14 days you have to come or follow up. At the you have to this advice you give, this medications you take. After again the patient comes, you again assess the patient. So that is known as terminal evaluation. So evaluation is basically of 3 types. That is ongoing, which is continuous, intermittent, which have a short interval gap, and terminal evaluation at the time of discharge and when again he comes in the follow-up. So thank you.
I think sir has discussed a lot in a very short time of span. He has discussed about implementation and evaluation, its introduction with definition, skills required, factor affecting, types. I think it is enough for part of introduction of nursing process. Thank you very much, sir.
Thank you so much, sir.
Now I would like to invite Mr. Mayur sir, Assistant Professor of JMD Institute of Nursing, to felicitate Dr. Binu Jo sir.
Thank you so much for joining today. I would like to invite Ms. Pratima Sabkota to felicitate Mr. Jayesh Jain, sir. Thank you, sir, for joining today. Dear student body, as you filled your pre-test form in the morning, you are supposed to fill the post-test form and the feedback form which has been kept in your folder. So I request everybody to complete both the forms, that is post-test and the feedback form, and do submit till the validity function closes. Thank you. Now, let's take a moment to congratulate the best academic performers of JMD Institute of Nursing during the last year. To pass over the prizes, I would like to invite Mrs. Swapna Suhas ma'am to come on the stage to pass away the prizes. Swapna ma'am. Ma'am, you are invited to give away the prizes for the academic winners. So we are starting with the second year. Dear student body, please to wait patiently. So the result of the second year PBBSc, the third rank goes to Ms. Gameti Saroj. Please to give a round of applause. Third rank goes to Gameti Saroj. Second rank goes to Mesriya Smita and first rank goes to Yadav Anita in absentia. And the first year PBBC results, third rank goes to Ms. Rathod Sweta. Rathod Sweta, are you here?
Rathod Shweta.
Second rank goes to Parma Rohan and first rank goes to Sapna Kapadia in absentia. Thank you so much, ma'am.
Now we are moving forward to second year BSc. So the third rank goes to, first of all, I would like to invite Dr. Binu sir to give away the prize. Third rank is held by Niyat Patel.
Mr. Niyat Patel, please to give a round of applause.
Second rank goes to Deep Patel. Mr. Deep Patel. And first rank goes to Vidhi Solanki.
Thank you so much, sir. First rank goes to Vidhi Solanki.
Thank you, sir.
Thank you so much, sir.
Now I would like to invite Mrs. Rameshwari ma'am to give away the prizes. So now we are moving forward into the first year BSc results. The third rank goes to Mansoori Riya. Mansoori Riya, please come forward. The second rank goes to Kirangi Riya. And first rank goes to Ami Patel.
Thank you so much, ma'am. Now I would like to request Mr. Jain sir to come on the stage to give the prizes for the second year GNM results. The third rank goes to Ms. Ruchita Patel in absentia. The second rank goes to Mr. Anshu Patel. First rank goes to Mr. Sachin Sadat. Thank you so much, sir. For the first year GNM, we have third rank goes to Ms. Kambala Sheetal, and second rank goes to Gava Ajay, and the first rank goes to Nikita Rabari. And they were unable to join us today, but do please to give a round of applause for all the academic performance. Thank you.
Today we gather here to witness the clash of minds where knowledge meets competition and curiosity fuels the desire to learn. This quiz competition promises to be a thrilling journey through a myriad of topics that will challenge and entertain us all.
Ladies and gentlemen, please put your hands together for Ms. Bhumika Chadba, Mrs. Bhumika Patel, the Assistant Professors of JMD Institute of Nursing, and Ms. Anjani, Nursing Tutor of JMD Institute of Nursing, to come forward as they take up the reins as the conductors of this gripping quiz competition. Over to you, ma'ams. I kindly request our volunteers to come forward on the stage to do the seating arrangements.
Thank you, ma'am. Good evening, students. So now let's move to our final part of this event, which is quiz competition. For the quiz competition, I would like to invite the students from the different college. Kindly come forward and take your seats. First, Tabia Radha from Sankarsi Waghela College. Patel Sangeeta from Vivekanand College. Patel Rajvi from Vivekanand College. Okay. Parmar Krish from JMD College. Patel Niyati from Apollo College. Raj Kharadi from Apollo College. Mekwan Merlin from Swayambhu College. Parikh Nandini from CM Patel. All the students kindly come forward on the stage. Take your seats, students. Audience, kindly maintain silence. Please, students, I would like to invite Bhumika Patel ma'am to explain the rules and regulation of this competition.
Okay, continue with rule and regulation of the quiz competition. સંભળાય છે ને? Okay, first we will divide total 9 students in 3 teams. Okay, with the lottery method. Okay, we will do it. Then team will be decided by lottery method. There are 2 rounds for quiz competition. First one is the elimination round within a 3 team. Okay, there will be 2. One team will be out, eliminate. Okay, then second round it is a semi-final and third is a final. Okay, then each round will be given a 10 questions. Only 10 questions you have in a one round. Okay, then there is no minus point. Then question will not be passed to other team or your colleague or your teacher anyway. Okay, in audience. Then first and final round contain MCQs, multiple choice questions, and semi-final contain short answer or one word answer. Okay. Then in final round, participant who will get highest score, it will get first rank, and remaining is second and third rank. Then when one team or participant is answering, other team or concerned cannot interrupt the else, particular team or participant will be eliminated. Okay. Then when each correct answer contestant will get 1 point score, and wrong or no answer it will 0. But we will not pass the question or answer anyway. Okay. Then last, if any query you can ask in between, like repeat the question. We will project. Okay, but then carry multiple answer. Some questions have multiple answer. You can give, you should give all answers, not 1, not 2, not 3. Okay. Then if you give the other like arguments, it's not valid. Okay. Participants must give all answers, else we will not be repeat the question or repeat the answer, anything. Okay. You will be eliminated. Clear? Okay. Then we will start with the lottery method for dividing the 3 teams.
Who are having A? Kindly raise your hand. Okay. So these 3 students comes under the A team. Kindly sit together with the team A. Who got the B? B? Okay. Come together and sit together. Are you all ready? Contestant? Okay, let's move to our first round, which is elimination round, and which is covered the MCQ. You will have 45 seconds to attend to give the answer. After 45 seconds, the question will change. Okay? Understood, all students? Okay. So here the first question. In which step nurses are doing validation of the patient outcome and goals? Okay, team C, give answer. So here the answer is wrong. So team C got the 0 score. There is a no pass question, students. So here the correct answer is evaluation. See, students, the patient outcome and goals means we are evaluating. Okay. Now, second question. 1 second, ma'am. Okay, second question. Attention, student. Headache, itching, and warmth are known as A. Team A, give answer. Use mic. Say loudly.
C. Symptoms.
Okay, so symptoms is the correct answer. So team A got 1 score. Silence, students. Okay. Our third question is, in emergency situation, what nurse should assess first? Okay, team C. So the pulse is a wrong answer. Team C got the 0 score because in the emergency situation we are assessing airway, respiration. C0. No pass question. Silence, students. Let's move to our fourth question. Which step of the nursing process does have revision of patient condition? B. Team B. Sorry, repeat. Evaluation. Okay, the evaluation is the correct answer. Team B got the 1 score. Okay. Are you enjoying, audience? Good. Okay, let's move to our fifth question. Which action by a patient marks the beginning of the physical assessment? Greeting the nurse, communicating with the nurse, walking in the room, or breathing normally? Team B. Communicating with the nurse. So the answer is wrong. The correct answer is breathing, right? Vital sign. That is the physical assessment, part of the physical assessment. So correct answer is D, breathing normally. Okay, so here team B got the 0 score. Okay, let's move toward the sixth question. Which nursing diagnosis is a first priority for the patient who need assistance with the daily activity? A, lack of knowledge, lack of energy, deficient self-care, or deficient full volume? So here the team A, give answer. Lack of knowledge. So here the lack of knowledge is Wrong answer. The right answer is self-care deficit. Okay. Because client need assistance, obviously he is unable to perform the self-care activity, right? Okay, so here the team A got the 0 score. Okay. Pay attention, participants. Next question. Which is not a step of implementation? A, diagnosis, B, goal, C, planning, or D, assessment? Okay, team C, give answer. You have 45 seconds to give answer. Which is not a step of implementation? So here the assessment answer is wrong. Again, team C got the 0 score. The correct answer is goal. In the implementation, we are not setting any goals. We are assessing the patient condition. Again, we are making a nursing diagnosis, and then we are planning and we are implementing the whatever the care we have planned, right? There is a no goal. Goal we have already set. Okay. Next question. Which is the last step of nursing process? Planning, history taking, documentation, or providing care? Team B, give answer. Yes, the correct answer is documentation. Team B got the 1 score. Okay. Silence, students. Okay, let's move to the next question. Question number 9. Which factor is affecting on goal attainment? Staff nurse, patient, doctors, or sweeper? So, Bino sir just say, right? Took the session. Okay. Team A, give your answer. Yes, the staff nurse answer is correct. Staff nurse affect the on goal attainment. So here the team A got 1 score. Sorry. So here the team A and B are having a tie. Okay, last question of our first round is, using a Maslow hierarchy of need, a nurse should assign highest priority to which client need. Okay, team A, give your answer. Okay, the elimination answer is right answer. So here the team A got the 1 score. So here the mark of end of round 1. So here the elimination, this round was the elimination round. So the lowest score team will be automatically eliminated. So here the team A is leading with the 3 point. Team B got the 2 point and the team C got the 0 point. So here the team C, sorry to say, you are eliminated from this quiz competition. Give the round of applause for the team C for their efforts. Silence, students. We will move forward to our second round, but before that, our team will be changed. Okay. So, sit silently. So now there will be a two team, team A and B. Again there will be a roti method. Who got the A? Kindly raise your hand. A team. A. Okay, sit together. And the B team sit together. Okay, students, kindly maintain silence. Let's move to the next round, round 2, the semi-final round. And in the semi-final round, there will be a short question answers where the students need to give all the multiple answers should be corrected. Otherwise, the answer will not be counted corrected. If the answer correct more than one multiple answer, right, then the students need to give multiple answer. If the students will say 1 or 2 correct answer, but other 2 will be the wrong, then the answer will also be a wrong. It won't be counted as corrected. Understood? If the answer is contain multiple answer, then you need to give all the corrected. For example, one question contain 4 answer. Then you should attempt 4 corrected answer. Otherwise, your answer won't be validate. It count as a 0 score. Wrong. Understood now? Yes. Give the full answer. Okay. So here our first short question. Question number 1. Cyanosis of the skin is included in which type of data? Team A, give your answer. Students, audience. Cyanosis of the skin is included in which type of data?
Observing. Objective data.
Objective type of data. Okay, the answer of objective data is correct. Okay. So here the team A got 1 score. Okay. Let's move to our second question. Which are the data collection methods? Team A, give your answer. You need to raise full, otherwise it won't be count. If you hold at half, then it won't be count. You need to raise your stick high. Okay, give your answer. Team A. Which are the data collection methods? You have 45 seconds.
પહેલી ખબર પેલી ઓબ્ઝર્વિંગ હતી અને એના એક્ઝામિનિંગ હતી પછી ઇન્ટરવ્યુઇંગ હતી અને પહેલી કઈ હતી
ઓબ્ઝર્વિંગ ઇન્ટરવ્યુ
અને ડોક્યુમેન્ટરી.
Your 45-second time is up. Okay. So there is a no pass question. So here there is a no losing point because there is the no one gave answer. Okay, I will give answer. The correct answer is inspection, interviewing and examining data collection technique or methods. Okay. Third question. Which are the types of nursing diagnosis? Team A. Hold. Use your mic.
Problem focused nursing diagnosis.
Say loud.
Problem focused nursing diagnosis, risk nursing diagnosis, syndrome nursing diagnosis, and
Shh. Audience can't interrupt in the quiz competition. You are allowed only to clap and cheer.
syndrome, problem focus અને risk અને એક રહ્યો વચ્ચેનો ત્રીજો રહ્યો મને બી આવડે છે.
No. Your 45 minutes is over. But students, the team A said problem focused, risk and syndrome. Okay, so here they gave only 3 answers, but the question contained 4 answers. The fourth one is health promotion. So here the team A got 0 marks. Okay. Okay, now let's move to our fourth question. What is the difference between goal and desired outcome? Goal and desired outcome. Difference between goal and desired outcome. Okay, team B, give your answer.
गोल मीन्स कि पेशेंट के लिए जो हम गोल बनाते हैं वो, और आउटकम मीन्स कि जो आउटकम्स वो हमारा जो हमने डायग्नोसिस किया कि उनको जो ट्रीटमेंट दी उसका जो आउटकम आता है वो होता है आउटकम. रिजल्ट मिलता है जो वो उसको आउटकम.
Okay, so here you should be more specific. Okay, so here the answer of goal and desired outcome. Is not validated. It is not wrong. I can't say yes or I can't say wrong because the answer is the goal is a general description, whereas the outcome is more specific, right? That is the difference. Okay, so here no points. Okay, next question. Question number 5. What is the full form of PES? Team A, give your answer. Define characteristic. You have 45 seconds. Think before you say.
P for problems, E for etiology, and S stands for the specific definite characteristics.
Time up. So here the PES stand for P for problem, E for etiology, and S for symptoms. Symptoms, sign and symptoms, both are different. S for only symptoms. Okay, so here team A got the 0 point. Okay, question. Silence, audience. Participant, pay attention. Here the question 6. Which are the activities of the evaluation phase? In the evaluation phase, which activity we are performing to evaluate our treatment, okay, or our care? Oh. Okay, team A, give your answer. Say your answer in mic.
Documentation, reassess the data.
So here the time is up. Both team go to 0 score. Okay, I am telling the correct answer. The activities of evaluation phase are identifying, collecting, interpreting, summarizing, documenting, and the last one is revision. Okay. Our next question, question number 7. Which are the 4 types of assessment? Team A.
Collection of data, organization, validation, and
4 types of assessment.
problem focus assessment, પછી
types of assessment.
collection inspection, palpation, percussion, and auscultation.
So here your answer is wrong. Here the 4 types of assessments are initial assessment, problem focused, emergency, and time lapsed. Okay. Audience, keep silence. Okay, next question number 8. Urinary retention is which type of nursing diagnosis? Team B. Urinary retention is which type of nursing diagnosis? You can't answer. There is. You have 45 seconds, students, to discuss. Urinary retention is type of nursing diagnosis. Your answer? Your time is up. So here the urinary retention, right, is nursing diagnosis itself. Urinary retention means here the patient having the problem of urinary retention. So nursing diagnosis is a problem focused. The type of the nursing diagnosis, problem focused nursing diagnosis. Okay, next question, number 8. List out the steps of planning phase. List out the steps of planning phase. So here the time is up. No one raised their stand, so 0 score. The correct answer is setting priorities, then developing outcome, then nursing orders, and the last one is documentation. These are the planning phase, or steps of planning phase. Okay, here the last question of this second round. The 10th question: when the post-operative patient complaint relieved after 1 day, which type of the goal is it? Post-operative patient say he's feeling less pain after 1 day. Suppose, okay, relieved after 1 day. Which type of the goal is it? Team B. Yes, the correct answer is short term. So yeah, the team. So yeah. So here, with the end of the second round, the both team have the tie. They both have 1 score. Students, audience, pay silence. So here we have the tie, right? So I will ask only one question, okay? So the team who will raise first. Right. Eliminate, yes, yes. Okay. Okay. So the question is, list out the nursing process steps in line. Okay. So here, team. Silence. Team B, give your answer. Pass the mic. You need to say in the correct line. Okay. List out. You have 45 seconds, student. You have 45 seconds.
Assessment, nursing assessment, nursing diagnosis, planning, implementation, and evolution.
The answer is wrong. The goal is missing. Okay, again the tie. I need to ask again first question.
Okay. Okay. Ready? I have another one question. What is the full form of Nanda?
Diagnosis. ત્રણે બોલીએ. 1 2 3 ત્રણે બોલીએ. ચલો આવો. North American Nursing Diagnosis North American Nursing Diagnosis Association. North American Nursing Diagnosis Association. International. North American Nursing Diagnosis.
So the team B got the correct answer. So here the team B got 1 score. So at the end of this round 2, the team B is leading and the team A got eliminated. I'm sorry with the team A, but you have done very well. Team A, kindly take your seat off the dais, please. Okay, the last one is final round. So in the final round, there will be again 3 teams, A, B or C. These 3 students will give the individual answer. And after these 3 will have a winner. Okay. So again for the team ABC, you need to take the cheat, okay, to decide the team. Who is A? B? Team A? Team B? And C? Okay. Students, audience, keep silence. Are you enjoying, audience? Are you having fun? Okay. Okay, so let's move our last final round, which contain again MCQ type question, but here the question will be hard compared to previous 2 round. Okay, so contestant, think before you hold your stick high. Okay, you have 45 seconds. Do not waste question, because there will be a 1 question and you are a 3 contestant, right? So if you are not sure, then do not raise. Okay, and for this round, we'll pass the question. Okay. So let's start. Audience. Okay, so first question. Which of the following is not an example of initial type of assessment? A. Blood test. B. Vital sign. C. Physical assessment. D. Intake output chart. Do not say answer from the audience. Don't say answer, audience. Okay, team C. Blood test. So here the answer is wrong. The answer will pass to the B team since the B raised the secondly. Give your answer. C. Okay, give your answer.
IO chart.
Okay, so this round also there will be a no pass. Okay, so here the answer is wrong. So the correct answer is D, intake output chart. No one got the score. Okay, let's. Okay, let's move to our second question. CPR is an example of which type of assessment? Team A, give your answer.
Emergency.
C, emergency, which is correct answer. Yes, C. C. So here the C team got this correct answer. 1 point. Sorry. A team got the 1 point. Okay. Next question 3. Which approach is cephalocaudal approach for examining client? Audience, I don't want answer from your side. Okay. Team C. C, give your answer. So the answer head to toe is correct answer, yes. Yes. Okay. The fourth question. Which type of indicator is correct when breathing difficulty is occur in client due to smoking? I'm repeating the question. Which type of indicator is correct when... Can you stand? Sugacha? I'm repeating the question. Which type of indicator is correct when breathing difficulties occur in client due to smoking? C, give your answer. Audience, I don't want the answer from your side, otherwise I will quit this competition and there will be no winner. All right. So here the answer B, risk factor is correct answer. Team C got 1 point. Okay, next question 5. Which is dependent intervention? Drugs, USG, C, A and B, and D, none of above. C, give your answer. Which is dependent intervention? Can you tell me the final answer? Your none of above. Okay, the answer none of above is wrong answer. The correct answer is A and B, C. Students, when you are giving your answer, kindly say with the option A, B, C, D. Okay, give the answer in full.
Only one time answer. Only one time answer. एक ज बार आंसर आपले फिक्स करवाना.
Okay, so here 0 point. Next question. Which of the following skill is necessary for bandaging the client wound? Which of the following skill is necessary for bandaging the client wound? Interpersonal skill, sociological skill, technical skill, or cognitive? A. Team A, give your answer.
Interpersonal skill.
So interpersonal skill answer is wrong answer. Here we are bandaging, so obviously I need some technical skill, right? To wrap properly in a spiral, simple, a figure of 8. So there is no any interpersonal or psychological or cognitive skill needed. It is the techniques. Okay. So the correct answer is technique. So there is no point. Okay, next question. Which is the correct sequence for the implementation of the step? PCM, then effect of PCM, then take temperature, then give sponge bath. Okay, team A, give your answer. Answer in full.
C. Temperature, sponge bath, PCM, record and report, effect of PCM.
So the sequence of implementation steps, Team A gave answer C, which is correct answer. Yes. So Team A got 1 score. Okay, next question number 8. Which of the following evaluation type is correct for client coming for follow-up treatment of TB? Team A, give your answer.
C. Intermediate.
Okay, so for the treatment of TB, client coming intermediate. The answer is correct. Okay, the question number 8. Okay, sorry. Question number 9. Are you having pain now? Which type of the question is it? C. Give your answer. Close-ended. Yes, the answer is correct. Close-ended. So here, the team C got 1 point. So here again, I can see that A and team C are having a tie and the B having a 0 score. Okay, so the last question number 10, which is not a source of diagnostic error. Team A, give your answer.
B. Clustering.
So here, clustering. Answer is wrong. So here the team A got the 0 point. Okay, so here we have the tie between the team A and C. So I will ask question. Here the question. Will be a short answer. Okay. With this, we'll have our winner. Okay, I'm asking question. Pay attention, students. Okay. The systemic problem solving approach toward providing individualized nursing care is known as. Yes. The B said nursing process, which is correct answer. Finally. So team B got 1 point. Okay. इसको मारूंगी मैं. अब याद रखो. So here the question, this question will only be for the team A and C. Team B will not be interrupt, okay? Because this is for the tie, okay? So the question is, information verbalized or stated by the client is called as, team A, give your answer.
Subjective information.
So the subjective information answer is correct answer. Yes. So here, with this question, our final round is ended and the team A got the correct answer. So 1 point for the team A. So with the end of this quiz competition, our scoring is the team B got 1 point, team C got 3 points, and team A got 4 points. So here the winner is team A. The second winner is team C and the last is team B. All three participants kindly take your seat off the dais. Thank you, students. I request volunteers to take the chair from the dais, please.
Okay. Announcement of winner's name. The third rank in the quiz Parmar Krish from JMD Institute of Nursing, Gandhinagar. Second rank, Patel Sangeeta from Vivekanand Nursing College. And first rank from Apollo College of Nursing, and she is a Niyati Patel. Now, I would like to invite our principal, Professor Divya Jiji ma'am, to give the prize to the winners. I am inviting first rank. Patel Niyati Ashwin Bhai from Apollo College of Nursing. Second rank, Patel Sangeeta Bhomaram from Vivekanand Nursing College. And third rank, Parmar Krish Jitendra Bhai from JMD Institute of Nursing.
Students, please be quiet. So, please pay attention here now. So, I am seeing that you guys really enjoy this quiz session, right? So, we are moving forward.
अभी वीडियो होगा शिवांगी नर्सिंग एकेडमी का, फिर से शॉर्ट वीडियो एक्टिविटीज ऑफ शिवांगी नर्सिंग एकेडमी। कहाँ है ये? अभी आई है, बोल दो। ये आप बोल दो ना। I request all the student body to remain in silence, and now we'll have a short video on describing the activities of Shivangi Nursing Academy.
लागे तू मेरा कोई ना होके भी कुछ लागे किया रे जो भी तूने कैसे किया रे जिया को मेरे बांध ऐसे लिया रे समझ के भी ना समझ न सकूं सवेरों का मेरे तू सूरज लागे तू मेरा कोई ना होके भी कुछ लागे अपना बना ले पिया अपना बना ले पिया अपना बना ले मुझे अपना बना ले पिया अपना बना ले पिया अपना बना ले पिया दिल के नगर में शहर तू बसा ले पिया
Thank you.
Now we are at the last phase of this conference. On behalf of JMD Institute of Nursing, it is my absolute pleasure to extend a warm and heartfelt welcome to each one of you to the valedictory function of this conference. Today, we marks the culmination of days filled with insightfulness, discussion, enriching presentations, and invaluable networking opportunities. As we gather here to bring this extraordinary conference to a close, we cannot help but reflect on the profound impact it has had on all of us in the nursing community.
May I have the attention of all the students who are seated here? Students, can you hear me? Are you all listening to hear? We know that you're very eagerly waiting to go home. So we have few more functions to be finished. So please be seated patiently. Okay, fine? Yes. So I would like to invite Ms. Pratima Sapkota and Ms. Akhila Wilson, Assistant Professors of JMD Institute of Nursing, to come forward and to reflect on today's insights. Please, ma'am.
A very good evening. A very good evening and warm welcome to you all in this valedictory session of quality improvement through nursing process with the theme of harnessing the power of nursing process for continuous improvement. Myself Pratima Sapkota.
Myself Akhila Wilson. We again welcome you all present in this fruitful evening of this session.
It has been an honor to be part of this delightful conference. On the behalf of the JMD Institute of Nursing, we would like to extend our heartfelt gratitude towards JMD Education Trust, our respected Principal Ma'am, for giving this opportunity to organize this wonderful state-level conference and for their exemplarious guidance throughout the conference.
Words are not enough to express our sincere gratitude to our chief guest, Dr. Deepika Khakha, for sparing time from her busy schedule and unveiling the theme. Our guest of honor, Mr. Iqbal Kadiwala, and our prominent speakers and moderators for their valuable presence. This conference would not have been the same without your presence.
An event of this dimension cannot happen overnight. The wheels started rolling months in advance. Since morning, we had deep insight into different steps of nursing process. The session focused on nursing assessment, goals, nursing diagnosis, implementation, and evaluation.
In the session of assessment and nursing diagnosis, Mrs. Swapna Suhas has discussed various types of assessment, types of data collection methods, validating and documenting the data. Further, ma'am has also emphasized and analyzed the data and formulation of nursing diagnosis statement. Ma'am has also shed light on the formulation of nursing diagnosis based on nursing assessment. In the second session, Mrs. Rameshwari Jhala emphasized how to set the nursing goals based on the need of patient and prioritizing them accordingly. Ma'am has also highlighted the factors which affects setting the priority, goals, and turning goals into planning in the nursing care.
Later, Dr. Binu Joy placed the mix of reflections on nursing intervention and evaluation. Sir has taught us how to carry out any treatment-based clinical judgment. Sir has also discussed about different skills necessary for implementation of plans. Similarly, the final steps of nursing process, that is evaluation, the judgment of effectiveness of a nursing care is crucial to determine the quality of nursing care, whether the predetermined goal has been achieved or not. It was very lively session this whole day, and now we have come to the end of the session. We just had very interactive and competitive quiz session, as well as we had also celebrated our JMD students' academic success.
In conclusion, we want to extend our profound appreciation for each one of you. Let us cherish these moments and use them as stepping stones for the exciting future that lies ahead. Thank you.
Thank you, ma'am. As we draw near the conclusion of this momentous valedictory function, it is now the time for us to extend our gratitude to all those who have made this conference a resounding success. Allow me to invite Ms. Hemangi Prajapati, Nursing Tutor of JMD Institute of Nursing, to deliver the vote of thanks.
Good evening, everyone. Myself, Hemangi Prajapati, Nursing Faculty of JMD Institute of Nursing, considering the occasion as an honor and privilege to extend the vote of thanks. Once a great man whispered, feeling thankfulness and not expressing it, it like wrapping a present and not giving it. Today, I take this opportunity to pull all my gratitude into words. On the behalf of our college, management and all the students, I would like to thank our respected chief guest, Dr. Deepika Khakha, for taking her precious time out and consenting to be the chief guest. I am grateful for our respected special guest of honor, Mr. I.A. Kadiwala, who graced us with their presence and guidance. Thank you for inspiring and encouraging us with your words on this special day. I would like to extend my heartfelt gratitude to our esteemed speaker, Dr. Binujo, Mrs. Swapna Suhas, and Mrs. Rameshwari Jala. It is indeed a great honor for our college to have welcomed such prominent speakers known for their great contribution for this noble profession. And I also want to thank our moderator, Mr. Jayesh Jain, Mrs. Himali Prajapati, and Miss Selvina Mekwan. Thank you, ma'am. We have been fortunate to be assisted by our trustee, Dr. D.G. Chaudhary and Sri M.K. Chaudhary, and our director, Dr. B.K. Jain. You have been a constant supporting and given us a lot of encouragement. And I want also thank Dr. R.D. Shah, director of Gita Residency. I am really thankful to our principal ma'am, Mrs. Divya Jiji, for encouraging such program in our college and coming forward to helping these students. Ma'am, you are truly an inspirational personality for all of us. Thank you, ma'am. An event of this dimension cannot happen overnight. The wheels start rolling months in advance. We have been fortunate enough to be backed by the team of very motivated and dedicated committee. I also wish to acknowledge the devoted endeavors of organizing team and committee, teachers and other staff members. I would also like to thank all principal and faculty of other colleges who are present here and have taken time out for this event. The overwhelming participation of more than representative and colleges and university is in itself a great achievement and success. It also speaks volume about the zeal and enthusiasm of the participants to learn, share and disseminate learning. I am very much thankful to entire sponsor of this conference. Without their generous financial support, it won't be possible to organize the conference. And I would also like to thank our Jaiswal catering team to provide their best services. Without you guys, this event was not possible. Thank you very much again. Last but not the least, the backbone of the event, that is place at where we have organized event, that is auditorium. So I specifically thank Gujarat Institute of Disaster Management for providing auditorium. I thank you all the students for showing their interest and hard work in the program. I once again thanks to organizing team, committee member, our host, admin staff, photographer, and also non-teaching staff member who help us knowingly or unknowingly to make this event successful. If time is money, then today you have spent million for us. Thanks to all of you for making this event successful. Thank you so much.
Thank you, ma'am. As we reach the end of this remarkable journey, we stand here filled with gratitude and inspiration. We hope this conference has been an enriching and enlightening for you as it has been for me. We have witnessed the power of collective wisdom and the strength of unity in our pursuit of excellence in nursing.
Before we part ways, I encourage you all to stay connected and continue to exchange of ideas and experiences. Let us remain united as we work towards a healthier and more caring world. Once again, I extend my gratitude to each one of you for being a part of this extraordinary nursing conference. I wish you all safe travels and continued success in your noble endeavors. Thank you. And until we meet again. Thank you, all of you.
High tea is being provided for everybody. So please do have your tea and snacks and then you can leave to your home. So all the best. Thank you all for coming. I request all the students to wait for 5 more minutes.
Students, the certificates are ready. Do you want the certificates? Then have some patience. Sit down. Take your certificates and go. So, what is the plan?
Every college में faculty from one college will come. One person.
एक रिप्रेजेंटेटिव को बुला के दे दो जाओ लो जाओ
टीचर है तो टीचर को
कोई भी
नहीं है तो स्टूडेंट
आप बोल देना कॉलेज का नाम
कॉलेज में खाली नाम बोलो सर्टिफिकेट
ये कॉलेज का नाम क्या है
દરેક કોલેજમાંથી એક રિપ્રેઝેન્ટેટિવ આવશે અને સર્ટિફિકેટ કલેક્ટ કરશે ઓકે વન બાય વન ઓકે સ્ટાર્ટિંગ ફ્રોમ ઓકે જેના ફેકલ્ટી મેમ્બર્સ આવ્યા છે તો ફેકલ્ટી મેમ્બર આવે નહીં તો કોઈ સિનિયર સ્ટુડન્ટ યા કઈ બી ઓકે વિવેકાનંદ નર્સિંગ કોલેજ CHM શાહ નર્સિંગ કોલેજ ઓકે CM પટેલ નર્સિંગ કોલેજ
Hello. Excuse me. The names, the colleges names which are... can I have your attention, please? Thank you. The name of the college which are announced now, where the representative of that college or the student of that college, one student or one representative is requested to come forward and collect the certificates of your of the participants of that respective college. Please. First is Vivekanand College. CHM. CM. Apollo. Apollo Dehgam. अपोलो हो गया JG कॉलेज हाँ नाम खाली मुझे बता दो केडी केडी कॉलेज केडी कॉलेज शंकर सिंह वाघेला बापू कॉलेज, शंकर सिंह हो गया, संकल्प कॉलेज, संकल्प कॉलेज, पंचामृत कॉलेज, पंचामृत, श्रीजी बापा कॉलेज, पंचामृत, राधा कृष्ण नर्सिंग कॉलेज,
All those who are moving, please have high tea and go.
Who is this? This one is Radha Krishna. Swayambhu Nursing College, Swayambhu Nursing College, Sims Hospital, JMD GNM students, बीएससी का ऐसे ही ले लेंगे वापस ऐसे। बीएससी का एक स्टूडेंट आ जाओ, खाली ऐसे ही दे दो, है ही नहीं, खाली फोटो के लिए दे दो, नहीं है। अच्छा है ही नहीं, और मंगवाना पड़ेगा। मैंने बना नहीं है।
प्रॉब्लम हुई है, जो स्टाफ का आपने दिया है ना, वो स्टाफ आए नहीं है, उसकी तबीयत खराब हुई तो इसकी जगह पे मैं आई हूँ, तो मेरा नाम
तो आपने करेक्शन करवाया?
करेक्शन नहीं करवाया।